everyone. Ayurapta presents Rukshitha, a national seminar with paper and poster presentation. I invite everyone to the final day of presentation. And first of all, I would like to welcome our respected panel members. And once again, I invite all our dear participants. And now we can start the presentation. And before that, the presentation is 8 minutes. Kindly do follow the time period. And now I invite Dr. Sujitra Aravind Patil for the paper presentation. I invite Dr. Sujitra Aravind Patil.
Good evening, everyone. Am I audible, ma'am?
Yes, doctor, you are audible.
Ma'am, please can you share the screen?
Okay, doctor.
1 minute, doctor. Doctor, start the session, doctor.
Thank you, sir. Good evening, everyone. Myself, Dr. Suchita Arvinda Patil, second year PG scholar, Department of Kai Chikitsa. Today, my presentation topic is Grudrasi Chikitsa in view of Ayurveda, guided by Dr. Hiraman Varungase, Guide and Professor, Department of Kai Chikitsa from SMBT Ayurved College and Hospital, Dhamandgaon, Nashik. Abstract. According to Acharya Charak, Grudrasi is classified under 80 types of Nanatmaj Vat Vyadhi. Vat is the controller and regulator of body. The line of treatment in Grudrasi, as expounded in Ayurvedic literature, is Snehan, Svedan, Vaman, Virechan, Basti, Siraved, Agnikarma. Among all this Panchakarma, Basti is considered as prime treatment to all Vat Vyadhi and it is described as Ardha Chikitsa. In this review article, we have to discuss some Ayurvedic Chikitsa which are used for management of Grudrasi. Keywords: Grudrasi, Ayurvedic Chikitsa, Nanatmaj Vat Vyadhi. Introduction. As the advancement of busy, professional and social life-changing lifestyle of modern human being has created several disharmonies in the biological system. The epidemiological factors found to influence incidence of Grudrasi, including increasing height, age, genetic predisposition, walking, jogging, and particular physical occupation, including driving, improper sitting posture in offices, factories, continuous and overexertion, jerking movements during traveling and sports, lifting of heavy weights. All these factors leads to undue pressure to the spinal cord and play an important role in producing low backache and sciatica. In Ayurveda, having promising results of sciatica, Grudrasi management. Definition. The word Grudrasi itself suggests the gait of the patient which is similar to Gridra, that is vulture, due to pain. Grudrasi is defined as stamba, stiffness, rukka, pain, toda, pricking pain in a radiating manner along with spandan, tingling sensation starting from Kati Pradesh, low back to Prushta, back, Janu, knee joints, Jangha, calf muscles and pada, dorsolateral aspect of foot of either one side of the lower limb or may involve both lower limbs. This condition makes rising of the affected leg difficult. Types. There are two clinical presentations, that is Keval Vata and Kapha Vata. Association of Kapha produces additional symptoms like Tandra, drowsiness, Gaurav, heaviness, and Arochak, that is loss of taste. Aims and objectives. To study the role of Ayurvedic Chikitsa in Gridrasi, to study various types of Ayurvedic treatment described in Gridrasi. Materials and methods. References are collected from Bruhatraya and Laghutraya and various textbooks. Ayurvedic literatures are used in this study. In Ayurvedic texts, various types of treatment are described for Gridrasi, that is Nidan Parivarjan, Snehan, Svedan, Vaman, Virechan, Vastikarma, Raktamokshan, Agnikarma, Shaman, Chikitsa. Chikitsa, the first and foremost principle to be adopted in the treatment of each and every disease is to avoid the Nidan of the disease, that is Nidan Parivarjan. Secondly, the intensity of the dosha prakop should be considered before deciding the line of treatment. If the dosh prakop is minimum, Langan Chikitsa is given. If the intensity of dosh prakop is moderate, then Langan and Pachan Chikitsa should be given. If, however, dosh prakop is maximum, Shodhan treatment should be decided. Snehan. Snehan is a process which gives snigdhata to the body. It can be done in two ways, that is internally and externally. Snehan elevates Rukshitha, gives laghuta and snigdhata to the body. As Grudrasi is a Vat Vyadhi, Snehan helps to elevate Vata, also helps to improper blood circulation and stimulate nerve endings. Svedan. Shul and Stamba in the lower extremities are the cardinal symptoms of Gridrasi and is best treated by the Svedan Chikitsa. Svedan helps in the liquefying of the dosha, thereby clearing the strotas or else rectifying the Marga Avran. Among the different forms of Svedan procedures, Avgaha Sveda, Pitchil, Nadi Sved, Patrapinda Sved, Pinda Sved, and Upnaha Sved may be essentially performed in patients of Grudrasi, but in Vata Kafach Grudrasi, Valuka Sved is a better option for evident results. Vaman. After Snehan and Svedan, Shodhan is indicated in Gridrasi. The authors like Chakrapani and Bhav Mishra opinion that without Shodhan of body, Basti Chikitsa will not give desired effect in the patients of Grudrasi. Shodhan in the form of Vaman is advised in patients suffering from Grudrasi and is specially preferred in Vata Kafach Grudrasi for evident reasons. Next slides, please, sir. Virechan. Virechan having an important role in Gridrasi. The action of Virechan is not only limited to particular site, it has effects on the whole body. In Vat Vyadhi, most of the authors mentioned Mridu Virechan. Oral administration of Eranda Sneha along with milk is ideal for the Virechan purpose. This helps in both Vata Anuloman as well as smooth excretion of mala. The Sneha Virechan clears obstruction in the strotas and relieves Vata vitiation very quickly. Thus, a Sneha Virechan of Mrudu nature helps in controlling shul in Grudrasi. Basti. Pakvashay is the primary location of Vata dosh. Vyan Vat is vitiated in Grudrasi. So, Basti is very helpful in pacifying Vata. Further, it is glorified that Basti Chikitsa as Ardha Chikitsa or Purna Chikitsa of Vat. By this facts, Basti is most important among the Panchakarma in the treatment of Gridrasi. No other Chikitsa has the capacity to pacify and regulate the force of Vat apart from Basti. Any type of Basti can be adopted, but initially one should purify the body by Shodhan Karma to get the desired effect. Example, Niruha Basti like Eranda Muladi Niruha and Dashmuladi Niruha are the best choices. Anuvasan Basti using Vatahar Telas like Balatel, Shir Balatel, Prasarini Tel, etc. are beneficial. Siraved. Charak explained Siraved as the site at the site of Antarkandara Gulfa. Acharya Sushrut and Vagbhat also indicated Siraved at 4 angul above and 4 angul below at the site of knee joint. Raktamokshan. It is a general rule that when the regular treatment with Shadbit Upakram fails to give any relief in any disease, one should consider the involvement of Rakta Dhatu in the pathogenesis and is best treated by Raktamokshan. As the disease Gridrasi is characterized by affliction of Rakta along with Vata in Dalhan Tika, it is said that if the disease is not get cured by other chikitsa upakram, then only Siravet should be done by considering Raktadushti. Agnikarma. Various acharyas mentioned Agnikarma in the management of Gridrasi. According to Sushrut and Vagbhat, in the management of Sira, Snayu, Asti, and Sandhigat Vyadhi. Agnikarma for the treatment of Gridrasi, different sites for Agnikarma are as mentioned according to Acharya Charak, Antarkandara, Gulfa, according to Chakradatta, Pada Kanishtika, Anguli, little that is little toe of the affected leg. Shastrakarma. Chakradatta has given the treatment of Gridrasi in detail. He has mentioned a small operation prior Snehan and Swedan to remove Granthi in Gridrasi and also Siravet 4 angul below Indrabasti Marma. Shaman Chikitsa. Different Churna, Kalka, Lepa, Kashay, Arishta, Grit, Tela, Gugul, Rasa and Yog are mentioned in different classics. Example, Churna, Ajmodadi Churna, Abhayadi Churna, Rasnadi Churna can be used. Kalka and Lep, Mahanimba Kalka, Rason Kalka, Vatahar Pradeha, Kashay and Arishta. Sir, please previous slide. Kashay and Arishta, Maharasnadi Kashay, Dashmuladi Kashay, Bala Arishta and Dashmul Arishta can be used. Grit and Tel, Bala Tel, Eranda Tel, Vishwagarbha Tel, Prasarani Tel and Narayan Tel can be used. Gugul, Yograj Gugul, Tripala Gugul, Trayodashanga Gugul, Rasna Gugul, Mahayograj Gugul, etc. medicines can be used. According to the condition of patient, we can use these medicines. Pathya. Pathya is a major pillar supporting the line of treatment of any disease. Ahar, Annavarga, that is Kulatta, Masha, Kodhu, Raktashali, Navin Tira, Puran, Shalyodan, Falavarga, Amla, Rasayukta Fala, Dadim, Draksha, Jambir, Badar, Shakavarga, Patol, Shigru, Rason, Dugdavarga, Sheer, Grit, Navnit, Drava Varga, Maunsaras, Mugdayush, Dhanyaka Amla, Tela Varga, Til Tel, Sharshak Tel, Eranda Tel, Anyavarga, Tambul, Ela, Pushtam. Vihar, Supushna Parishet, Nirvata Sthana, Samvahan, Avgaha, Abhyanga, Brahmacharya, Ushna Prauran, Agni Atap Sevan, and Snigdha Ushna Lep. Apatya, those ahar and vihar which have adverse effects on the body are called as apatya. Ahar, that is talai, chanak, kankuni, kodra, shamak, nivara, nishpava, rajamasha, karir, jambu, trinak, tinduk, शुष्क मांस, दूषित जल, विहान, वेग विदारण, व्यवाय, व्यायाम, वमन, रक्तमोक्षण, प्रजागरण, दिवास्वाप, अति गज, अश्व, उष्ट्रयान सेवन. Discussion. Ayurvedic approach of treatment is much better. Nidan Parivarjan, Shodhan Chikitsa, that is Snehan, Svedan, Vaman, Virechan, Basti, Raktamokshan, etc. and Shaman Chikitsa are main route of treatment for any disease. Shodhan may be recommended for Bahu dosh, but Shaman is also essential for removing the remained doshas after Shodhan process. Conclusion. Gridrasi is a painful condition and so far there is no established therapy. Abhyanga with medicated oil followed by Swedan may be used as first line of treatment for Gridrasi. Agnikarma and Raktamokshan may be useful in several painful conditions and in chronic degenerative condition. Basti therapy may be better choice for the management of Gridrasi. Nidan Parivarjan may stop the further progression of disease. It may be concluded that various treatments present in Ayurveda vary according to condition of disease. These are some references from which the matter is collected. Thank you.
Thank you, doctor.
Thank you,
Next.
doctor.
Thank you.
So next I invite Dr. Divyasri ji. I invite
evening,
Dr.
ma'am.
Divyasri.
Good evening, ma'am.
Good evening, doctor.
Am I audible?
Yes, doctor. Audible, doctor.
Yes, ma'am. Can you please share the screen?
Okay, 1 minute, doctor. Hello, Dr. Divishri.
Yes. Hello.
Doctor,
Yes.
please chat the session, doctor.
Thank you. Good evening, everyone. I am Divishri, first year PG scholar from Department of Prasuti Tantra and Stri Roga. My topic is management of PCOS in Ayurvedic perspective. Introduction. PCOS means polycystic ovarian syndrome. It was first described in 1935 by Stein and Leventhal. It is a heterogeneous disorder characterized by amenorrhea, hirsutism, obesity, and associated with enlarged polycystic ovaries. It is the most common endocrine disorder of women of reproductive age group. Recent study revealed that about 22.5% of women in India suffer from this condition, which is one of the causes for infertility. Etiology. According to modern science, uncertain hypothalamic pituitary gonadal disturbance, abnormal ovarian steroidogenesis, genetic and affected families, stress, sedentary lifestyle, improper diet, and lack of workout. Pathophysiology, not clearly understood, but we can discuss under following headings. Abnormality of HPO axis, hyperinsulinemia arising from receptor dysfunction, hyperandrogenemia, and genetic inheritance. Then clinical features, menstrual irregularities, anovulation, hirsutism, acne, obesity, acanthasis nigricans, and ARN syndrome. Then investigations. In investigations, elevated LH, ratio of LH and FSH is 3:1, elevated estrogen, raised testosterone, elevated DHEAS, raised fasting glucose, and raised total cholesterol that is greater than 200 mg per dl. Prolactin needs repetition if greater than 150 mg per dl, and diagnostic tests like USG scanning and laparoscopy. Then Ayurvedic consideration, PCOS though a syndrome cannot be correlated to a particular disease. An exact correlation is not available in Ayurveda. No specific univapid with above said feature is noted. Conditions like Vantya, Arajaska, Nashtartava, Artavakshaya, and Pushpagni Jatarini to some extent can be related. According to Acharya Shushruta, the four essential factors for consumption are similar as the germination of a seed. First, Rutu, fertile period, is explained by Acharya Dallana that Rutu means Rajaha Kala, that is ovulation period. Deposition of the spermatozoa in upper vagina should be in appropriate time of the female cycle. Then Kshetra, anatomically and physiologically adequate reproductive organs. Vagina must be healthy. Cervix and its secretion are also permitted to pass spermatozoa. The oviduct must be potent and sufficient ciliary movement is present. The uterus must be capable of supporting implantation and fetal growth throughout pregnancy. Then Ambu, proper nourishment to the body, adequate hormonal level, and proper nutrition is required for genital organs. Then Bija, the adequate ovum and spermatozoa and the female ovulatory mechanism must be normal. The male must produce an adequate number of normal spermatozoa. So in concept of PCOS, adequate bija is not available. The some Ayurvedic pathophysiologies of PCOS are Artava Dushti. Acharyas have mentioned that Ashtartava Dushti, if remains untreated or not properly treated, then it causes abhijata, that is unable for prajotpadana. Acharyas have not described any specific etiology of these 8 menstrual disorder. Vata get aggravated and causes dhatu kshaya. Because of this dhatu kshaya, rasa dhatu decreases and that ultimately causes the kshaya of its upadhatu, that is artava kshaya. Then avarana, in the concept of artava nasha, Shushruta and Vagbhat has described that both vata and kapha, when aggravated, obstruct the path, thus artava is destroyed. Here artava can be taken as antaha pushpa, here we can taken as anovulation. The artavaha srotas is obstructed by the kapha and vata, due to which artava is not visible. It is also a sangha pradhana vikara. Then asrup dosha, word asruk refers to ovum and menstrual blood. Abnormalities of ovum and ovarian hormones produces infertility. Then dietetic habit. Beside all these reasons, dietetic habits also causes anovulation, as mentioned in Kashyapa Samhita Kalpasthana. Due to Ati Ushna Virya Annapana, Artava and Bija becomes Upachita, vitiated. Ayurvedic perspective, PCOS is basically a disease of Artavaha Srotas. Avarana is the main pathogenesis in PCOS. Kapha Medha related doshas, dosha Samurchana is seen here. Staulya Samprapti and Kaphaja Prameha Sampraptis are the key areas to be explored. In PCOS, Kapha dominant granthis are seen in ovary. Granthis developed when there is a Sangha in Srotas due to Snigdha and Guruguna of Kapha. These granthis with strong kapha platform inhibits the artava, leading to artava rodha. Samprapti dosha, kapha, dushya, rasa, rakta and medha dhatu, srotas, rasa, rakta, artavaha and medhavaha srotas, srota dushti, sangha, agni, manda at kosta and dhatu level. PCOS can be correlated with kaphaja prameha, staulya, medha avruta vata, kapha avruta vata and kaphaja granthi. Treatment protocol, Deepana Pachana, Staulya Chikitsa, Datvagni Deepana, and Kapha Medha Dushti Chikitsa. Role of Panchakarma in PCOS, Vamana for Kapha Chedana and Avarana Chikitsa, Virechana for Kapha Pitta Nissarana and Vatanulomana. For Virechana, we can use Eranda Thaila and Trivrit Leha. Then Basti, for minimizing the Kapha related granthis in ovary, Eranda Muladi Shodhana Basti, Lekana Basti, and Uttara Basti with Falagruta, Kasisadi Taila, Sahacharadi Taila, and Bala Taila. Then Bahir Paniparjana Chikitsa, Udgarshana, Kapha Medha Shamana by Kola Kulatyadi Churna, Avagaha Sveda for Pakvashaya Gata Vata Shamana, Shirodhara and Shiropichu can be advised as per patient's Prakruti. Then Shamana Chikitsa, Lashuna Erandadi Kashaya, it is useful for reduction in circulating androgens. Sukumara Kashaya corrects the Apana Vaigunya and acts on Pakvashaya. Varunadi Kashaya removes the Avarana and useful in insulin resistance. Raja Pravartini Vati for Artava Pravrutti. Then Kanchanara Gugulu indicates in Granthi. Kuberaksha Vati is also for indicated in Granthi. Falagruta corrects the hormonal imbalance and regularizes the Artava. Then conclusion, it is inaccurate to state that PCOS is the most common cause of anovulation because PCOS does not cause anovulation. Rather, PCOS is the consequence of chronic anovulation which can result from a wide variety of causes. PCOS is a condition involving disorder of ovary associated with dearranged metabolism of lipids and carbohydrates and multiple hormonal involvement. Researchers are required for understanding the correct pathophysiology of PCOS in Ayurveda causing infertility. By proper investigation, diagnosis, and management, we can fight against the PCOS and can bring a new glow to women's life. And extensive studies is needed. Thank you.
Thank you, doctor. And post presentation is pending, doctor. I will share the screen for you, doctor.
Okay.
Doctor, please start, doctor.
Thank you. Role of yoga in PCOS, guided by Dr. Vidya Ballal ma'am. Yoga is a form of holistic medicine that was developed thousands of years ago. Yoga helps unite the mind, body, and spirit. It helps to create a balance, strength, flexibility, along with mindfulness. Women with PCOS are encouraged to engage in exercise on a daily basis as it helps manage and balance hormones along with insulin and blood sugar levels. However, in recent times, it has been proven that yoga not only helps in maintain physical health, but also aids in mental well-being by reducing anxiety, regulating hormones, menstrual cycle, and metabolic parameters. Surya Namaskara, which helps for weight loss, waist and hip fat shedding, and menstrual cycle regulation. Second one is Bhujangasana. Bhujangasana stimulates the functions of ovary. It also helps in better digestion and relieves the stress. Then Naukasana, it is a noun to control the thyroid function. Then Setubandha Sarvangasana, which regulates the thyroid function, which is crucially linked to PCOS. Then Kapalabhati Pranayama, which reduces the oxidative stress, improving the blood circulation in the body and balancing glandular output. It aids weight reduction by influencing the pancreas. Shavasana helps to de-stress, stress being one of the primary cause of PCOS. Calm mind and keep cortisol levels in balance. Then Suptabadha Konasana, which helps to calming the mind, body, and spirit while opening up the pelvic region. Conclusion, several studies and researchers have proven that yoga cannot cure PCOS, but it is creative way of managing PCOS symptoms. Performing yoga asanas for PCOD every day may lower the testosterone level in the female body, activate de-stressing hormones, and relax body. Be a useful method for reducing anxiety, helps in improving blood circulation and balancing the blood sugar levels, and can also minimize the need for tablets and medicine to regulate hormones. Follow the above mentioned yoga poses for PCOD to aid towards a healthy lifestyle. Thank you.
Thank you, doctor.
Next, I invite Dr. Srinivasa NV.
Thank you, ma'am. Am I audible, ma'am?
Yes, doctor, audible, doctor. Please share the screen, doctor.
Okay.
The screen is visible, doctor. Please start.
Okay, sir. Thank you, sir. Good evening, everyone. Myself, Dr. Srinivas NV, second year PG scholar from Department of Shalya Tantra, and I am going to present a topic on Buddha Brahmsha. So, anatomy. Buddha is one among 15 Poshtangas of the body, and there are two parts of Buddha, Uttara Buddha and Adha Buddha. The entire length of Buddha is mentioned 4.5 angula, and there are three valleys from proximal to distal, that is Pravahini, Visarjani, and Sambharini. The shape of Buddha is Shankavartaniba, and color of Buddha is Gajatalu, that is palette of elephant. So Buddha Brahmsha, so that is rectal prolapse. The causes are Pravahana, that is straining, and Atisara, that is loose stools. So it is more seen in Ruksha and Durbala. So Vagbhata mentioned Buddha Nisarana for Buddha Brahmsha. In Siddhisthana, Charaka also stated that it is a complication of Virechana Ati Yoga. Dosha and Dusha involved in Buddha Brahmsha. Dosha, Vata, and Dusha, Mamsa. Shushruta mentioned Mandangni is the main reason for Buddha Brahmsha. Chikisa. So with the help of Nehana and Svedana, the prolapsed portion of Buddha is slowly replaced. In irreducible prolapse, Svedana should be given frequently. Avagaha Sveda with Vatahara Kashaya like Dashamula Vata should be given. Mushika Taila has a special reference in Buddha Brahmsha, usage Pana and Abhyanga and Tichudharana. Some of the oral medications are Changeri Guta, Chavyadi Guta, Vachasadi Tasneha, Bilva Kalka Sadita Sneha, Dashamula Kwalta, and Anvasana Basti, Vatahara, Vihara, Ahara and Vihara. So Bandha, Gofana Bandha with a hole at the center for expulsion of Vayu is applied. Ksharakharma. So some of the in BHU and Jaipur, they performed Ksharakharma in rectal prolapse and they seen good results. And Kshara Sutra, so it is like modified Tairish technique. Instead of the silk thread, they have used Kshara Sutra, and the 50% of the people has seen some of the complications like inflammation, recurrence, and burning pain. Pichudharana. So Pichu by Mushika Taila can be given, as I mentioned earlier. Rectal prolapse. Incidence. Overall incidences are 4.2 per thousand population, and it is more commonly seen in females than male. So the male and female ratio is 1:6. And pediatric patients, when younger than, it is more commonly seen below 3 years. So history and symptoms, usually the patient presents with something coming down and soiling of underwear, fecal incontinence, constipation. So if the prolapse remains prolapsed, breast and mucus ulceration and strangulation of the prolapse can be seen. Types of prolapse: partial prolapse and complete prolapse. So partial prolapse, when only mucosa and submucosa of the rectum, come out through the anus, it is called partial prolapse. So the causes in infants due to agencies of sacrum or diminished tone of the anal musculature are the main causes. In children, faulty bowel habit, straining, diarrhea, whooping cough, etc. So general etiology. So due to chronic cough, or else due to stricture of urethra, there will be increased intra-abdominal pressure. So this is the main cause for prolapse. And due to less ischiorectal fossa fat, or due to neurological causes, or due to weakening of supporting tissue and levator ani-mesal, or atony of sphincters, or increased abdominal pressure, intra-abdominal pressure are some of the causes for rectal prolapse. Complete prolapse, when the rectum comes out through the anus and the protrusion consists all three layers of the rectal wall. It is a descending sliding hernia, contains a pouch of peritoneum anteriorly between the walls. So on local examination, so it is pink in color, circumferential, ulcerated. On PR, there will be laxative sphincter. Anteriorly, peritoneum sac comes down as a pouch which may contain small bowel. Differential diagnosis. So partial prolapse and complete prolapse. So usually partial prolapse consists radial folds. Length is below 3.5 centimeter. On palpation, it will be evident that it is composed of two layers of mucous membrane with submucosa in between. In complete prolapse, we can see circumferential folds and length it is more than 3.5 centimeter. If palpated between a finger and the thumb, double thickness of the entire valve can be seen. Differential diagnosis: prolapsing rectal prolapse, prolapsed internal hemorrhoids. So piles are not circumferential and their hemorrhoids are usually blue in color, but prolapse it is circumferential and pulum are pink in color. Investigations: anal monometry, diphography, endoanal ultrasound, and colonoscopy can be done. Mode of treatment: so the main treatment, control of prolapse, prevent recurrence, and prevent constipation. So non-surgical treatment: adhesive stopping of buttocks, constipation treatment, treatment of malnutrition, perianal exercises, and digital repositioning, and submucosal injection of 5% of phenol in almond oil. It is done after digital repositioning. Acute irreducible prolapse. So reduction under anesthesia, tapping the buttocks together, Trendelenburg prolapse position. If the prolapsed rectum is not viable, then resection should be done. Surgical treatment. So surgical treatment involves resection and fixation operations and abdominal. In surgery, it may be abdominal approach or perineal approach. Thyris operation. So it is done in partial prolapse. In this, a thick silk suture is applied all around the anus after reducing the prolapse. Goodsell's operation. Prolapsed mucosa is ligated at different positions using non-absorbable suture material, and excision of prolapsed mucosa done at its base, usually done for one side in 3 positions as shown in the figure. Delamor's operation. So it is through perineal approach. It is done for complete prolapse. If the collapsed rectum is pulled as far as possible, mucosa of the collapsed rectum is excised and muscular layer is plicated with vicryl and mucosa is sutured to the anal margin. And Altme's procedure, it is nothing but rectosigmoidectomy. The rectum and part of the sigmoid colon is excised and anastomosis of part of sigmoid to the anal canal is done. Anterior resection of the rectum just above the anterior peritoneal reflection is resected. The anastomosis must be done without tension. And Evolon sponge wrap operation, it is also called Wells operation. It is through abdominal approach. Laparotomy is done and the rectum and sigmoid is sutured to the posterior side of the sacrum. The sponge is sutured posteriorly and laterally to the walls of the rectum. The dense fibrotic reaction occurs, resulting in the fixation of rectum to the sponge. Some of the complications will be present in this procedure: infection, fistula formation, or constipation. And rectal sling operation or Revstein method. After laparotomy, the rectosigmoid junction is sutured to the sacrum by using Teflon sling below the sacral promontory. The complication may be constipation. So usually due to rectosigmoid angulation and meshed rectopexy, it is instead of that polyvinyl sponge, a mesh can be kept behind the rectum and it is sutured to the sacrum. Loher's operation, the whole rectum and lower sigmoid colon are mobilized and sutured within the rectal sheath. So the procedures and the recurrences. Delmor's, the recurrences will be 0 to 38%. Altmere's, it is 16%. Posterior suture rectopexy 9%. Mesh posterior rectopexy 6%. And resection rectopexy 5%. So which way is the best way? Either perineal, abdominal, or open or laparoscopic. So it is based on overall medical condition and choice of procedure depends on age, sex, operative risk, pelvic floor defect, degree of incontinence, and history of constipation. Complications of surgery: injury to hypogastric nerve causing impotence, bladder dysfunction, bleeding from sacral venous plexus, injury to rectum and colon causing fecal fistula. Constipation after rectopexy is a known complication, and improper correction of continence occurs in 50% cases. Summary: it may be mucosal or full thickness. So in children, the prolapse usually mucosal and it should be treated conservatively. In adult, the prolapse is often full thickness and it is frequently associated with incontinence. Surgery is necessary for full thickness rectal prolapse. The operation is performed either via perineum or abdomen. Budabramsha is described in Ayurvedic literature and it is regarded as Krucha Sadhya, yet various treatment modalities like Bandha, Sharakarma are explained, which may be easily adoptable. Thank you.
Thank you, Doctor.
So next I invite Dr. Vikas Bharat.
Hello.
I invite Dr. Vikas.
Am I
Hello,
audible,
doctor.
ma'am?
You are audible. Yes, doctor.
Very good evening to one and all. Myself, Dr. Vikas. I am second year physics scholar, Shailatendra department. Hello.
You are audible, doctor. Please continue.
Okay, ma'am.
Your screen
Hello.
is visible, doctor.
Yes,
Please start.
yes, sir. I am dealing with the topic Bhagna Chikitsa. Contents are introduction, Nirukti and Utpatti, etymology and definition of the fracture, Nidana of the Bhagna according to Ayurveda and according to modern science, and Lakshana of the Kanda Bhagna, and the signs and symptoms of the fractures, classification of Bhagna, and complications of the fractures, and Bhagna Chikitsa and discussion and conclusion. Introduction is Bhagna is defined as the Bhajyate, Amajyate, Vishleshate iti Bhagna. The one which is having the discontinuity in the bone is known as the Bhagna. And Kanda Bhagna is in the discontinuity of the shaft of the bone is known as the Kanda Bhagna. And the clinical feature of the fracture, such as the pain, loss of the function, and deformity or swelling, are very much similar to the Lakshanas of the Kanda Bhagna, such as Shopa, Vedana Pradurbhava, and Sastangata. Nirukti and Utpatti. Nirukti is Asti Vishlesho Atraha Bhange Abhipretah. The one is having the discontinuity of the bone is the Bhagna. And Utpatti is the word derived from the Bandhat and Ta Pratyaya, meaning to break. Etymology. According to modern science, the Bhagna is defined as the complete or incomplete break in the bone is known as the fracture. And Nidana of the Bhagna according to Ayurveda, Patana, Pidana, Prahara, Akshepana, and Vala Mugadashana, and Balavat Vigraha. Patana is having the fall from the height, and Pidana is any violent pressure or the compression fracture pressure. Prahara is the one which is a strong blow from the blunt instruments, and Akshepana is violent jerks or a sudden or a severe contraction of the muscles. Vala Mugadashana, bites or nail injuries and attack from the wild animals. Balavat Vigraha is a strong blow from the heavy things. Etymology according to modern science, the large and the sudden force on the bone, chronic and repetitive force on the bone, and decreased and natural resistance of the bone. Lakshanas of the Kanda Bhagna. Shvetu Bahula, one is having the diffuse swelling, Spandana, throbbing or a pulsatile feeling, Vivartana, displacement of the fractured fragment, Sparsha Seshtutva is known as the tenderness. Avapidamane Shabda, cryptus elicited on the palpation. Sastangta is flaccidity of the muscles. Vividha Vedana Pradurbhava, different types of the pain. Sarva Avasthas na Sharmalavaha, unable to get the comfort in any position. Clinical signs and symptoms of the fracture according to modern science are pain, which is a patient having the severe pain, which is having the mild, moderate, or severe pain, and the tenderness. The patient is not unable to touch that fractured site. That much tenderness will be there, and swelling is occurred due to the tissue injuries, and deformity. When the fracture segments are get displaced, then deformity will be occur. And an abnormal mobility between the fractured fragments is a sure sign of the fracture. When patient having the complete fracture, then patient feel the abnormal mobility in the any fractured site or joints. Inability to use the affected part in another frequent complaint. In the open fractures, protruding bone is from the outside from the skin, which is having the wound will be there over the fractured site. Bleeding and bruising and limping are also involved in the fracture. Classification of the Bhagna, and they are classified into the Sandhimukta and Kanda Bhagna. And first we have to explain with the Kanda Bhagna. First one is Karkataka. Visheshastu Sammuda Ubayo Asti Madhye Bhagna Granthir Unnatam Karkatam. The fractured shape will be crab-like shape. So it is a Karkataka. And Ashwakarana. Ashwakarana Udgatam Ashwakaranakam. The fractured says fractured part will appear as like a horse of the air, and it is elevated and displaced. Next is Churnitam. Sprushyamanam Shabdava Churnitam Avagachyate. The bone breaks into a multiple fragments and not able to regain normal shape. And the greater injury to the soft structures. This fracture can be easily detected by the palpation due to the presence of the crepitus throughout the line of the fracture. Next one is Pichitam. Pichitam Prututam Gatam Analpashopam. The fracture site will be crushed and comparatively swelling is lesser. Asti Chellitam. Pashorasti Hinodgamam Asti Chellitam. Here the fracture is confined to any one surface of the bone, that is medial, lateral or anterior posterior side. And this is after the site of the injury due to the muscle contraction. Next one is Kandavagnal. Vellite Prakampanam Kandavagnam. The term Kandavagna is specially used for the fracture of the shaft of the bone. An attempted movement produces the tremors. There will be displacement of the fractured fragments. Here the more will be shaft of the bones will be involved. Majjanugata. Astavo Asti Madhyam Anupraveshistam Majjanumam iti Majjanugatam. The fractured of the fragment of the broken bone or the impacted in the marrow cavity of the other fragment, and this is result due to the force of the violence. This variety of fracture is commonly seen in the humerus and the femur. It is a fracture of the old age, and this type of fracture is difficult to diagnose clinically because the signs and symptoms like a rotational deformity, crepitus, etc. are absent due to the impaction. Atipatita. Astihi Nisheshitam Chinnatam Atipatitam. It is a complete fracture in which the fragments are completely separated and the separated fragments are hangs are angulates. Vakraha. Avugnam Avimuktasti Vakram. It is the incomplete variety of fracture. This type of fracture is seen only in the children. There will be visual deformity. Chinnaha. Anyatha Parshvavasishtha Chinnam. A fracture in which one of the cortex of the bone remains patent, and this is also an incomplete variety of the fracture. This is no visible deformity in the fracture. Patitam. Patitam Anubhavidaratam Vedanacha. A fracture in which the bone is partially fractured and cracked into the multiple fissures, resulting in severe pain in the affected part. Sputitam. Shukapurnam Avidmatam Vipulam Visputitam Sputitam itihi. Here the fractured part is swollen and there will be pricking pain due to the sharp points of the bristles. Hence the bagna is of a crack type, mostly occurs in the small bones, for example teeth. The next one classification is Sandhi Mukta Bagna Lakshana. First one is Utpishta. Utpishta Sandhyavabhutah Shofo Vedana Pradurbhavo Visheshatascha Nana Prakahara Vedana Ratro Pradurbhavati. Next one is Vislishta. Vislishta Alpa Shopa Vedana Satyatam Sandhi Vikriyacha. Next one is Vivartita. Vivartita tu Sandhi Parshva Upagmanad Vishamangata Vedanacha. Avikshipta. Avikshipta Sandhi Vishlesha Tivra Rujatvam cha. Next one is Atikshipta. Atikshiptam Dvayo Sandhyo Stananati Atikrantaha Vedanacha. Next one is Tirakshipta. Tirakshipta is स्व एकः अस्ति पार्श्व उपगमनात् दत्यर्थं वेदनः च इति. Next fracture classification again to modern science are according to the plane of fracture. They are divided into the plane of fracture according to the cause, number, and based on the extent of the fracture line and the clinical manifestations. First one is plane of fracture. First one is transverse. When the fracture surface is perpendicular to the long axis of the bone, is a transverse fracture. And a spiral. When the fracture surface is spiral and is usually caused by the torsional stress. Next one is the oblique. When the fracture surface forms an angle with the long axis of the shaft. Next one is comminuted. When the fractures are more than two fragments, then it is the comminuted fracture. Next one is compression fracture. Result from the compression force. This leads to the compression of the bone trabecula, resulting in the decreased length or width of the portion of the bone. For example, compression wedge fracture thoracic spine. According to the cause, first one is traumatic, pathological, and stress. Traumatic due to the any trauma occurs on the fractured site, which leads to the fracture. And there are three types: direct violence, indirect violence, and another one is the muscular. Next one is pathological. Any diseases related to the bones which leads to the fracture. So, for example, is tumor or infection or any bone disease like osteomyelitis or osteoporosis. Next one is stress fracture. When the fracture occurs due to the repeated stress and due to this osteoclastic resorption takes place followed by the periosteal callus formation. In case of such fracture, the site of the fracture becomes painful and tender, and treatment is electroplast bandaging and rest till the pain and tenderness will be disappear. According to the number, and it is single and multiple. A single fracture occurs when the bone is broken at only one place, and multiple occurs at the different bones. Based on the extent of the fracture, incomplete, green stick fracture, and buccal fracture. Incomplete is in this type of fracture is it does not involve the whole breadth of the shaft, and the portion remains intact. Green stick fracture is the bones in the children are so elastic, so when the one cortex is fractured, other remains intact. Next one is buccal fracture, fracture in which one cortex is intact with the buckling or compaction while other cortex is fractured. Complete fracture. Complete is having the two types, impacted and non-impacted. When the fragments are get impacted into the another fractured site, either straight or angular. In case of non-impacted, the fracture fragments remains separate. Non-impacted fractures are displaced and undisplaced. When the fractured fragments are not fractured not in a line, and they are get displaced. When the fracture fragments are in the only one line without angulation or displacement. Based on the clinical which the fracture surface does not communicate with the exterior through the skin or mucous membrane, which there is a communicated gap between the fracture
Excuse me,
and the
doctor.
exterior.
Excuse me, doctor.
Hello? Hi. Yes, madam.
Doctor, you are exceeding your time.
Okay, okay. I will complete now. Next, special examinations are X-ray and X-ray examination. Diagnosis will be history of trauma and localization, swelling, and crepitus and X-ray will be there. And approach to the patient is first aid. In case of first aid, stop the bleeding and immobilize the injured area, and application of the ice pack. Fracture management, reduction, retention, and rehabilitation. In case of retention, the conservative is draping and sling and traction. Plaster Paris will be applied, and operative is internal and external fixation. Rehabilitation, in case of rehabilitation, elevation, exercise, and physiotherapy can be advised. Healing of the fractures are in case of 5 stages, there hematoma formation, cellular formation, callus, and new bone formation and remodeling. In Ayurvedic literature explained Anchana, Pidana, and Sankshepana. Anchana is like a traction. Pidana is by pressure we have to maintain the surface, and Sakshepana is the fractured alignment is applied, and Bandhana to support and to stop the bleeding, the bandhana will be applied. And bandhana is in Saumya Ritu, once in 7 days we have to change that bandaging, and Grishma Ritu once in 3 days, and Samshita Ritu is once in 5 days. And concepts of physiotherapy is explained: Mrutpinda, Lavanapinda, and Pashanapinda. With help of these three things, we have to do the rehabilitation like in Ayurvedic concept. And dietary explained in Lavana Katuka and Ksharamla, Maithuna Atapa, and Vayama, and Rukshana 7 is contraindicated. Shali Mamsarasa, Kshira, Sarpiyusha, and Brahmanarasa can be advised. And Vistasira is mainly indicated in the fracture. Proper union will be without pain or any discomfort. If a patient moves the fractured site, it indicates the proper union of the fracture. Discussion: the principles laid down in the Ayurveda is regard the Bhagna Chikitsa are universal and it's still in practice. Irrespective of the system of the medicine, the general management of any fracture is elevated fracture, and by pulling in case of the being pushed aside, and by reinstating in the upward and position in the conclusion. However, there is certain principle behind every line of management. If correctly laid down, would be universal and remain unchanged whatever be the means they adopt them. The present day medical science has also accepted most of the principles of the Bhagna Chikitsa described in the Ayurvedic classics. Objectives described in the classics include approximation of the fractured fragments, realignment of the fractured ends without any angulations as far as possible, and full length of the limb or injured plot is obtained. Facilitated injured bone will be healed or net. Thank you.
Thank you, doctor.
Thank you, doctor.
Thank you. Thank you, ma'am.
So next I invite Dr. Rashmi Suresh Nawale.
I invite Dr. Rashmi Suresh.
Yes, ma'am. Am I audible,
Yes,
ma'am?
doctor, you're audible.
My screen is visible, ma'am.
No, doctor, not visible,
No,
doctor.
doctor, it's not visible.
Can you share my screen, please, sir?
1 minute, doctor. I will share for you. Doctor, please start the session, doctor.
Hello, everyone. Myself, Dr. Rashmi Novin, PG Scholar Second Year Kai Chikitsa Department, guided by Dr. Abhishek Gaikwad, Reader of Kai Chikitsa Department at Ashwin Rural Ayurved College, Manchegiri, Sangamner. And my topic of presentation is role of Dincharya in healthy living Ayurvedic review. Abstract. As we know, there is an increased number of deaths due to non-communicable disease has been proved to be because of lifestyle-related factors like physical inactivity, rapid economic development, and increasing westernization of lifestyle in past few decades. Prevalence of this disease has reached alarming proportions among Indians in recent years. In today's scenario, the daily routine of each individual has become so busy and hectic that many of the non-communicable diseases, that is lifestyle disorders, have been uh, have taken in the form of epidemic in current era. Ayurvedic perceives that positive health depends on a healthy lifestyle of an individual. Ayurveda has a great contribution in the treatment of disease as well as prevention of disease. Health include one's reserve of physical strength and stamina as well as mental steadiness to meet the requirement of daily life. Next, 1 minute. Lifestyle change more than any other factor is considered to be the best way of preventing the disease. In prevention of lifestyle disorders, dincharya, that is daily routine, plays a very important role. As a part of nature, human beings are very closely associated with the rhythm of nature. Ayurveda teaches how to perform daily routine to compensate external environment to remain healthy. The concept behind dincharya is to doshas. Dincharya plays an important role to the activities that man can perform spontaneously, deliberately, which results in both physical and mental fitness and keep the person healthy and disease free. Introduction. Ayurveda is the ancient science of life. It is the science which not only deals with the curative aspect of disease, but gives more importance to preventive aspect. Prevention is better than cure. There is a close relation between the lifestyle of an individual and the state of health of disease. Lifestyle refers to someone's way of living, or we can say the dietary and ahar and behavioral vihar choices of an individual that he or she usually practices in daily routine of life. A daily routine is necessary to bring radical change in body, mind, and consciousness. It is also regularize the person's biological clock, aids digestion, absorption, assimilation, and generates self-esteem, discipline, peace, happiness, and longevity. Dincharya or daily routine is an important part of healthcare. To fill each day with essential self-care practice, eat at proper time, and create a regular sleep schedule. The Sanskrit word dincharya is defined as the daily routine. Din means daily, and charya means practice or routine. It starts from waking up in the morning in Brahma Muhurta, Ushapan, Malmutra Visarjan, Achaman, Danta Dhavan, Kabal, Gandush, etc. According to Ayurveda, one should follow dincharya in order to lead a healthy and disease-free life. All lifestyle disorders can be prevented by adopting dincharya. Ayurveda is the excellent science of life. Ayurveda is the science of life which emphasizes on restoration of health of individual. Then a treatment of disease, material and methods. Various Ayurvedic classic texts, Charak Samhita, Shushruta Samhita, Ashtam Sangraha, Ashtam Hruday, Bhav Prakash were used as a source material. Apart from these websites and modern books on prevention and social medicine were also searched for this study. Dincharya includes various activities. Brahma Muhurta Utishtate. Waking up early in the morning. It is advisable to wake up during Brahma Muhurta, early in the morning, that is 90 minutes before sunrise. It stimulates the melatonin, which is mood elevator, and helps the mind to keep in active state. Achaman, that is Pad Mukha Prakshalan. Washing of feet, face, hands, etc. prevents recurrent infection and remove alasya. Grit evam darpan darshanam. Looking one's face into grit and mirror, it helps to come out of mental confliction and prolongs longevity of life. Ushna Jalpan. 1 to 2 glasses of water kept for a whole night should be taken before sunrise. It is considered as a Chakshushya, Medya, Jaranashak, Arshogna, Jwaragna, Udar. Malamutra Visarjan. Urination and defecation. It prevents the disease and provides kanti, bala, rushya, chakshusham, etc. Dantadhavan, cleaning the teeth and gargling the mouth. Dantadhavan by Katu, Tikta, Kashairas Pradhan Aushal or tree sticks. Example, Apamarga, Arimeda, Karvir. Oral health is very important for healthy life because lot of infections of upper respiratory tract spread via mouth. It cleans the teeth, remove harmful coating, removes bad odor, and increase life of our healthy teeth. Jivha Nirlekhan. Tongue scraping helps to remove impurities of tongue, bad odors, and coating on the tongue. Ishta Devta Smaran, praising God, helps to liquefy our ego, and when ego gets liquefied, it's easy to attain moksha. Mukha Nitra Prakshalan, cleaning the face and eyes, helps to relieve the disease like Nileka, Mukhadosha, Vyanga, eye wash with Shitodak, helps to purify the eyes and prevents the eye disease. Anjan, one should apply Savir Anjan, which is beneficial to eyes. It improves, maintains our vision. It cleans our eyes and increases their shine. Pratimarshanasya, nasal medication. The nasal medication is advised since birth to till death. And it is advised in a disease of Urdhva Vikaras. Gandush and Kaval, mouth gargling and withholding medicated oil and water in the mouth. Tail gandush leads to strengthening of jaw, voice, improve taste. Dhumpa, medicated smoking. It gives strength to throat, improves voice. Abhyanga, anointing the body with medicated oil, prevents jara, promotes strength, and prolongs life. Udvartan and Utsadan, by rubbing with powder, the excessive oil, dirt, and dead skin will be removed. Vyayam, physical exercise, promotes longevity, improves digestion, complexion, makes the body firm and compact. Acharya described the importance of Vyayam or exercise, that is, lightens our body, increases work capacity, and improves digestion. In today's life, lack of exercise has created a lot of lifestyle disorders in humans like obesity, CAD, diabetes mellitus, hyperlipidemia. Snana or bath. Taking bath with medicated water helps to purify the body, eliminates fatigue, sweat, and dirt. It also improves blood circulation in the body. Vastradharan, proper dressing. Proper dressing leads to calmness, gives fame, Ayushkar prolongs, longevity, eradicates poverty. Gandhamala, Gandhamala Mala Anulepam. Smearing the body with a sandalwood paste removes sweat, dirt, improves complexion, and removes fatigue. Bhojanam, proper intake of food. Ayurveda elaborately explains about the food intake. It helps to improve complexion and promotes life, happiness, strength, promoting medya, increases ojas and balakarak. Tambul Sevan, chewing of betel leaves with areca nut. Helps to pacify all the three doshas, cleans mouth, removes bad odor of the mouth. Healthy habits. Acharya had mentioned all the deeds to follow to live a healthy life under the topic of Sadrikta. In Ayurveda, Swastha is whom all dosh, Agni, Dhatus, Malas, all physiology are in equilibrium. Both physical and mental wellness is required to be healthy. In Ayurveda, all Vihar is told in such a way that it maintains balance between physical and mental health. Discussion. According to the science of Ayurveda, stress should be laid upon a health promotion rather than the management of disease. Ayurveda provides better solution in the form of following proper dincharya regimen described in Ayurvedic text, which promotes positive health of individual by maintaining a normal physiological function of the body and keeps the person healthy forever by slowing down the irreversible changes occurring in the body with the advancement of time or age. Daily habits of people make their lifestyle. The rapid modernization has changed the lifestyle and behavioral pattern of people, which is responsible for occurrence of lifestyle disorder. The management of this lifestyle disorder demands modification in faulty dietary and behavioral habits of persons. Principles of Dinchari is basically related with the harmonization of human body related with environment, and this practice basically balances the doshas, which ultimately results in good health. The points are looking very simple but play very important role in the maintenance of health. Conclusion. The Dincharya regimen, if followed properly, helps to attain physical, mental, and spiritual well-being of an individual. Dincharya is a specific regimen of the activities helpful to fulfill the need of body in a particular time. Dincharya deals with maintaining health of healthy as well as diseased person, and hence Dincharya Adhyaya is described in all the three brief phrases. One should adapt the wholesome daily regimen, which is prescribed by our ancient acharyas to lead healthy, wealthy, and prosperous life. References. There are some references. Charak Sahita text with English translation, editor translator, Professor Priyava Sharma, Volume 1, Sutrastan, Chapter 30, Shlok number 26, published by Sokhamba, Oriental Varanasi edition 2040, page number 240. Dr. Priyanka, a review on a Dincharya. Charak Dr. Brahmananda Tripathi, Charak Sahita, Sutrastan Adhyay 5. Charak Vagbhat, Atanga Sangrah, commentary of Shashilekha by Indu, Sutrastan, the third chapter, Shlok number 2. Acharya Vagbhat, Ashtang Hridaya with Sarvanga Sundar of Arun Datta and Ayurved Rasayan and Hemadri commentary, Sutrastan second chapter, Shastri K. and Chaturvedi Jayan, Charak Sahita, volume number 1, Varanasi, Chaukhamba Bharati Academy. Thank you.
Thank you, doctor.
So next I invite Dr. Gautami.
Yes, ma'am. Am I audible?
Yes, doctor.
Okay.
Your screen is visible, doctor. Please start the session.
Okay. Good evening, everyone. Myself, Dr. Gautami Isasare, PG Scholar, Department of Swasthavritta, Government Ayurveda College, Tripunitra. My topic of presentation is Pathophysiological Interpretation of Symptoms of Purisha Vegadharana, a conceptual study. Abstract. To maintain the normal homeostasis of the body, Vegas or natural urges are generated. Vega is a fundamental concept of Ayurveda as it appears to maintain the equilibrium of doshas and dhatus and excrete mala or toxins out of the body. The Vegas help in the elimination of substances from the body naturally, although they are involuntary but can be controlled at one's own will. But continuous suppression leads to severe illness or disease. Introduction. Vegas are the part of bodily function to fulfill the physiological demand. They are created naturally to eliminate toxins that are produced in our bodies. Vega is considered as adharaniya, that is, which is not supposed to be hold. Manas Vega is considered as dharaniya, that is, which are supposed to be hold. Purisha Vega comes under adharaniya Vega. Vegadharana may cause disturbance in the normal physiological behavior of the concerned organ system and subsequently cause various types of diseases. When Vegas are frequently and unnaturally suppressed, the normal physiological mechanism of the body get disturbed and mainly Vata dosha get disturbed. The vitiated Vata dosha disturbs the equilibrium state of two doshas, that is Pitta and Kapha. In our modern lifestyle, we find ourselves suppressing some or most of the natural urges of the body. We forcefully suppress the urge in a meeting, when busy with work, watching our favorite television program, or in distant traveling. The urge of eliminate Urge to eliminate the feces is suppressed due to inadequate toilet facilities. Symptoms due to long-term suppression of natural body urges may be acute, subacute, or chronic. The suppression of natural urges brings changes in every system of the body. Purisha is the result of Annapachana Kriya. It is formed in Pakvashaya at the third stage of Avastha Paka. At this stage, Agni does Shoshana of Anna and the Paripindita form of Purish is achieved. Katubhava give rise to Ahara Malarupa Vata, that is flatulence. Visarjana of Purisha and Ahara Mala Vata from Guda is under the control of Apanavayu. Objective of the study is detailed physiological study of Purisha Vega and its Vega Dharana Janya symptoms. Contemporary modern understanding of the above concepts. Methodology. Ayurvedic text Charaka Sushruta Vagbhata Samhita with contemporaries were consulted as references. Literature available regarding changes in body from various journals and books is collected. These references from both stream of knowledge were compared and analyzed critically. Discussion. Nowadays, people have an unhealthy lifestyle because of a busy schedule like shift duty, stressful job, lack of exercise, nightlife, especially in metropolitan cities, and this creates the problem of Vegadharana, which further leads to the initiation of the diseases. Suppressing natural urges affects not only the biological clock of the body, but also the physiological functions of the body. According to Acharya Vagbhata, most of the diseases occurred by Vegadharana. Acharya Sushrut explained that suppression of natural urge blocks the gati of Apanavayu that rebounds in the opposite and upward direction and interferes with the functioning of the particular strotasa. Overturns the whole body functions, manifesting symptoms in whatever areas they get accumulate. These are the symptoms of Purisha Vegadharana according to Acharya Charaka, Sushruta and Ashtangradaya. Symptoms produced by Purisha Vegadharana according to Acharya Charaka is Pakvashaya Shula, Shira Shula, Purisha Apravartanam, Vata Apravartanam, Pindiko Dveshtana, Adhamana, bad odor from the mouth, Mukhena Vitpravritti. Some symptoms which are explained by Acharya Sushruta are same as Acharya Charaka, but some symptoms are different, and these are Shula, Parikartana and Purisha Sangha. Same as according to Ashtangradaya, some extra symptoms are Pratishaya and Hridayasya Parodhanam. Interpretation of Lakshanas or symptoms produced by Purisha Vegadharana. First is Pakvashaya Shula or abdominal pain. Due to continuous Purisha Vegadharana, it causes constipation, which generate abnormal stimulation and increase the distension of bowel due to excessive fecal or gaseous content, which due to nociception, pain occurs in the stomach. The nociception is the some kind of due to peripheral nervous system, some signals are generated which activate the central nervous system and which causes pain. This is called nociception. Pindikodveshtana, accumulation and stagnation of fecal matter in the large intestine, which causes reabsorption of sodium or which is called as hypernatrium, which causes dehydration of cells and muscle cramp. Acharya Vagbhata described that these symptoms are also the symptoms due to suppression of Purisha and Adhovata. Mukhena Vitpravritti. Purisha Vegadharana. Due to continuous Purisha Vegadharana, when bowel is obstructed and the intestinal contents cannot move normally downwards, peristaltic waves occur in an attempt to decompress the intestine, which pushes the content backward through the pyloric sphincter into the stomach and causes vomit. That is Mukhena Vitpravritti. Radivyatha. Vegadharana of Mala leads to reverse a natural pathway of Apanvayu, causes vitiation of Vata and Rasa Dushti occurs. This causes Hriday Roga. Suppression of natural urges like Mala, defecation, constipation occurs and which is the cause of cardiovascular disease. In a study, it has been mentioned that constipation is marker for cardiovascular risk factor and increased cardiovascular diseases. Shira Shula or headache. Vegadharana causes constipation, which produces gases like carbon dioxide and it causes a spark, a gastric headache. Shiroruja and Pratishaya. Due to Vegadharana, accumulation of toxins and various allergens, Shirashula and Pratishaya occurs. Hridayasyoparodhanam. Pain in subdiaphragmatic area of epigastrium lead to confusion in differential diagnosis with cardiac cause of pain. Effect of holding natural urges according to modern. In children, holding behavior of feces causes slow colonic transit, abnormality in enteric nervous system, chronic gas accumulation and bacterial growth occurs, which causes future IBS. Chronic constipation. UTI and fecal soiling of urine among children occurs due to the chronic constipation. Here in this picture, we can see that there is lots of hard stool accumulated in this area, which causes stretching of the rectum, and due to this, some loose stool is coming out. This is called as fecal soiling. Pudendal nerve damage. If the pelvic floor is overstretched acutely or chronically, the pudendal nerve is vulnerable to stretch and induce neuropathy. Unilateral pudendal nerve neuropathy inconsistently may cause the fecal incontinence. Inflammation of the colon. An increased fecal load in the colon may increase the bacterial count. This inflammation may increase the risk of developing colon cancer. Retention of urine. Accumulation of fecal matter causes pressure on bladder, which causes retention of urine. Fecal impaction. Dry stool that cannot pass out of the body results in constipation. Intestine absorbs water from the stool that accumulates in the rectum, due to which stool become hard and difficult to pass. Intestinal perforation. A hole that develops in the gastrointestinal tract due to pressure of excess fecal matter on your intestine. Due to continuous holding of urge, the stool get dry and due to the continuous holding of the urges, the stool get dry and create pressure on rectum. Expansion of rectal sac loses its sensitivity to activate the defecation reflex. Due to deactivated defecation reflex, people tries to defecate forcefully, which may cause several diseases like hemorrhoids, anorectal damage, colonic diverticulitis, cutting or splitting pain in anal region. Diverticulitis. Due to high pressure within the colon, weak areas of the colon wall get bulged out and form the sacs. The inability to have a bowel movement caused by poorly coordinated pelvic floor muscles. The puborectal muscle is responsible for the relaxation and contraction of the anal sphincter. When puborectal muscle get relaxed, anal sphincter get open and stool is evacuated. When puborectalis muscle get contracted, anal sphincter get closed, stool does not evacuate and prevents fecal incontinence. Anorectal nerve damage. Chronic constipation may also cause nerve damage that leads to fecal incontinence. Anorectal disorders with history of childhood
Excuse me,
constipation.
doctor.
Yes, ma'am.
Please.
Hello.
Hello,
Hello.
doctor, you are exceeding the time limit.
Doctor.
Can you speed up your presentation, doctor?
Yes.
Okay, doctor.
Results. The main conclusion derived from the study are the exploration of the pathology of symptoms of Purusha Vegadharana from the clinical findings, and the evaluation of them on an Ayurvedic and modern basis will add new scope to the discipline of Ayurveda. If the normal physiology is altered, then it leads to the pathology due to disturbance in the normal body physiology. These are some of the interpretations made based on articles and published, and there are no such pieces of evidence related to the Vegadharana and its consequences related to its long-term suppression. But an attempt is made by studying thoroughly and understanding the basic physiology of the body reflexes. There are many more interpretations that can also be drawn, but depending on their yukti, many assessments are made ranging from acute complication to late and severe complication grading can be done. Thank you.
Thank you, doctor.
Doctor. So next I invite Dr. Shadab Khan Yunus Khan. Dr. Shadab Khan Yunus Khan.
Yes, ma'am. Am I audible?
Yes,
Yes,
doctor,
doctor.
audible.
Okay. My screen is available.
Your screen is visible, doctor. Please
Okay,
chat,
sir.
doctor. Please start the presentation.
Good evening. Yes. Myself, Dr. Shadab Khan, second year Kaya Chikitsa student from Ashwin Rural Ayurved Mahavidyalaya, Sangamner. My guide is Srirang Chapekar, sir, and Vaidya Kuldeep Rajput, sir. My topic is nothing but the pilot study of my synopsis, effect of Yashtadi Yoga, herbo-mineral preparation in Urdhva Gamla Pitta clinical control study. Introduction. In Ayurveda, a widely practiced system of traditional medicine in India, in Ayurveda, health means a state of Dosh Samya, Agni Samya, and Dhatu Samya, as well as Atma, Indriya, and Mana. Due to lot of stress, lack of exercise, work in hurry, and faulty dietary habits are improving following Rutucharyas. Example, faulty diet habit result in the Amla Pitta, which is disease Annavaha Srotas. As Acharya says, Rok Sarvapi Mandagni. Example, vitation of Agni in main pathophysiology factor of all disease. In Amla Pitta also due to Mandagni, in undigested food become Vidagda Paka and then the Pachak Pitta attend the excessive Amlata and cause the Vidaha and increase the Dravya Guna of Pitta, Amla Pitta from Amashaya and Dosha as having Ashrayas. Rational study. Amla Pitta can be correlated with the disease like a gastritis, hyperacidity, dyspepsia. Prevalent of hyperacidity in India range is 7.6 to 18.7%. Lifestyle factor are light dietary habits, consumption of carbonate and alcoholic beverage, and tobacco smoking have been indigested as risk factor that conditional like hyperacidity and gastric reflux of disorders. Yestari Yog is a combination of herbo-mineral preparation, content of this formulation having property of Dipan Pachan Grahi, hence decided to use combination in treatment of Urdhva Gamla Pitta. Avipattikar Churn is Ayurvedic medicine used treated Amla Pitta that affect the normal functioning of digestive and excretory system. It neutralizes the acid secretion in the gastrointestinal tract and promote the production of digestive enzymes. Avipattikar Churna reduce the acidity in stomach, relieve the heartburn and discomfort. Hence, study titles Effect of Yestari of Herbal Mineral Preparation, Clinical Control Study. Methodology, study design, randomized controlled comparative clinical trial, duly signed and that consent from the subject will be participate. Screening of subject according to baseline assessment and inclusion and exclusion criteria. Randomization, allocation of groups. Dependent variables, sign and symptoms of Urdhva Pitta. Independent variable are Yashti Yoga and Avipattika Shona. So inclusion criteria is patient having age group 20 to 15 year or other. Patient fulfill from the diagnostic criteria which are based on sign and symptoms of Amla Pitta. Exclusion criteria is patient not willing for clinical trial. Any other addiction like chronic alcoholism, induced hyperacidity, patient suffering from the other chronic system of disorder, pregnant and lactating mother. Withdrawal criteria for patient is patient who will discontinue the treatment, patient unable to take the treatment during study, patient show any type of adverse effect if complaining occurs. If any complaint exists during treatment, case will be liable to rejection. So in this study, we divided the two groups, group A and group B. Group study of 5 patients and other group have 5 patients. Assessment is seen in 0, 7, 14, and 21st day. In first group, we give the Yashadi, second group, we give the Avipattikar Churna. Yashadi is my preparation containing 500 mg per vati, Yashti Madhu 17 mg, Amlaki 70 mg, Shatavari 70 mg, Shunti 70 mg, Daim Tak 70 mg, Kapardik Bhasma 50 mg, Shoktik Bhasma 50 mg, Shwarna Makshi Bhasma 15 mg. The dose of tablet is 5 500 mg 2 tablets twice a day after meal with a Koshna Jala. During of study is follow-up 0, 7, 14 and 21. Appropriate method of measurement. There are subjective criteria for it. Avipak, Hruday Kantadaha, Tikta Amlodkar, Chardi, Guruta, Aruchi and Utklesh. From subjective parameter, we got the result. From the above pilot study, we noticed that total 10 patients from both group A and B have symptomatic relief in 7-day follow-up. In pilot study, we understand Yashtadi Yoga and Avipattikar Churna have equal result in Urdhva Pitta. Discussion. In this pilot study, we divided the patient in two equal groups. To first group, we give the Yashtadi Yoga, and second group, we give the Avipattikar Churna. We seen that both yoga are good working from day first. In both group, seen Pitta's Prakruti patient are much affected and suffering from the symptoms of Amla Pitta than other Prakruti. In study, we seen that mostly patient of Amla Pitta are found the Hetu like Akali Bhojan, Atimatra Bhojan and all types of Viruddha Ahar. Excessive drinking of tea, coffee and eating unhygienic food or snacks and also disturbing sleep pattern as well as stressful lifestyle. To get the best result of drug and no recurrence of the symptoms, we must have to avoid treatment. Due to Madhu, Amlaki and Shatavari having Shitvirya Pittagna property, that's why relief symptoms like Hrudaykanta Dahani Amlodkar. Shunti having Grahi and Deepan Pachan property, hence Daim have Shitvirya, Deepan Tritoshna is useful in above Lakshana. Kapardika having Deepan Pachan property, hence useful in Agni Vardhana. Shoktik having Deepan and Madhur property. Suvarnamakshik Bhasma is Madhur Tikta Tridokshakna, hence all these properties are useful in the Urdhva Pitta. Conclusion. In this pilot study, we seen that Yashtadi Yoga and Avipattikar Churna has equal relief in Amla Pitta. To get the proper, accurate and detailed result, Yashtadi Yoga will be study more deeply on this topic. Also seen the patient of Urdhva Amla Pitta. And there are some references they are giving. Thank you so much.
Thank you,
Hello.
doctor. Thank you, doctor.
Yes. Thank you.
Next, I invite Dr. Renuka Bhushan Sawant.
I invite
Dr. Renuka Bhushan Sawant.
Yes, ma'am.
Yes, doctor, you're audible. Dr. Renuka, please start.
Ma'am, I'm trying to share my screen. Ma'am, is my screen visible?
yes, doctor, it's visible.
Shall I start?
Please, doctor.
Good evening, everyone. I'm Vaidya Renuka Sawant, second year PG scholar at Rognidan and Vikruti Vigyan Department from Government Ayurveda College, Nanded. My topic for presentation is urine microscopy, a liquid biopsy of urinary tract. So let us see why it can be known so. We all know urine is not merely a body fluid excreted, but it holds many cellular and non-cellular elements along. Some of these elements are organized, that is, they have a specific morphology. They are cells like RBCs, WBCs, epithelial cells, or they could be casts and organisms. While some other elements are unorganized, they have variable morphology like crystals. These crystals can be calcium oxalate crystals, uric acid crystals, triple phosphates. We'll see them all further. And then amorphous material, which can be seen as black dots scattered all over the microscopic field. These elements are microscopic, that is, they are very minute in nature, so they needs to be observed under the microscope under LPF, that is low power field, or HPF, that is high power field. So let us see a specimen. Which specimen is to be preferred? First morning midstream freshly voided concentrated sample is preferred. Why such first morning urine is preferred? Because it is concentrated, that is, the concentration of elements is high and they could be easily found in that sample. And midstream is preferred because the beginning stream might have some contamination, or the last stream might have a residue, so we prefer the midstream. At least 10 ml of urine sample is to be collected in the clean container, and then it is centrifuged for 5 minutes at 2000 rpm. After centrifugation, two layers are seen in the tube. First layer, the above layer, is supernatant layer. It is super liquid part of the sample, and the other layer seen at the bottom is sediment, that is precipitate like layer. We use this for the examination. Then when we begin the examination, what structures are to be observed? So we can categorize it under 4 parts, that is cells, cast, crystal, or some other structures like organisms or parasites. We'll see them in detail. So RBCs, the structure on the left hand side of yours is RBCs. Normally, RBCs can be found in a urine microscopy 0 to 2 per HPF, that is high power field. But if more than 3 per HPF are seen, it shows a significant presence of blood in urine, so which is known as hematuria. What can be the causes of this hematuria? They can be of glomerular origin, like glomerulonephritis or Buerger's disease, and some non-glomerular origin, like calculi, benign prostatic hyperplasia, or malignant conditions of prostate, kidney, bladder, or due to strenuous exercises. Hematuria can be also found due to hematological conditions. What could these hematological conditions be? They can be coagulation disorders or sickle cell diseases, and it can also be seen in dengue hemorrhagic syndrome. Coming to WBCs, on the right hand side, you can see the WBCs. Normally 0 to 2 per high power field WBCs can be seen in urine microscopy. But if more than 10 WBCs per HPF are found, it is suggestive of urinary tract infection. And if they are found in clumps, then it is suggestive of acute pyelonephritis. Classic picture of UTI is clumps of WBCs along with presence of bacteria and presence of albuminuria, and when the urine tests positive for nitrite. Without WBCs in bacteria, without WBCs, if bacteria are present, then we can consider that the urine is contaminated. Some other conditions showing presence of WBCs in urine is fever, tubulointerstitial nephritis, or renal transplant rejection. Going forward to squamous epithelial cells. Epithelial cells, they are mostly of two types, renal tubular epithelial cells or squamous epithelial cells. So structure on the right, left hand side of yours is squamous epithelial cells. It is best seen under LPF, that is low power field. When are these squamous epithelial cells found? When the urine sample is contaminated with some genital fluids. And on the structure on your right hand side is transitional epithelial cells. They can be found in acute tubular necrosis or pyelonephritis in case of heavy metal poisoning, viral infections of kidneys like cytomegalovirus. Next structures to be observed are casts. Casts are nothing but precipitate of proteins which are secreted by the tubules. They also can be best seen under low power field with lowered condenser. Presence of cast in urine is called cylindruria. Casts are the only element which have specifically renal origin. Let us see the significance or diagnostic evaluation of finding this cast. First of all, hyaline cast. Hyaline caste, let me state that hyaline caste is, every caste in the beginning is a hyaline caste. Then the other structures which get adhered to it, then we could say that it is the caste of that particular type. Hyaline caste is normally found in urine, and if it is found for more than 2 to 3 per LPF, then it is suggestive of nephrotic syndrome. Second is granular caste. This muddy brown structure on right hand side of yours is granular caste. When the other elements in urine like cells or organisms, they get degraded, they adhere to this caste into the hyaline caste into the granular form, and the granular caste is formed. It is found in acute tubular necrosis. Next, RBC caste. These are the cellular caste, RBC caste. RBC castes are seen in glomerulonephritis or malignancies. WBC castes are found in acute pyelonephritis, and epithelial cell caste are found in acute tubular necrosis, or if it is a squamous epithelial cell caste, then it is found in BPH, that is benign prostatic hyperplasia. Going forward to the crystals. Crystals are normally or abnormally found in urine. They are identified by their morphology. So normal crystals in acidic urine are uric acid, calcium oxalate, and amorphous urate. And normal crystals in alkaline urine are calcium carbonate, triple phosphate, and ammonium biurate. Now crystals which are found in diseased states, that is abnormal crystals, are cholesterol, cysteine, leucine, and tyrosine. Calcium oxalate crystals on the left hand side of yours, they are envelope shaped. The morphology of calcium oxalate crystals can be exactly correlated to the description of Vataj Ashmari given by Acharya Sushruta. They are found in urinary calculi and osteoarthritis. Then uric acid crystals on the right hand side of yours, you can see the diamond or rosette shaped structures. They are uric acid crystals. They can be correlated to the description of Pittaj Ashmari given by Acharya Sushruta. They are found in urinary calculi and gout. Also, amorphous urate crystals are found. They are thorn apple shaped. Unfortunately, I don't have the needful image for it. They are found normally if there is increase in the intake of calcium or potassium diet, and if you hold prolonged holding of urge to micturition.
Excuse me, doctor.
Yes.
You are exceeding the time limit. Please speed up.
Yes. I shall cover. Then triple phosphate. Triple phosphate are triple phosphate crystals are coffin lead-like structures. They can be correlated to the Kafaj Ashmari. It is due to high ingestion of phosphorus dye, hyperparathyroidism, or it can lead us to the specific diagnosis of UTI, which can be caused by Proteus. Next is the cholesterol crystal. Cholesterol crystal is abnormal crystal. Presence of cholesterol crystal in urine is due, we can call it as a lipiduria. It is found in nephrotic syndrome or hypercholesterolemia. Then leucine crystal. Leucine crystal is that flower-like structure on the left-hand side of yours. Leucine and tyrosine, both these are amino acids. They are seen in urine when protein metabolism is hampered. Protein metabolism is done by liver. So in cases of severe liver diseases, these crystals are found in urine. Other significant findings. For this findings, it is compulsory that the urine sample examined is fresh, or it can lead to the false detection of these organisms. First of all, bacteria. The rod-shaped structure on the left-hand side is bacteria. If more than 1 lakh bacterial colonies are found in per ml of urine, or if more than 20 bacteria per HPF are seen in microscopic field, a high power field, then it is suggestive of bacteriuria, which is seen in UTI or pyelonephritis. Spermatozoa on the left hand side, they are seen in the urine sample of male patients. Then candida. Candida is seen in case of vaginal candidiasis or also diabetes mellitus. The bush-like structure is candida. Trichomonas vaginalis. Trichomonas vaginalis is a motile structure found in fresh urine. It can be found in the condition of vaginitis. This is it. The motile structure seen in between is trichomonas. So, like in biopsy, we collect the part of tissue or fluid in the tissue, and we take it for the laboratory examination. We know urine is also a body fluid that is produced, metabolized, and occupied all in the urinary tract. So, examination of this urine, we can consider it as the liquid biopsy of a urinary tract. It is like the snap of the current state in which your urinary tract is. Thank you to the organizers for allowing me to present.
Thank you, doctor. So next I invite
Dr. Shirin.
Am I audible?
Yes, doctor.
Screen is visible, right?
it's visible, doctor.
Okay, may I start?
Yes, please.
Okay. Good evening. The topic of my presentation is Kshara and its applications in Ayurveda, a critical analysis. Myself, Sharon P., first year PG scholar, Department of Shalyatantra, VPSV Ayurveda College, Kottakkal. Here, in this presentation, we will be dealing with the basics of Kshara and its applications in Ayurveda. In between, we will be doing the critical analysis at respective points. First of all, Kshara is included among Anushastra as well as an Upayantra and is one among Shashti Rupakrama. So, Shastra Anushastranam Shreshtaha Ksharaha, and it does Chedya Bedyadi Karmaha. Etymology of Kshara derived from the root word chara, to move, by Shabda Kalpadruma, Ksharaha Sanchalani, to move or to melt away. And in Amaragosha, Chara is Dahana and Kaja, to fasten or to shine. These are the etymologies of Kshara. Moving on to its Nirukti, Chitwa Chitwa Ashayat Ksharaha, Ksharatwad Ksharetyadaha, according to Charakam Chikitsa, Tatra Ksharanad Ksharanadva Ksharaha, according to Susrudam Sutra. Thus, we can find that Kshara Syandana, Kshana Himsaya, Vatadaka Ksharaha. So the two main properties are Himsana, Kshanana, and Ksharana. Kshanana means Himsana, Mamsadi Himsana, to disintegrate or to destroy the skin or other tissues. Ksharana means Shodana, that is the cleaning of excessive morbid doshas. Now, what is meant by alkali? It is a caustic substance, and the word is derived from the Arabic word alkali, ashes of salt water, and caustic from the Greek word kaustika means to burn. So this is the same action from Kshara we are getting. What is its significance? It is used as a parasurgical procedure, minimal, invasive, and precise. It can be administered both internally and externally and reduces disease recurrence. So let's look at the basics of Kshara in our classics. It is referred to as a rasa by Nimi, mentioned at Charakam Sutrasthana Atare Bhadragapya chapter. Kshara in Gulma, Kshara Gudiga, Kshara Grida, all references we are familiar with. Kshara Paga Vidhi in Chakrapani Datta we are familiar with. Kshara in Virana Chikitsa, Arshas Chikitsa also in Sushruta we can see. And it is one among Kshara Guna, Bharada, Bandhana also we hear it, and in Shilajadu, Shodhana, etc. So what its main properties? It is basically Kadurasa, Ushnavirya, Varna Shukla. But looking on its guna, it is Saumya, Tikshna, Agneya. Critically looking, how can a drug become at the same time Saumya as well as Agneya? That should be a further research point. And what is Uttama Kshara Lakshana? Naiva Aditikshna na Mradu Shukla Lakshana Atha Pichila, Avishyande Shiva Shigra Kshara ki Ashtaguna Smrida. 8 qualities as per Acharya Susruda and 10 qualities by Acharya Vagbada. Which are the 2 additional points told by Vagbada? It is Shighari as well as Sugha Nirvapya. Shighari means it is producing vertical flame on heating, and Sugha Nirvapya means it is getting easily neutralized. What are the Kshara doshas? Adhimardava Shaitya, Ushna, Taikshne, Paichinya, Sarpida, Santrata, Apakwada, Hinatrapyada, Dosha, Uchyade. So Kshara dosha, if it is present, will not get adequate results. What will cause if it is used in excessively? Kesha, Akshay, Hridaya, Pumsu, Upagada Garaha, Sadadam, Upayunchadeta, Anthyam, Shantyam, etc. This slogam we are very familiar with. So excessive use of Kshara will cause so many contraindications. Now, basically types on the basis of administration, we can say Paniya Kshara as well as Pradhisaraniya Kshara. Based on concentration, Tikshna, Madhyama and Mridu. Mridu Kshara can be used in Pitta Rakta Arshis conditions. Usually Kshara is contraindicated in Pitta Rakta condition, but we can use Mridu Kshara. Based on origin, it is Vanaspatika, Pranijanya and Khanijajanya. Based on preparing seasons, Uttama Kshara is bought in Grishma Ritu, Madhyama in Sharat and Adhamam in Varsham. Looking on to the Kshara Karma, Tridoshakna, Nana Ushadi Samavayatvat, Saumya, Shuklatvat, Dahana Pajana Dharana is its karma, Agneya Ushada Guna Bhuishta is basic property, Shodhana Ropana Shoshana is the action it is being done. Paniya Kshara, we are very familiar with its indications, Arshis, Agni, Mandhya, Ashmari, Gulma, Udara, etc. And its modern view, it is reducing the gastric secretion before food intake and also as an antacid in peptic ulcer, protect gastric mucosa, mucolytic expectorant in bronchial asthma. But critically looking, in common clinical practice during acidic conditions of a gut, Kshara preparations are given, aiming of neutralizing this acidic with alkali, so a salt is formed. But in Agni-Madhya conditions also, Kshara can be used to improve the Agni. So one drug is doing multiple actions. So how is it so? That should be critically analyzed. Now, Pradhisaraniya Kshara, it is useful in skin diseases, anorectal diseases, Mugarogas, and other common clinical conditions. According to the condition, we can use it. And Kshara is contraindicated in Rakta, Pitta, Jwara, Pitta, Prakriti, Durbala, Bala, Sevira, Bhiru, Garbhani, etc. This and all we are very familiar with. Looking on to the Dagda Lakshana, there is Sammik Dagda Lakshana and Hina Dagda Lakshana and Adi Dagda Lakshana. Sammik Dagda Lakshana, Vigara, Ubashamana is occurring. Hina Dagda, inadequate cauterization is occurring. And Adi Dagda, it will be Daha, burning sensation, Paga, redness and all occurs. These are the common plants which are indicated for Kshara preparation. And plant origin Kshara and diseases, usually clinically we can see Arka and Abamarga is best at GIT respiratory conditions, Gokshura in urinary system disorders, Palasha in GIT conditions, and Kshara Taila for diseases of ear. Preparation of Kshara, usually Sharat Ritu, and we'll do 6 times water is added, filter 25 times, 21 times through a cloth, and again boiled and evaporated to form Ritu Kshara. In Kshara application, Purva Karma we are doing as such in Agrobharaniya, and Pradhana Karma, Vada, Leghana, Pitta, Garshana, and Kaba Prachana. That should be critically analyzed. Why Acharya has told specifically said. And it should be applied with Shalaga. Duration is 100 Matra, Pakku, Jambu, Phalavarna, and Krishna Varna. Pashchat Karma is Shalana with Amla Dravya. So why Amla Dravya is selected? Kshara is Amla Vardhya Rasa. So Kshara plus Amla Madhura occurs. Madhurya, Shama Matnodi, Vahni Radhirari Apluda. So then only the complications by applying Kshara will be neutralized. Advantages of Kshara therapy. Post-operative pain is mild in intensity, no bleeding as such if we are doing it properly, minimal hospitalization and minimal scope for recurrence, and minimal surgical complications like incontinence, stenosis, and stricture if the procedure is done adequately. Now, looking on to the Kshara Sutra reference, we can say that Kshara is alkali and Sutra is thread. So, Kshara Sutra is Ayurvedic medicated thread. Delhana commentary tells Kshara Pidena Sutrena. Looking on to its preparation from Chakrapani Datta, Arshas Tigilsa, you can see that Bhavidam Rajani Churne, Stohi Kshiram Punaha Punaha, Bandhanat Sudrudam Sutram, Vihatyarsho Bagandaram. This is the preparation of Kshara Sutra. But whether we can see any Kshara in this sloga, mentioning of any Kshara in this sloga, there is only Rajani Churna, Stohi Kshira, as well as Sutra is mentioned. So that is a very great point for critical analysis, whether actually Kshara is told for Kshara Sutra preparation. Looking on to Rasa Tanagini and Rasa Kamadhenu Kshara Sutra preparation also, we can see Kshira, Shuddha Dugdam is seen, Haridra Churna also is seen, Leban of drugs is 7 times it is told there. Also in Rasa Kamadhenu also we cannot see any Kshara as such mentioned, but these are all the preparation of Kshara Sutra itself. Now features of the thread, we know that it is a cotton thread, barber's thread number 20. It should have good tensile strength and ability to hold Kshara coating. Whatever medicines we are imbibrating, that should have the capacity to hold it. And as such, we know, Haridra Churna, we should take the worm eaten and old kurkuma is to be discarded. The fresh one, dried as well as powdered well, is to be used for coating. Now, stages in preparation, we know application of latex and Kshara is there. Then application of Haridra Churna and latex is there. Sterilization of Kshara Sutra and packing of Kshara Sutra should be done. So total 21 coatings. Snuhikshira coating is 11. Snuhikshira plus Abamarga Kshara 7. So practically we are using Kshara, but actually in the slogan there is no reference of Kshara seen. Snuhikshira plus Haridra is 3 coatings. Total 21 coatings of 21 days. Why 21 days, that should be critically low. Whether we can do and shorten the total procedure in 20 or 10 days, minimum 10 days, it is told that it's an auspicious number we are taking 21. But actually, in the slogam also, in the reference also, we could see 21. Why is it 21? We read 20 assumes the size of 40 to 15 gauze size, but 21 is referred to as an auspicious number only. In order to preserve the action of maximum 3 ingredients, more number of coatings is stored. Mode of action, cutting of tract by pressure, doesn't allow cavity to close down prematurely. Ideal cutting and healing of the tract from apex to periphery, and no pus packet allowed to stay back. So that is why Kshara Sutra is having less recurrence, and anti-inflammatory and curating action is less. These are the usual types of Kshara Sutras. Here, Gugulu Kshara Sutra, Udhumbara Kshara Sutra, Gomutra, Papaya, several researches are there. And among all of them, Abhamarga is having more results from more researchers. And looking on to the indications and contraindications, actually in Changradatta, Arshas and Bagandhara is mentioned. Sutrada Nadivrana context only Kshara Sutra is mentioned, and as such Kshara Sutra preparation is not mentioned in Sutrada, it is mentioned only in Chakrapani Datta. And commonly in external Pradisarani Kshara we use in wards and all. Pyeloneedle sinus, fistula and ano is the common indications we are using. And be precautious with severely compromised cardiopulmonary status patients suffering from or having history of TB and Crohn's, as usually we are avoiding such cases. And immunocompromised and having evidences of HIV infection, diabetes and all, we should be very precautious with such cases. Preoperative preparation, written informed consent and sensitivity test should be done before. Operative procedure, as we all know, lithotomy position, perianal region will be cleaned well, local anesthesia is given, prop passed through the external opening, and internal opening is found out, and Kshara Sutra is applied. Post-operative procedure, will be giving suitable analgesics and antibiotics from Ayurvedic side itself, and six bath with Ushna Udaga or Vara Churna is utilized. Now, in practical aspect, it is told to change the thread in every 7th day, and railroad method is the usual method of changing. And measurement of old sutra should be recorded and advised to take rest for some time. This is the usual practice. And what are the basic advantages? Means application and follow-up of Kshara Sutra is very easy and very low rate of complications and minimal cost. These are the recent advances, beaded Kshara Sutra technique as well as double Kshara Sutra technique and ADR Kshara Sutra kit. Beaded Kshara Sutra technique means the Kshara Sutra will be having beaded at definitive intervals so that the cutting action will be more faster. Double Kshara Sutra technique means in the tract itself, 2 Kshara Sutras will be imbricated so that also the cutting will be more advanced. And so in all this, we can see that the cutting is getting more prominent with more number of threads or of the beads, more than the amount of Kshara. So we have to think whether actually a Kshara is told in Kshara Sutra. As such, in the preparation also, we couldn't see any mentioning of Kshara. And ADX Kshara Sutra is the latest sterilized Kshara Sutra kit that can be readily available. These are my references. Thank you.
Thank you, Doctor. So next I invite Dr. Nikita Gunwant Khandekar.
I invite Dr. Nikita.
Hello, ma'am.
Hello, doctor, you're audible.
Hello.
Okay, ma'am. I'll share my screen. Is my screen visible, ma'am?
No, doctor, it's not visible.
Okay, ma'am. It is visible, ma'am?
Yes, doctor, it's visible now. Please start.
Okay. Good evening, everyone. Myself, Vaidya Nikita Gunwant Khandekar, PG Scholar, first year, Kriyashari Department, GSC Usmanabad. My guide name is respected Dr. Dhindime sir. My topic name is Pranvah Strotas. So, what is Strotas? Acharya Charak in Vimansthan has defined Strotas. स्त्रोतांसि खलु परिणाम आपद्यमानानां धातूनां अभिवाहिनी भवन्ति अयन अर्थेन. Strotas is the channel through which parinam apadyamanam constituents, those which are still undergoing transformation, get carried to the destination where they are in sthir, that is stable dhatus. The part that is still to be converted into sthir dhatu is also known as posya or asthira dhatu. Pranavaha Srotas. The Srotas that act as the channel for the transfer is denoted by the name Pranavaha Srotas, and it is one of the Bahirmukha Srotas. Bahirmukha Srotas are the Srotas which allow the substances outside the body to enter and gets transformed to a state that can be useful for the body. Due to pollution and improper dietary and lifestyle habits, there is rise in diseases of Pranavaha Srotas. These commonly seen diseases are Pratishay, Kas, Shwas, Rajakshma. Causes of vitation of Pranavaha Srotas, Dhatu Kshinata, which may be due to various diseases, regular intake of dry non-oily food item, excessive exercise, excessive fasting or dieting, suppression of natural urges as a result of vitation of other srotas. Then symptoms of vitation of Pranavaha Srotas. Acharya Charak, again in Vimansthan, he has given the symptoms of Dushti Lakshan of Pranavaha Srotas. Atisrushtam, Atibaddham, Kupitam, Alpa Alpam, Abhikshnam va, Sashabda Shulam Uchvasantam Društva, Pranavahanyasya Strotamsi Pradushtani iti Vidyata. Atisrushta, that is increased respiration. Atibaddha, excessively obstructed and prolonged respiration, restricted breathing. Kupitam and Alpa-Alpam or Bhikshnam, that is Prakupita and frequently respiration. Sashabda Shulam, sometimes respiration is with sound and pain. Some other symptoms like forward bending of the patient, frequent giddiness are also observed. And diseases of Pranavaha Strotas like Kas, Shwas, Pratishay, Rajakshma, Parshvashul, these are also seen. Then method of chest examination. The organs related to Pranavaha Strotas are Nasa, Kantha, Hruday, etc. Hence, for the purpose of differential as well as confirmed diagnosis, it is very necessary to ask questions, that is Prashna Pariksha, inspect darshan, and to palpate sparshan, akotan, percussion of chest and other organs is also necessary. Also, the knowledge and examination of generalized symptoms should not be excluded. So first is darshan inspection. So in notes, observe the nasal mucosa. If there is presence or absence of redness or inflammation, kantha, throat, observe redness, inflammation. It might indicate tonsillitis. Chest region, observe its shape, whether it is pigeon shaped chest. Nakha, nails, observe clubbing, cyanosis, that is blue tinge in nails. Nasaga straw, nasal discharge, observe whether it is tanu or a pichil, or there is rakta straw, watery or mucoid or blood tinged, less or profuse, without any specific odor or smell, foul smell. Kafanishtivan, it might be phenayukta or yellowish with blood tinge, less or more quantity with or without bad odor. Samakafashtivana, Durgandhi, foul smell, thick, heavy. Observe Niram Kapha Steven sputum. In Niram Kapha Steven, there is no specific smell. It is light and watery. Then second is Sparsha, palpation. Pain and tenderness in Ura Pradesh. It might indicate Kas, Shwas, also Rudrog. Parshva, it might indicate Parshvashul, Kantha region, Kasa, Pratishay, Swarabhed. Then a tactile vocal fremitus. When the patient talks, the vibrations are felt on the chest wall. This can be assessed by placing the palm of each hand at two comparable positions on the patient's chest, anteriorly and posteriorly. Sound and subsequent vibrations are normally transmitted well in solid structures but poorly in air. This helps in understanding abnormality or diseases of lungs. Similar vibrations felt on both sides of chest. Normal lungs vibrations are increased in either or both sides of chest, that indicates consolidation. Third one is Akotan percussion. Normal sound, it indicates normal lungs. Dull sound in Parshvashul, no sound in Jalaparshva. Hyperresonance is seen in pneumothorax or emphysema. And the last one is to note down is respiratory rate. Normal is 14 to 18 per minute and abnormal more than 18 or less than 14. Now, one of the diagnostics tool is a spirometry. Spirometry is the test performed to determine the level of the lung function. An X-ray chest tells about the gross structure and pathology of the lung, whereas spirometry determines its functioning capabilities. Spirometry can be performed by any adult and children over 5 to 6 years of the age. Spirometer, being expensive, is used in the clinic and hospital settings for diagnosis and long-term monitoring or asthma. Spirometry should not be used in following conditions like hemoptysis, respiratory infection on the day of test, chest pain or pain induced or aggravated by testing. Then commonly seen diseases of transverse truthus and their characteristic symptoms. So first is CAS, Ashukapurna Galaseta, Kanthe Kandu, that is itching throat, Bhojanam Avarodha, difficulty in swallowing, Shwas, Shwasakruchrata, difficulty in breathing or dyspnea, Asino Labhate Saukhyam Shayanah Shwasapiditah, relief while sitting, and dyspnea, that is Shwasapida, aggravates in sleeping. Rajakshma, Dhatukshay, pain in both lateral scapular region, fever, cough, breathlessness, and hemoptysis. Parshve Shulevedhavat Vedana, that is severe pain in lateral sides of chest. Pratishay, Vatam Pratyabhimukham Shaya Yogamanam, Kafadinam Yasminsa Pratishyaya, discharge of Kafadi dosha through nose as per the direction of Vayu. The general treatment is to be administered on the line of treatment of Shwas. In Shodhan, Vaman, it is most fruitful in certain stages of Kapha Vikar when performed after Purva Karma like Snehan and Svedan. In Shaman Chikitsa, Ushna Vatanulumak Vatakafagna Ushadi Dravya are used. External Snehan, that is oleation on chest with Narayan tail. After that, Svedan, Bashpa or Nadi Sved or Upanaha. Rasayan Prayog is also effective. After Shodhan Chikitsa and transverse Truthus disorders, Rasayan is very effective. The Rasayan Dravyas like Pimpali, Bhallatak, Amaliki, and the formulations prepared from them like Sausashta Pimpali, Amalaki compound are beneficial. Use of Shunta Siddha Jal, that is water boiled with adding Shunti. Take Pimpri with Saindha with warm water. Leek Shunti with Mishri with old jaggery or oil. Mixture of harika juice plus Mishri is useful in cast. These are the home remedies which can be used by anyone. In allergic type of transverse throatus diseases, application of oil inside the nostrils act as a prophylactic measure. Guda Shunti Nasya, good, that is jaggery, and Shunta Churna are useful in Shwas and Hikka by using internally or when inhaled. Vacha Pradhama Nasya, Vacha Churna used for Pradhama Nasya is beneficial for Kafach Pratishay. Apply Vacha Tel inside the nasal mucosa with little finger. Dhumpan, the varti made up of soya, vacha, and ajwain. Then take steam inhalation of tulsi patra, ajwain patra in boiled water. Heat yashti madhu and dhatur patra churna in a vessel and take hot fermentation or inhalation. This reduces the constriction of bronchi and act as bronchodilator. In Shirogaura, that is heaviness of head and cold, lep, that is application of paste of shunta or marich, is also beneficial. Oleation with teal tail mixed with saindhav on chest and back is advised in Shwas. After that, in boiled water, add ajwain and tulsi patra. Give fermentation with this water on chest and back. Hot fermentation with atasi potali is also beneficial. Internal use of Mahanarayan tail with warm water helps in expectoration of cough. Thank you.
Thank you, doctor. So next I invite Dr. Parvati Vijayan. I invite Dr. Parvati Vijayan.
Hello, ma'am. Am I audible?
Yes, doctor.
Is my screen visible, ma'am?
Yes, it's sharing, doctor. It's visible. Please start.
Okay. Good evening, all. I'm Dr. Parvati Vijayan E, second year PG scholar, Department of Shalyatantra, VPSV Ayurveda College, Kottakkal. I'm presenting the topic tongue cancer and Ayurvedic approach. Starting with an introduction, the incidence of carcinoma tongue is equal in both sexes. Tongue cancer can either occur on the front of the tongue called oral tongue cancer, or it may occur at the base of the tongue called oropharyngeal cancer. Squamous cell carcinoma is the most common type of tongue cancer. Then the etiology. Leukoplakia and erythroplakia are two pre-malignant conditions that can become tongue cancer later. Any white or red lesions that does not heal or resolve on its own in about 2 weeks should be evaluated by a qualified physician and considered for biopsy. Then all the S that is mentioned as the causative factors of pre-malignant conditions such as smoking, spirit, sepsis, superficial glossitis, spices, and sharp tooth leads to malignancy. Then infection by HPV also can cause tongue cancer. These are the pathological types. There are 4 varieties. Non-healing ulcer, which is commonly on lateral border of tongue in about 60% of cases. And the second one is a proliferative growth with everted edge. Then a frozen tongue or indurated variety, there is maximum induration and sometimes it is more than the size of the tumor. The tongue is converted into a hard woody mass. In 4th type, that is the fissure with induration, tongue is indurated with deep fissure. Histologically, it can be squamous cell carcinoma, adenocarcinoma, or melanoma. Adenocarcinomas may arise from minor salivary glands or mucus glands. These are the common sites for tongue cancer. The commonest one being the lateral margin, which accounts for 47 to 50%. Then posterior 1/3, which is about 20%. Dorsum of tongue 6.5%. The ventral surface about 9%, and the tip 10%. This is the pathophysiology of any cancer. That is the etiological factors which leads to formation of carcinogens, which binds to the DNA, and then DNA adducts persisting miscoding. Mutations will be happening to RAS, P53 and other genes, and there will be loss of normal growth control. The cells grow abnormally, causing tumor. In Ayurveda, the samprapti occurs due to various causes, such as repeated exposure to environmental toxins, which are dosha-provoking factors in deeper cellular level. There will be vada, kapha, vriddhi, and pitta chaya. It causes microinflammatory changes, which disturbs the cell components of acne. Due to this, the acne produces only poorly formed tissues. So, as per Ayurveda, cancer is a tridoshaja vyadhi, which has the capacity to spread due to the interplay of abnormal vada, pitta, and kapha. Almost all Ayurveda texts have given maximum importance to kapha in the development of arbuda. So, Shrudha has mentioned that due to excess of kapha, arbuda does not separate. Thus, it seems justified to postulate the excess of vitiated kapha in the body. It might be responsible for the precipitation of cancer. The others involved in arbuda are rakta, mamsa, and meda. Coming back to the clinical features, it may be a bleeding, painless ulcer or swelling in the tongue, which later become painful. The pain in the tongue may be due to the infection of ulceration or due to the involvement of lingual nerve. There will be excessive salivation. The saliva is often blood stained. There will be dysphagia and disarticulation. Disarticulation is the difficulty in talking. There will be fetor oris or halitosis due to the infection and necrosis in the oral cavity. Change in voice will be there. Particularly, it occurs in posterior 1/3 tumors, and there will be palpable lymph nodes in neck when it is fixed to underlying tissues in advanced stages. These are the investigations. In wedge biopsy, the specimen for investigation should be taken from the edge of the ulcer. It can be taken under local anesthesia. Then orthopantomogram, it is a common radiograph which is used to identify the hard tissues of the oral cavity and surrounding skeletal structures. Then fine needle aspiration cytology of lymph nodes, indirect and direct laryngoscopy, etc. can be the investigations. Then a CT scan should be used to see extension of posterior third growth. MRI is excellent for identifying the extent of tumor infiltration. Chest X-ray to see if there is any bronchopneumonia. These are the treatment options: surgery, radiotherapy, and chemotherapy. First one is the surgery. Surgical removal of all or part of the tongue is termed as glossectomy. We can do partial glossectomy, hemiglossectomy, subtotal or total glossectomy. Partial glossectomy is indicated when the lesion is less than 2 centimeter and it is confined to the lateral border of tongue. In hemiglossectomy, if the tumor is larger than 2 centimeter, we can remove the anterior 2/3 of the tongue on one side up to the sulcus terminalis. Very extensive growth involving the entire tongue are given radiotherapy initially to reduce the size of tumor, and surgery is done then. Total glossectomy carries significant mortality and morbidity. These are the post-operative management. Control of infection and edema, regular mouthwash, maintaining the airway, prevention of aspiration, and nutrition should be provided through nasogastric tube. Then the second treatment modality is radiotherapy. In radiotherapy, small primary tumors are treated by curative radiotherapy. Large primary tumors, primarily radiotherapy is given and then surgery is done. Advanced primary and secondaries in the neck controlled by palliative external radiotherapy, and post-operative radiotherapy is done in large tumors to reduce the chances of relapse. The third treatment modality is chemotherapy, which is given in post-operative period and also for palliation. The drugs used are methotrexate, vincristine, adriamycin, bleomycin, mercaptopurine, etc., which is given either intra-arterially or through IV and also given orally. Coming to the Ayurveda perspective, we should approach a condition of carcinoma in 4 perspectives. The symptoms or conditions persisting should be addressed first. So primarily we can go for symptomatic treatment. Then Prakriti Sthapana Chikitsa. We know that the cancer is a condition where abnormal multiplication of cells occurs. Here we must bring back the cells into normalcy. Then comes Rasayana Chikitsa. For regaining the restoring the health debilitated due to disease, Rasayana Chikitsa should be done. Along with it, Naishtiki Chikitsa, which provides emotional support, including yoga, pranayama, meditation, etc., should be done. The general line of treatment for Arbuda is Snehayet Shuddhi Karmam Cha Tikshne Shuddhasya Lebanam Tadapi Apakvam Chitvena Stide Rekte Aknina Dahet Sadhu Shesham Sasheshabi Punarapyayade Dhruva. So first, Snehana, Mrudu Swedana and Mrudu Virega should be done, which causes cell cleaning, and then Tikshna Lepana should be done for wound cleaning and healing. Rekta Mokshana should be done. Chedana or Shastra Karma should be done, as it is the counterpart of surgery. Then Anushastra Karmas like Agni, Kshara can also be done. It is better to select an integrative approach in cancer. That is, we have to do Ayurvedic treatment along with chemotherapy and radiation therapy. Although allopathic treatment of cancer is considered valuable, from Ayurvedic perspective, it results in degeneration and depletion. It is due to Dhatu Kshaya, which ultimately results in Oja Kshaya. One of the aftermath is that the whole body is going to feel absolutely devitalized, exhausted, and unable to cope with day-to-day activities. Nutrients should be affected because of the cellular life. That is, the Dhatu Agni will be almost flickering. There will be a chronic state of low-grade inflammation in the system. In this stage, we can do treatment which are correcting Agni, restoring equilibrium, and rejuvenative. Certain yogas which will be beneficial in the treatment of cancer is being mentioned here. Churnas like Avipatti Churna, Ashta Churna, Hinkuachadi Churna, etc. Gugulu preparations like Kanjanara Gugulu, Trifala Gugulu, etc. Kashayas like Gugulu Tiktaga, Indukanda, Nimbamradadi, Panchatiktaga Kashayam, Varanadi, Trayandyadi, etc. The preparation Gugulu Tiktaga have tremendous effect on cancer. Gruda preparations like Gugulu Tiktagam, Indukandam, Varanadi. Rasa Ushadis like Rasa Sindura, Nityananda Rasa, Arogyavardhini Vadi, Chandramayuta Basma, etc. And Rasayana preparations like Chavana Prasha, Brahma Rasayana, and Akastya Rasayana. Thank you.
Thank you, doctor. So next I ask Dr. Rasika Kumar.
Yes,
I invite Dr. Rasika.
Hello, ma'am. Hello, ma'am.
Yes, you are audible, doctor. Dr. Rasika. Hello, Dr. Rasika. Doctor,
Hello.
please unmute yourself.
Hello.
Yes, you are audible, doctor. Doctor, you are audible.
My screen.
It
Hello.
started sharing, doctor.
Okay. Good evening, everyone. My name is Dr. Rasika Chaugule, PG Scholar, Department of Panchakarma in ADMC Ashta. My topic name is different types of Pindaswed. Introduction. The word Pinda means bolus. The Pindaswed refer the sedation performed by bolus of drugs. It is Sagniswed variety. Terminology used by Charak is Sankarswed. Rukshaswed and Snigdhaswed are the types. Various Pindasvedas in Rukshasvedas were Valuka Swed, Ruksha Churna Swed, Lavan Pinda Swed, and in Snigdha Swedas, Shashtishali Pinda Swed, Jambir Pinda Swed, Churna Pinda Swed, Patra Pinda Swed, and Kukudanda Swed. We can see Patrapinda Swed. This is the type of Sweda wherein the Swedan is done by heated potli containing leaves of medicinal plants. Materials: leaves, scraped coconuts, sliced lemon, cotton cloth, tags, vessels, oil, towels, saindhav, rasna churna. Drugs required. The following plant
Hello,
are.
doctor.
Hello.
Doctor, slide is not moving, doctor. It is in first slide.
Wait.
Okay, doctor. Okay, now moving, doctor.
Yes, up. Hello.
Hello, doctor. Uh,
Hello.
Doctor, here the slide is visible, doctor. Yes, doctor. Now moving, doctor.
Okay. Drugs required. The following plants are generally used: Eranda, Arka, Dhatur, Shigru, Varuna, Vasa, Karanja, Mithika, Amlavetas. Preparation of potli. Grinded coconut was slightly fried in an iron vessels and kept apart. Fry small pieces of lemon with mediated oil. Fresh leaves of plant are firstly cut into small pieces and fried on pan till mixture become reddish color. In some cases, rasna, mithika, etc. Vatanashaka powder are used. This mixture is divided into two parts, put into two pieces of cloth and made potli. It is a procedure. In Purva Karma, ask the patient to sit on droni, abhyanga, with the prescribed oil in 7 positions: sitting, supine, right lateral, prone, left lateral, supine, and sitting. In Pradhan Karma, ask a patient to sit on droni. Patra potli made warm. Potli are gently applied on affected part after checking of temperature. Heat of potli should be maintained throughout the procedure. Pind should be changed in every 3 days. In Paschat Karma, hot water bath after sweat gets subsides. Apply Rasnadi Churna over the scalp. In indications: armvat, osteoarthritis, muscular cramps, cortisol, stiffness of joints. Complications: skin rashes is a common complication for this. Apply madhu and ghrita. Then Shashtishali Pindaswed. Shashtishali Pindaswed is a type of Bruhan Swed. Cooked Shashtishali is used to induce sweat. Materials: Shashtishali, root of bala, water, cow's milk, cotton cloth, vessels, oil, rasnadi churna, and towels. Preparation of potli: take 750 gram of crushed root of bala and add 12 liter of water in it. Put it on mild fire and reduce up to 3 liters. Take 500 gram of Shashtishali in vessels. Add 1.5 liter balakvat and 1.5 liter milk to it. Keep the vessels on the mild fire until rice get cooked well to a semi-solid consistency. Divide it into 4 equal parts and prepare the procedure of Shashtishali Pindaswed. In Purva Karma, proper position to patient. Talam is kept on the patient's scalp. Snehan with the prescribed medicated oil in 7 positions. In Pradhan Karma, potli made warm by keeping in hot mixture of milk and quat on the mild flame. Attendant massage the body with it. Direction of massage should be downward and begins from neck. Position of Pinda Swed is same as the Abhyanga 7 postures. Massage in each posture is maintained for 15 minutes. In Paschat Karma, scraping of rice paste involved with the prescribed oils, hot water bath within 5 minutes after the application of oil. In indications, various system diseases, nervous system diseases, spinal cord degeneration, chronic rheumatism, degenerative disorders, Fakka rog, muscular dystrophy, muscle wasting, fatigue syndrome, restless uh, then Churna Pindaswed. Materials suitable churna, cotton cloth, tag, vessels, towels, Rasnadi churna, medicated bath powder. Drugs required kulatha, til, devdaru, rasna, kol, haridra, methika, nimba and saindav. Procedure of Churna Pindaswed. Prepare the potli by adding the churnas in it. Potli is heated in vessels containing Nimba Taila. Massage on the affected part. After massaging is over, wipe off the oil. Apply the Rasnadi Churna. Take a rest for 1 hour. Take bath with medicated bath powder. In indication, disease of Vata and Kapha, arthritis, lumbago, sciatica, neurological disorders. Then Jambir Pindaswed. Potli prepared by Jambir so as to provide swed. Materials, suitable oils, cotton cloth, tags, vessels, towels, Rasnadi churna, medicated bath powder. Drugs required lemon, coconut, haridra, mithika, taila, til taila, saindhav. Preparation of potli. Take 2 or 3 lemon, cut them into small pieces. Add equal quantity of coconut and then fry on pan till the mixture gain reddish color. Tie in potli. In some cases, rasna are added. Procedure same as patra potli swed. Then in indication, amvat, osteoarthritis, muscular cramp, avbahu, stiffness of joint. In complication, skin rashes is common complication. For this, apply madhu and ghruta on it. Then kukutanda swed. Materials Jambir, Kukutanda, Rasna Churna, Mithika, Saindhav, Erandatel, Vessel, stove, cotton cloth. Preparation of potli. 25 ml is taken in pan. Add some pieces of jambir and fry till become soft. Cut, open the eggs and add to pan. Fry till it becomes cooked. Then add remaining powders one by one. Divide it in two parts and tie the potli. Procedures same as patra potli swed. Indications अवबाहुक, संधिगतवात, मन्यास्तंभ, अर्धित, traumatic condition, muscular weakness, वातव्याधी, पक्षाघात. Then Valuka Pindaswed. Materials sand, coconut, cotton cloth, tag, vessel, towel, attendant. Indications आमवात, उरुस्तंभ, मेदोरोग, ग्रंथी.
Excuse me, doctor.
Yes.
Doctor, your time is exceeding.
Okay.
Please speed up.
Yeah. Then this is the procedure of Valuka Pinda Sweth. Then benefits of Sweth: relieve the pain and stiffness, relieve the swelling related RA, expel the morbid arm, Vat, Kapha and Med. Correct the fat metabolism by removing sweat, which is said to be metabolic waste of fat. Thank you.
Thank you, doctor. Next, I invite Dr. Trupti Dattu More.
Yes, ma'am.
I invite Dr. Trupti.
Yes, ma'am. Am I audible, ma'am?
Yes, doctor, you are audible.
Okay, ma'am. Is my screen visible, ma'am?
No, doctor.
Okay, ma'am. Can you share my screen, please?
Doctor, sorry, we are unable to share the screen now. Doctor, please be there. You can present next.
Okay, ma'am. Okay.
Now I invite Dr. Neeraj.
Yes, ma'am. Am I audible, ma'am?
I invite Dr. Yes, doctor. Dr. Neeraj. It's visible, doctor. Please start. Doctor, unmute yourself. Dr. Neeraj, please unmute yourself.
Hello.
Yes, you're audible. Please start.
Okay. Thank you, ma'am. Good evening, all doctors. Myself, Dr. Neeraj, second year PG scholar from Sri Jendra Saraswati Ayurveda College, LM Department. And my presenting topic is Cosmetology and Ayurveda under the guidance of Dr. K. Vasudeva Reddy, HOD Department of Shalatantra in the same college. Introduction. start from mother womb, Dincharya, Ratricharya, Ritucharya with the practice of medicinal herb and minerals, achieving beautiful health by Ayurveda through procedure of Lepa, Krishinikarna, Lomsthana, Vesthapan Yoga, Yumne Pidika Nasak and Kikishhar Yoga, Pandu Karma, Netra Prasadan, Kes Ranjan, etc. Through surgically, lobuloplasty, rhinoplasty, oroplasty, well explained by the Shishruta as Sandhan Karma. The word cosmetic is defined as a substance meant to be rubbed, poured, sprinkled, or sprayed on, or introduced into, or otherwise applied to the human body for the purpose of cleansing, beautifying, promoting attractiveness, or altering the appearance. Human body function through various channel system called the srotas, containing both microscopic and the macroscopic structures such as the respiratory system, lymphatic, circulatory, reproductive, urinary system, and the nervous system. As these channels function as innumerable psycho-biochemical process and responsible for wellness and the beauty. Panchkarma therapy, rasayan therapy, lepam, shashtiv karma, or surgically wound healer, Jaloka is the preventive for healthy people to maintain and improve excellent cellular function, improve blood circulation, and curative for those experience diseases. Factor determining the beauty is Praman, Prakriti, Chaya, Sar. Factor contributing towards the beauty is Dosh, Dhatu, Agni, religion, age, and sex. And factor improving the beauty is diet, science, Snan, Abhyanga contributing in the cosmetology. Now come to the concept of beauty in Ayurveda. Ayurveda beauty is determined in the term of the Prakriti, Sar, Sahanana, Tvaka, Pramana, or Dincharya, Dirgha Ayu Lakshana. The arm makes a person ugly, and Shodhana is the best therapeutic intervention to eliminate body toxin. Snehana and Swedana bring moisture to our skin elasticity, and rejuvenate skin tissue. Ayurvedic massage and the cleansing procedure. These treatment lead body long-term rejuvenation. Many interesting factors such as the age, immunity, nutrition, hygiene, circulation, etc. are totally responsible for the appearance and the health of the skin. Concept of the tvaka and the beautifying enhance the measurement. The concept of varna chaya prabha. Varna means outward appearance, exterior form, figure, shape, color. Color of the face, good color or complexion, luster, beauty, and the include all parameter of the healthy and the radiant skin. Chaya is the entirety which circumscribes the varna, and prabha is the highlighter of the complexion. Skin care, acne care, these are the measurement of the beauty. Anti-aging, Karshini Karna, Pandu Karna, hair care, hair coloring, Rom Sanjana, and Lom Sthana, Sandhan Vidhi, role of Panchkarma, and the role of Rasayana. In this slide, I am describing the herbs due to the enhancing the power of the beauty, increasing, and as well as they also work as the wound healer and the glowing of the skin. Now come to the cosmetic surgical correction, Sandhan Vidhi. In Shishrut Samhita, for the first time, explanation of the techniques of the surgical correction, that is plastic surgery of injured and the amputated body parts like nose, ear, lips, and the cosmetic correction of the developmentally malformed. Acharya Shishruta well explained the lobuloplasty, Karnapali, Sandhan, Bandhan that are 15 and they're named as the Nemi, Sandhan, Utpal, Vallur, Asangik, Gandhkarn, Aharya, Nevodharmik, Vyovarjim, and Kapal Sandhi ka Ardha Kapal Sandhi, Sankshipt, Heen Karn, Valli Karn, Yasti Karn, and Kakost, used for the correction of the structural deformity of ear lobule and the reconstruct it by the Bandhan Vidhi. If impure blood, more quantity is coming from the lobule of the ear, do not do Sandhan Karma, otherwise patient may suffer from the Pripot Roga. After the Karnapali Sandhan Bandhan, 10 type of complication occurred, name as Utpatak, Utputak, Shav, Amantak, Skanduk, Granthik, Jambul, Sravi, and Dahavan. Nasha Sandhan Vidhi, that is rhinoplasty. According to Arya Shushruta, if on the nose, take a leaf of the same size of Kapola and cut the mass piece same size. Do Vilekhan Karma of injured nose front part, mass piece placed on the injured part with the help of the Sivan Karma. Insert Erandanar in the both nostrils, keep nose lift up, and Bandhan Karma should be done. After that, sprinkle powder of the Lal Chandan Muleti Rasot on the injured area. Cover with a cotton swab and Sichan Karma with the Til Telam.
Ostsandan, oroplasty, injured lips, hair tip, and the cleft lip. Reconstruct same as the Nasa Sandhan karma, but the difference is don't use the arundinale. Now come to the that is reconstructive surgery and the plastic surgery. Facial implant are the currently used to augment skeleton dimension to restore facial contour by the expanding area where the facial volume loss occur, or to work in the combination with the radiodectomy or other procedure as part of the more current multimodality approach to the facial rejuvenation surgeries. The common implant procedure include the cheek augmentation to balance the effect of the malar hyperplasia, mandibular augmentation to create a stronger lateral dimension to the mandible profile and better nose-chin relationship. For the implantation, for the rebuilding and the reconstruction, the injury part, the enhancements of the beauty, that there are two methods, that is grafting and flaps. That is grafting having two methods, that is with thickness skin grafting, that is tear grafting, and the full thickness skin grafting is wolf grafting. And another one is the composite skin grafting, that is usually most usually skin and fat, and another one is skin and cartilage, often taken from the ear margin, and the useful for the relieving is of the nose, eyelids, and the fingertip. Shruta Tominasa Sandhan, missing nose part rebuilt by the same is cut of mass and place it and do the bandage karma. This is the ski surviving battle, that is ambition of plasma at wound site and osmosis connection into the blood capital in growth. Healing process, blast maturation. Implant biomaterials that are the there are uses of the fibrous tissue growth, enhancing implant the stability, use oral maxillary ears, etc. And now come to the flaps. Flaps are tissue that are transferred with the blood supply, bringing
Hello, doctor. Hello, Dr. Neeraj. Can you hear me? I think it has some network problem. Next, I would like to invite Dr. Tripti Datumore for the paper presentation. Dr. Tripti, are you there?
Yes, sir.
Okay, doctor.
Sorry, sir, I am unable to share my screen. Can you share it, please?
Doctor, please start the session, doctor.
Okay, sir. Good evening, everyone. Myself, Dr. Trupti More, PG second year student of the Department of Shalakyatantra from SST Ayurvedic College, Sangamner. My paper presentation topic is the role of Achyutan in Netra Rogas. Eye is a God gift to all living organisms to see the wonderful world. So it is our duty to take care of our eyes from harmful diseases. Kriyakalpas, the local ocular therapeutic procedure, is the group of special methods of drug administration locally into the eye for treatment of eye diseases. They provide nourishing effect to the eyes and improve the visual acuity. Tarpan, Putpak, Achyutan, Anjan are the Kriyakalpas which are beneficial for eye health. Among these, Achyutan plays major role to treat eye diseases and keep eyes healthy. Etymology: the installation of the few drops of medicines to the open eye from the height of 2 anguli is called as the Achyutan, which is helpful in the initial stages of Netra Rogas, where doshabala is less. Achyutan Vidhi. First, Purva Karma. Patient should inform about the procedure. Patient should be lying down in the supine position. Second is the Pradhan Karma. The eye is opened by stretching and pressing the Apanga Pradesh by left hand, and Achyutan Dravya is taken in the dropper by right hand and instilled in the eye near the Kanenika Sandhi from the height of 2 angulas. Third is the Pachat Karma. The fluid flowing out of the eye should be wiped out with the cotton, and Mrudu Svedan was given by a pichu dipped in the Sukoshna Jal. Netra Rogas and Achyutana type. First is the Vataj Netra Rog, where the Snehan Achyutan is preferred. 10 drops of Achyutan Dravyas are instilled In Pitta and Raktaj Netra Rog, Ropan Achyutan is preferred. 12 drops of Achyutan Dravya is used. Third one is the Kafash Netra Rog, where the Lekhan Achyutan is used and the 8 drops are used. In Charak Sahita, various yogas given for Achyutan on the basis of Dosha Dushti. In Vatash Netra Rog, Erandamul, Jayanti, Bruhati, and the Bilvadi Panchamul boiled with water are the drugs used. Then the Pittash Netra Rog, Prithvika, Darvi, Manjishta, Laksha, and the Madhu boiled with sugar and water. Kafash Netra Rog, Shunthi, Trifala, Musta, Nimba, and Vasa boiled with the water. Then the mode of the action of Achyutan. The medicine dropped into the channel of the head, nose, eyes, eliminates the malas from upper part of the body and destroy the diseases from the root cause. Importance of Achyutan. Achyutan is the first line of the treatment in the eye disease which will relieve the Ruka Tod, that is the painful condition. Kandu means the scratching. Gharsha means irritation or the foreign body sensation. Ashru, excessive watering. Daha is the burning. Rag means the redness or the congestion. Paka or shofa means the features of the inflammations. When doshas are not severely vacated and the disease is in the early stage, it is beneficial, but it should be done on the 4th day of disease manifestation after the ama lakshanas are the settled down. Thank you.
Thank you, Dr. Tripti. Next, I invite Dr. Bijna P for the paper presentation. Dr. Bijna, are you there? Hello, Dr. Bijna P, are you there?
Hello, am I audible?
Yes, doctor. Audible, doctor.
Hello, am I audible?
Audible, doctor. Your voice
Okay.
is clear, doctor. Doctor, please share the screen, doctor.
Sir?
Hello, Dr. Bijna. Doctor, your voice is breaking, doctor. We can't hear your voice, doctor. Hello, Dr. Bijna. Doctor, we can't hear your voice, doctor. Your voice is breaking, doctor.
Hello, sir.
Yes, doctor. Now voice. Okay, doctor.
Is my screen is visible, sir?
Not visible, doctor. Hello, Dr. Bijna.
Hello, sir.
Doctor,
Sir,
you have any problem with screen sharing, doctor?
yes, sir.
Okay, doctor. I will share for you, doctor.
Okay,
Doctor,
sir.
please start the session, doctor.
Okay, sir. Sir, I am audible.
Yes, doctor. You are audible, doctor. Please start, doctor.
Okay, sir. Good afternoon, all. I am Bijuna from Department of Shalyatantra, VPSV Ayurveda College, Kottakkal. Ayurveda is a science which has given importance to diet and regimen as a part of Chikitsa. The branch Shalyatantra, which describes the surgical management of diseases, also give much importance to diet and regimen. The concept of Patya and Apatya has a major supportive role in Chikitsa. Following Patya and avoiding Apatya is enough to cure the disease. Today, we are going to discuss the scope of Patya and Apatya in the management of surgical diseases. What is Padya? The word Padya derives its origin from the root word Pada, which literally means a way or channel. That which does not create any trouble and which is pleasant to the mind is known as Padya, which create troubles and unpleasant to the mind is known as Apatya. The importance of Patya and Apatya in Ayurveda can be deduced from the fact that Acharya Charaka has stated Patya as a synonym of Chikitsa. So next slide, please. Patya not only means ahara, it includes both ahara and vihara, wholesome to the body. In Charaga Vimanasthana, in conditions of Chinda, Shoga, Krodha, Dukushaya, and Ratri Jagarna, even the small amount of Padyahara is not get digested. So Padya Viharas also have equal importance as Padyahara. Harida mentioned the importance of Patya and Apatya as Sada Padyam Prayoktavyam na Apatyena sa Siddhyati, Aushadena Vina Padye Siddhyade Bishakutame, Vina Padyam na Sadhyasya Daushadaram Shadairabi. If a person ignores the concept of Padya and Apatya and devote Padya, illness will never leave the body. Hence, one should use Padya according to his or her physical and pathological condition. Even in the absence of medicine, if patient takes Padya according to the disease, he will become healthy. But if he takes regular medicines and avoid Padya, the disease will never cure. Up to this, we discussed the concept of Padya and Apatya and its importance in Chikitsa. Now coming to our topic, scope of Padya and Apatya in the management of surgical diseases. First, we can discuss about Vrana. So next slide. Vrana and its management has been a prime concern since ancient times. Acharya Sushuda has written almost half of his treatise describing various aspects of wound healing. He has devoted the entire chapter of Pranidopasinium dealing about nursing of the wounded person, and it is more focused on Patya and Apatya. Jirnashali is considered to be Patya in Vrana, which is Tridosha Nashaka and Lagu. Yava and Goduma is said to be Patya for Pranida by Acharya Vagbada. Yava is Pitta Kapha Shamaga and a Sara Gunatmaga. In addition to that, it has an anti-inflammatory property. Goduma is Vada Pitta Shamaga, Anuloma, and Jivaniya and contain carbohydrate, protein, and fibers, which are essential for wound healing. Jangalamamsa and Gogrida are said to be Padya for Vranida by Acharya Sushuda and Vagbada. Jangalamamsa is Lagu and Balya and rich in proteins. Proteins have highly significant role in collagen synthesis. Gogrida is a rich source of vitamin A and D and are essential for collagen synthesis. In Vaishajya Ratnavali, Patya for Vranida. It is Vrananashaga and contain omega-3 and 6 linolenic acid. Both plays important role in prostaglandin synthesis. Acharya Sushuda mentioned Sriddha Jala, which is Deepana, Pajana, and Lagu. Saindava and Triphala are considered to be Padya. Triphala has Vrana Ravana property and Saindava is Avidahi and Tridoshakna. So next slide. Navadanya to Takranta Varga are considered as Apatya for Pranida and named as Dosha Sanchanana Varga. Navadanya and Tila are mentioned as Apatya because both are Abhishyandi. Kalaya, Kulatta, and Nishpava are also Apatya for Pranida as they vitiate Vada, Pitta, and Rekta doshas. Because of the Ushna, Tishna, and Ashugari Kuna of Madhya, it vitiates Rekta and Pitta dosha. So Acharya Sushuda mentioned Maireya, Asava, Arishta, Sidhu, Sura as Apatya. So next slide. Adra, Anuba, and Audaka Mamsa are mentioned as Apatya for Vranida. These are Abhishyandi. It impairs digestive power. Shushka Mamsa and Vasa are Guru. So both are heavy to digest. Curd is Adi Abhishyandi and Vidahi in nature. It vitiates Tridosha and Rekta. Payas is Vishtambi and Kapha Vardhaga. In Sushuddha Samhita and Vaishajya Ratnavali, Pishta Vikriti is mentioned as Apatya because it is Vidahi and vitiates Kapha and Pitta dosha. So next slide, please. So next is Patya. Next is Bhakna. Here Patya is mentioned as Shalir Mamsarasa Kshiram Sarpir Yusham Satina Ja Brahmanam Cha Annapanam Syat Deyam Bhaknaya Janada. Mamsarasa, Kshira, Sarpi, etc. are considered Balavadaga Ahara. In addition, Kshira is Shadakshina Hita and Jivaniya. Sarpi is Santanakara and Shali is Tridoshakna. Recovery from bone fracture is very painful, and with the help of an appropriate diet and regimen, one can speed up the recovery. Calcium, being the main component of bone, can be consumed in the form of milk. Protein is essential to rebuild muscle, and zinc contains the necessary chemicals which helps to rebuild the bone. Mamsarasa is a rich source of protein And satina or lentil is a rich source of protein, fiber, zinc, vitamin B complex, etc. Intake of Shara, Amla, Lavana, and Kadu causes destruction of tissue, especially in conditions like fractures, where the person is already in Shinavastha. Strenuous activities like Vyayama and Maiduna are also delay bone healing. So next slide. Ajari Vakbada has told that yoga surve abhimando akno. That is, all the diseases are primarily caused due to improper digestion. The nature of food intake, frequency of meal, and fluid intake plays an important role. Ajari Sushudha mentioned Degaroda Stri Prishtayanya Nutkudagasana Yadasam Doshalam Chanam Ashasu Parivarjayat as Apatya in Ashas. Degaroda is considered as one of the Nidanas for Ashas, which leads to constipation. Trisanga, Prishtayana, and Utkudagasana causes local congestion and improper vascular flow to the perianal region. Viruddha, Vishtamba, and Guru Ahara leads to disruption of the digestive functions. Patyahara, like Yava, helps in stool formation, and Snigdha Madhura Guna of Goduma prevents loss of moisture in the stool. Shali is rich in soluble fiber, which helps in easy evacuation of feces. High fiber food increase intestinal peristalsis, promote the expulsion of stool, which at the same time become much softer, so it does not damage the walls of anus. The next slide. The patient of Bagandhara should avoid Vyayama, Maiduna, Koba, Prishtayana, and Guru Ahara for 1 year after the healing of fistula wound. Exercises increases the intra-abdominal pressure should be avoided. Maiduna and Prishtayana cause local congestion and improper vascular flow to the perianal region. Koba, Shoga, etc. cause disruption of the functions of GIT, leads to slow movement of bowels through the large intestine, results in hard bowels. Guru Ahara also cause constipation. So next slide. Ayurveda explains urinary stone under the heading of Mutrashmari. Shali, Yava, Kushmanda, Ardraga, etc. are considered to be Patya in Mutrashmari as per Yogarek Nagara. In addition to that, Gokshura, Pashana Beda, Shigru are also mentioned as Patya in Vaishyaja Reknavali. Kulatta and Kushmanda have Ashmarikna property. Pashana Beda possesses Vedana property. Pashana Beda and Kushmanda have Mutra Vishodhana property. Kulatta, Shali, and Sigru have diuretic properties. After the surgical management of Mutrashmari, one should avoid strenuous activities like climbing, swimming, etc. Overconsumption of Guru, Vishtambi, and Ruksha Anapana are also restricted. The next slide, please. So, coming to the conclusion that Patyas and Apatyas are mentioned not only for preventing the disease progression, but also for maintaining a healthy life. Nowadays, the Ashas, Bagandhara, and Ashmari are very common, and the main cause for that is improper diet and regimen. In all diseases, irrespective of Bheshaj Sadhya and Shastra Sadhya, Apatyas should be avoided because apatya is predisposing factors for various diseases and helps in fast progression of pathophysiology. The concept of Padya is very basic but most important in Ayurveda, which seems to be useful and must be practiced clinically in today's era. Thank you.
Thank you, Doctor. Next, I
Thank you,
invite Dr.
Doctor.
Tasni Das for the paper presentation. Dr. Tasni Das.
Yes, sir.
Okay, Doctor, please share the screen, Doctor.
Share screen. Desktop plan. Sir, can you please share the screen?
Okay, Doctor, 1 minute, Doctor. Dr. Tasneedas, please start the session, doctor.
Good evening, everybody. I'm myself Dr. Tasneedas from Department of Rasayana Ajiramna from Sri BMK Ayurveda College, Pelaguri. My role of Virechana for the management of Kiriba Kushta. 28-year-old male patient came to the OPD with the chief complaint of. Sir, next slide. Sir, next slide. Black and reddish discolored patches with itching on bilateral upper limb and lower limb associated with the papules and macules on the trunk. Patient was apparently healthy till 2011, and after that patient developed a boil on the leg and he tried to access the boil with sharp instrument and then gradually developed a black and reddish discolored patches on bilateral upper limb and lower limb. For that he's taken modern treatment and Ayurvedic treatment, but no relief for this symptom. The next slide. No complaint of hypertension, diabetes, or thyroid. For the above complaint, patient has taken external application and internal medications in OPD level, but he didn't got any relief, and the symptoms are aggravating. His father has also similar history. So personal history was normal, and diet is vegetarian. His daily usage of curd is there, and milk along with the dinner he is using. Ashtasthana Pariksha. Next slide, sir. These are the Dashvidha Pariksha and Vigrudha is Vata Kapha, YS Yavana. General examination ability is moderate and no lymphadenopathy or cyanosis or edema. Systemic examination per abdominal examination, inspection, mild blackish red papules on the skin and no tenderness or organomegaly by palpation. Examination on the skin, no lesions. Number of lesions numerous. Size is 5 centimeter to 15 centimeter and shape is oval and polygonal. Surface is rough and dry and mild scaly. Color is blackish red and arrangement is solitary. Koebner phenomenon present, auspix sign absent, Candlegreen sign negative, and Werner absent. Nidana Panchaka, Nidana is Adi Pella Pravrta and Virdana Sevana and Adi Vyayama and Thupa Sevana. Pururupa Vivarnya, Kando, Adi Parisha, Asveda and Adi Sveda Rupa is Shavarna, Varna Pidaka and Kando. Upashaya is Saushal Sevana and Upashayan is Navina Anna, Dadi, Masha and Vegadharana. This is the pathophysiology. And Samrapti Adipala Pravrta due to Bija Bhaga Avayav Drishti and Vadadi Dosha Prakopa, Tridosha Prakopa, and leads to Tok Mamsa Recta Lysiga and Shaidilita, Dosha Dosha Samoshana and Sthana Sanstray of the Dosha in Toka Dhatu and leads to Kushtaroga Utpatti. These are the Samrapti Gadagas. Dosha is Vata Kapha. Then Vyadhi Vavicheda. This is Kiriba Kushta, Shavarna Pidaka and Kina Karasparsha. Then Eka Kushta, Malsishaglopama, and exclusion criteria is Asveda and Maha Vastu. Sitma Kushta, Tamratana Pidaka, only found in Ura Pradesha is exclusion, and Visarapa Vivida Varna Pidaka is inclusion, and exclusion Ekta Pradhana and Prabala Vedana. In Vicharchika, inclusion is Shavarna Pidaka Kandu, and exclusion is Bahusrava. Diagnosis Kiriva Kushta, Shavarna Pidaka, Kinakara Sparsha, Parushya, plaques, psoriasis, red patches, inflamed skin, scales, and itching. This is the Chikilsa Sutra of Kushta, Vadutreshu, Sarpivamanam, Shleshmotreshu, Kushteshu, Pittotreshu, Moksha Rektasya, Virejanam Chagre. Next slide, sir. These are the treatment procedures we have done. First day we have given with the Hinkwashtaka Shuna and Chitragadivadi. And next day we started Snehapana with the Tikta Kruta 30 ml. And on the next day, dose is increased into 50 ml. Then 10% decrease of dryness of the skin and changes in the lesion. Next slide, sir. On next day, same. On 50% of decrease in the dryness of the skin on the 2nd July. On on 10th day of the treatment, we got 85% of decrease in the dryness of the skin and 90% reduction in the itching. We have given Trivitlegia for Virechana on the 10th day, along with the Trifala Quadra 100 ml. These are the pictures on the 3rd day of the treatment started. Pictures on the July 2nd and pictures on the July 5th. And this is pictures on the 11th day after treatment. Mode of action of Virechana, Deepana Pachana is done prior to the any Shodhana therapy to achieve the Nirama condition. Snehapana in Arohana Krama is important for loosening of the dosha dosha bonding and therefore helps breakdown of dosha and doshi samurjana. Snehana and Svedana, this procedure helps in melting of doshas at the site of sthana samstra and virejana. Dravya carry the melted doshas to the gut and expel out through the alimentary canal by the process of purgation. As Kushta is Behudosha Vyadhi and Virechana helps in expelling dosha through the alimentary canal. Mode of action of Virechana. Let's see. Any discussion in form of Kushta is having impact on body and mind, and this case studies the evidence for the effective management of Kiriba Kushta by Ayurvedic protocol. Shodhana Karma helps in removing the doshas from the roots and prevent the reoccurrence by the eliminating doshas. Shamana Ushadhi and Dasana plays a vital role in alleviating the symptoms. In this case, patient has got about a 90 to 85% improvement. This is the research updates. 22-year-old female patient came to OPD with the chief complaint of white scaly patches present all over the head and associated with the severe itching since 1 year, and brownish red patches with the white scaly lesions of lower back and abdomen associated with itching since 1 year. We have given Shodhana therapy and Shamana therapy treatments. And Ayurvedic, hence it is concluded that Ayurvedic principles are effective in the management of psoriasis, followed by Patya, Ahara, Vihara, Achara, and this helps to control the recurrence of disease and maintain health. Thank you.
Thank you, Doctor. Next, I invite Dr. Meghasri B for the paper presentation. Dr. Meghasri, are you there? Hello, Dr. Meghasri, are you there?
Hello, am I audible, sir?
Yes, Doctor, audible, Doctor. Please share the screen, Doctor.
Okay. Is my presentation
Yes,
seen,
Doctor,
sir?
your screen is visible, Doctor.
Welcome you all to the presentation of. Can I start, sir? Hello.
Yes, please, Doctor, please start.
Welcome you all to the presentation of mine on the topic Sutikopachara in Karavali. Myself, Dr. Meghasri, first year PG scholar, under the guidance of Dr. Ramadevi ji, HOD, Department of Prasuti Tantra and Stri Roga, STM College of Ayurveda, Udupi. As we all know, pregnancy is a beautiful part of women's life. At the same time, it's much important to restore women's health postnatally. Has a folklore saying quotes that health of a Sutika, if lost, can never be corrected. Sutika Paricharya is the rejuvenation therapy which involves the Shodhana followed by Brahmana. Difficulty faced by Sutika. In Sutika, like after the delivery, a woman undergoes prasava vedhana, rakta nishriti, there will be lots of blood loss, agnimandya, vata prakopa, dhatu kshaya, and dhaurbalya. And why Sutika Upachara is important? Delivery is said to be a rebirth of woman. Mother not only gives birth to a baby, but she herself gets a rebirth. At this point, if a woman undergoes Sutika Paricharya, she becomes Punarnava by achieving Agni Sandushana, Vata Shamana, Garbhashaya Shodhana, and Yoni Samrakshana. Sthanya Pravartana will be there and Sthanya Pushti will be there. If Sutika Paricharya is followed, she'll get a good quality of Sthanya and her body becomes rejuvenated. Views of Brihat rice. According to Brihat Rai, that is Charaka, Sushruta, Vagbhata have got a different point of view when it comes to Sutika Paricharya. Especially Charaka has told about the Ushna Jala Parisheka, Snehapana with any of the Chatu Sneha, Udara Veshtana, Sneha Yukta Yavagu, Ushna Jala Parishechana. Shushruta, wherein has told about Balatela Abhyanga and Vatahara Kashaya Upachara. Panchakola Chuna with Gudhotaka for 2 to 3 days. Sneha Yavagu or Kshira Yavagu of Vidari Gandhadi Gana Dravyas. Yava Kolakulatta Siddha Jangala Mamsa Rasa with Shaliodana. Vagbata has told about Abhyanga, Snehapana with Yavani Upakunchika Panchakola drugs. Udhara Veshtana after Yamaka Snehabhyanga and Yavagupana. Apyayana with Jangala Mamsa Rasa. What then is the gifts of Kashyapa? Kashyapa has given a customized gift when it comes to Sutika Paricharya. Like he has customized according to Desha, Kula, Satmya, and sex of the baby. Accordingly, he has given Paricharya. When it comes to Deshanusara, he has divided into Anupadesha, Jangala Desha, and Sadharana Desha. In Anupadesha, he has told Sneha should not be used in the beginning. Like soon after the delivery, Snehana is not given. And Agnivardhaka and Bhalavardhaka Mandhadi Prayoga has been indicated. Svedhana, Nivata Shayana, Ushnadravya Sevana is given. In Jangala Desha, Snehapana with Pipalyadi Kashaya has Anupana is indicated for a strong woman with the good Agni. And Sneha Yavani or Snigdhana Prayoga has been indicated for weak women with lesser Agni. And the Sadharana Desha, Sadharana Kriya has been mentioned. In Karavali, Karavali comes from the Kasargod to the Barkur of Udupi. In this belt, no, there is a tradition called Pedmedi Mipu. Pedmedi Mipu is making a woman bath soon after the delivery. Here we practice soon after the delivery, coffee prepared with the ole bella, that is palm jaggery, has been given to the woman. And after drinking the coffee, she is made to sleep by covering herself top to bottom with a thick blanket, that is Nivata Shayana or Svedhana. We can correlate to that, wherein which the acharyas have mentioned about Svedhana. Here we practice in this way. And after 1 hour of sleep, a hot, freshly prepared rice to be given to her. Vegetables like drumsticks, elephant food, rich curd, green leafy vegetables, sprouted grains are given. Especially when it comes to Karavali, it's rich in seafood. So fish like kane, that is ladyfish, balanjit, silverfish, anchors, kolataru, this fish curry is been given to her. Instead of ganji, freshly prepared rice is given. And we include lots of spices here in curry for the puerperal women. Has told by acharyas that Agni Deepana drug should be given. We use it like spices here. On 10th day after delivery, Leha prepared of garlic. Garlic has been given to her in BD doses for 3 days. There's a traditionally prepared dish called Omada Paladya. It contains Agni, Deepana and Pachana Dravyas. It has been prepared traditionally and given to her in TID doses. It helps the woman to deal with Sutika Makkala, Agnimandya, Vata Vaishamya. There's another traditionally prepared chicken dish, that is Korita Kashaya or Resa. On the 9th day after the delivery, has an acharyas have mentioned that the Sneha has not been given in the Anupadesha soon after the delivery. We don't give Sneha soon after the delivery. It's been given at around 6th to 9th day after the delivery. Chicken, which is of 3 to 4 month age, that is Kukkuta, 3 to 4 month age, has been taken, cut into small pieces, magneted, and added with the Deepana Pachana Dravyas like Shatapushpa, grinded it very well and added ghee, boiled in a mud pot, kashaya is prepared, or a resa, that is curry, is prepared and given to her hot. Pedmediga Meepauna enne, that is oil which is used for abhyanga, for the mother. It is containing of coconut oil, mustard oil, and other ajwain, manduka parni, all these leaves is been taken. This helps in dealing with wrinkles and skin rejuvenation. Other practices which are used are podi marda, belluli leha, wild shark fish soup, etc. So only few traditional practice like formulations I have mentioned in this presentation, but there are many numerous such formulations. Clear from this that principle behind all this traditional practice is Ayurveda. Ayurveda is so deep rooted that we practice it from ages together, knowingly or unknowingly. Thank you.
Thank you, doctor.
Thank you, doctor.
Next, I invite Dr. Tarun Bailey for the paper presentation. Dr. Tarun Bailey, are you there?
Yes, sir. Am I audible, sir?
Yes, Doctor. Audible, Doctor.
Yeah, sir.
Doctor, please start the session, Doctor.
Yeah, okay, sir. Good evening, everyone. I am Dr. Tarun Bele, PG third year student, Kaya Chikitsa Department from Gomantak Ayurvedic Medical Mahavidyalaya and Research Center. My topic is Ayurvedic Management of Sandhigatvat, a case study guided by Dr. Mithun Bondre, Associate Professor in Kaya Chikitsa Department. Abstract. Arvind has described about the pathogenesis and the treatment of various disorders in incidence of some have increased in the present scenario. One of them is Janu Sandhigatvat. It has similar condition like osteoarthritis. Osteoarthritis of the knee joint is one such a chronic degenerative inflammatory disease. disease uh, which has a great impact on the quality of the life of an individual due to sitting job, air conditioner, atmosphere, lack of proper healthy diet, traveling, obesity, etc. leads to this disease, which can be increasing day by day and poses a huge hindrance in daily activities of the sufferer like walking, dressing, bathing. It is disease of old age. It mainly affects weight bearing joints of the body, especially knee joint, hip, lumbar spine. Next slide, sir. Keyword संधिगतवाद जानु संधि शूल शोथ पिंड तेल स्नेहन महामाश तेल जानुभस्ती. Next slide, sir. Introduction. Sandhigatvad term is formed from three distinct words. Sandhi means a joint, Gat means particular place or sthan, Vat means one of the three doshas. Acharya Charak has made the first mention of the disease separately with the name Sandhigat Anila. Vat vitiating ahar and vihar like ruksh ahar, ati maithun, ati vyayam, sheet bhojan, dhatu chai and rog atikarshan is considered to be main causative factors. In Madhav Nidan, Sandhigatvat is described as a Hanti Sandhigata Sandhi Shul Atopurita, which means these disease damage joint having symptoms like pains, sensation, friction at joints. Sandhigatvat can be correlated with osteoarthritis. The prevalence rate of the osteoarthritis is 14.8%, in which knee osteoarthritis prevalence rate is 10.8, which is more than other. Case report. A 60-year-old female patient come in Kaya Chikitsa OPD of Kamakshi Arogyadam Gomantak Ayurvedic Mahavidyalaya Center, Shiroda, Goa, with complaint of Janu Sandhi shul and swelling over both knee joint, Chakraman Kashta, difficulty in walking since 10 years. She also complaining of Ansh Sandhi shul from past 1 year with Urdhhast va Pad Chinchmayan for 2 months and Chakraman Kashta for 2 months. The patient was taking allopathic treatment through um, not regularly but did not get relief. She was advised to get knee replacement surgery by orthopedic surgeon. Examination of the patient revealed Janu Sandhi Shoth swelling around both knee joint. The range of movement was limited to 30 degree. Patient is known case of hypertension, ischemic heart disease and hypothyroid from past 10 years. On examination, her pulse rate is 60 per minute, respiratory rate is 18 per minute, blood pressure is 130 by 90 mm of Hg. X-ray of the joint revealed joint space reducing in both the knees joint and mild osteopenia. The diagnosis of osteoarthritis was established on the basis of above findings and classical signs and symptoms. कुलाव्रत पित्रज अविशेष मात्रज स्वकुलज अविशेष आहार अतिरूक्ष लघु अल्प अन्न सेवन विहारज एक्सपोजर टू कोल्ड दिवाशयन. ऑन एग्जामिनेशन अष्टवेद परीक्षा नाड़ी 60 पर मिनट, शब्द क्लियर, बद्ध मल प्रवृत्ति, मूत्र सम्यक, जीवा निराम, स्पर्श उष्ण, दृक सामान्य एंड आकृति अवर. जनरल एग्जामिनेशन पल्स रेट 60, cyanosis negative, clubbing negative, edema present, SpO2 99%, BP 130/90, polar negative, pallor negative, temperature 96.7. Systemic examination, RS bilateral equal air entry with no added sound, CVS as soon as to normal, CNS conscious and oriented, periabdominal soft, non-tender, liver, kidney and spleen not palpable, pupillary reaction to light was normal. संप्राप्ति दोष वात कफज दूष्य रस रक्त शिरा अस्थि स्रोतस अस्थि व स्रोतस स्रोतोदृष्टि प्रकार संग एंड विमागमन अधिष्ठान संधि व्याधि मार्ग बाह्य मार्ग अवस्था जीर्ण अवस्था. Patient was giving the following treatment: Shodan Chikitsa, Sarvang Snehan with Pindatel after the Pindatel Sweden, given once in a morning for 15 days. After that, Patrapinda Swed given once in the morning for 15 days. Janu Basti with Mahamash tail at evening for 15 days. Urdhva Ansh Kati and Vakshan Sandhi. Bahu Baluka Potli Swed at evening for 15 days. Along with the above Panchkam procedure, following Shaman Chikitsa is given with Rasna Saptakvat morning and evening 20 ml after food, Yogaraj Google morning, evening, night, tedious after food, 2 tablet, and Triflachun 4 gram at night before sleeping with hot water after food. Pindutel. The reference of Pindutel are found to be similar in Charak Samhita, Ashtang Hridaya, Vacha Ratnavali, and Saharsh Yog. Pindutel is prepared from beeswax, manjistha, sargeras, and sariva, and sesame oil. These mystic lube works wonder in eradicating pain and calming the body. A gentle massage of Pindutel gives relief from the pain, burning sensation, redness, joint tenderness, and the inflammation that are commonly encountered by arthritis patients. It is specially recommended for gout arthritis and rheumatoid arthritis. Patra Pindaswed. It is a form of Pindaswed which is nothing but a Sankarswed of Acharya Charak. Nirgundi and Tiltel are the main drug used in Patra Pindaswed. Patra Pindaswedan having analgesic, anti-degenerative, and anti-inflammatory properties are used for fermentation of painful parts. Mahamash Tel. It is mainly contain Ushnavirya drug which has Vatshamak property due to its Madhur Ras, Madhur Vipak and Ushnavir, and Tiltel is its main ingredient which is considered best for treatment of irritated Vat. Tiltel is an essential analgesic and useful for wound healing, skin, ear, dental and hair problems. Useful in dryness by acting dental and hair problems. Useful in dryness by acting as Vatshamak. Local application of oil reduce pain, hence it is very effective for reducing pain and knee joint. Baluka Potli Swedan. Baluka carries Ushna Guna by Agni Sanskar. Vat having exactly opposite gun, Shit gun. Due to this, restore the properties and functions of irritated Vat. Also, Stambh is because of Stotavro due to Am, Kaf, Ushna, Tikshna and Lekhan gun also reduce the Stambh and also effective for reducing the Shot Kriya Kashtata. Rashna Saptakar, it is Ayurvedic anti-inflammatory decoction, hence very effective for reducing the pain and swelling of body joints. Yogaraj Google, it elevates all the 3 doshas and has Rasayan action. It is indicated in the management of Vatrogas. Google possesses anti-inflammatory and analgesic actions that prevents degenerative changes in bone and joints, also reduce inflammatory pain and stiffness of joints. Triflachun has its immunomodulatory, anti-inflammatory and anti-arthritic, analgesic, antipyretic, ulcerogenic, antibacterial and wound healing properties. Also, it acts as purgative, which reduces viband, due to which it is very effective for treatment of Janu Sandhika. Conclusion analysis of the study reveals that Shodhan Chikitsa with Pindutel, Patrapinda Swedan and Mahamash tail is very effective to pacify irritated Vat dosh, and Shaman Aushadhi, Yogaraj Gukul, Rasa Saptak Vat and Triflachun also very effective for reducing the pain, stiffness and other classical symptoms of Sandhigat Vat. Hence, there is a significant result in the decreasing pain, stiffness, tenderness, also improving range of movement and walking ability of patient. These are the references. Thanks.
Thank you, Doctor. Next, I invite Dr. Meghasri for the poster presentation. Dr. Meghasri. Hello, Dr. Meghasri.
Sir, am I audible?
Yes, Doctor. Audible, Doctor.
Screen is visible, no, sir?
Your screen is visible, Doctor. Please start, Doctor.
Sutika Paricharya in Karavali. Lot many Sutika Paricharyas have been mentioned or told in our classics, may it be in Brahatrais or according to Kashyapa, but an attempt is made here to highlight few traditional formulation practiced in Karavali or South Canara region. First one is the Omada Lehya for the mother, 1 bowl of coriander seed, half bowl of ajwain, black pepper, grated coconut is added to half kg of flaked rice, and leha is prepared out of it. Indication is for increasing the breast milk. Second one is podimarda for mother, that is a churna which has been prepared out of ajwain, coriander seed, mustard, half bowl cumin, methi, half bowl of pepper. All these are made into powder form, and it has been indicated to increase the appetite or balance the appetite. Next is oil application for mother. Half liter of coconut oil, 1 liter of mustard oil, half bowl leaves of jasmine, manduka parni, henna leaves, and lemon. All these ingredients are boiled, and thailapaka is prepared and has been applied to the mother. Has like for abhyanga, indication for in wrinkles, to overcome the stress and strain which has been caused due to the delivery. Newborn care. For baby, oil prepared with leaves of henna, neem, hibiscus. These ingredients are taken, and coconut oil is taken as base. Thailapaka is prepared, and it's been used for abhyanga for the newborn babies. Indication, it provides a good sleep and nourishes the body of the baby. Fumigation. For Dupana Karma, the gum, benzoyl, lucas, asparagus plant, and onion and garlic peels have been taken, dried, and it's been done as a Dupana Dravya, and it's used for fumigation. Indication, Balagra for good sleep. Kodi Marda, it is a tuna which has been prepared out of leaf sprout of Goa, Java palm, wild berries added with pepper, onion, garlic, and removes the kapha from the body of the mother. Thank you.
Thank you, Doctor. Next, I invite Dr. Patel Vishwa Rajesh Pai for the paper presentation. Hello, Dr. Patel Vishwa. Are you there?
Yes, sir.
Okay, Doctor. Please share the screen, Doctor.
Sir, screen is visible.
No, Doctor. Not visible, Doctor. Now it is sharing, Doctor.
Yes.
Yes, Doctor. Visible, Doctor. Please chat, Doctor.
So myself, Dr. Vishwa Patel, first year PG scholar, Department of PG Studies in Salyatantra, Government Ayurvedic Medical College, Bangalore. Topic with the karma, the hidden treasure of Ayurveda, guided by Dr. Rukshitha. Vidya Karma is a modified form of Siraveda. The Siraveda is called a Salya Chikitsa Ardha, means the half part of Salya Chikitsa. Acharya Susruta has explained a Vedan of a specific Sira in a specific disease. Sira Vedan is done on the Sira that are clearly visible, but in case when they are not clearly visible, Vidya Karma can be done as explained. When Sira Ved is performed, the most vitiated dosa, that is Rakta, is released. Similarly, in a Vidya Karma, the most vitiated dosa is released. So Vidya Karma to the specific point of body may release the Vata Avrodha, and ultimately pain will be decreased. This immediate reduction in pain is of no cost and will be as a miracle to the patient. There is a need of efforts to develop a Vidya Karma as a non-invasive technique with evidence-based practice. Also, make a Vidya Karma at its finest level with understanding the efficacy in a special condition and phase. In a Susrut Samhita, Susrut Acharya has mentioned Ashtavidya Sastra Karma, that is Chedan, Vedan, Lekhana, Vedan, Esan, Aharan, Vistravan, and Sivan. Out of these 8 types of surgical procedure, Vedan and Vistravan Karma are 2 different procedures. Vidya or a Vedan is a Sanskrit word meaning to pierce or penetrate something, whereas a Vistravan means training. In Susrut Samhita, Siraved Vidya Adhyay has been explained in which Vedan of a specific Sira in a specific disease is mentioned. We generally understand Siraved as a Sira Vistravan, wherever the word Sira Vedan is referred. Letting out of blood from the vein comes in our mind. This is the reason the Vedan Karma has lost its identity. Actually, its chapter is very confusing. After going through it again and again, one can understand why Acharya Susruta has used word Vyadan. The word Vyad has so many meanings which can be following: to bore a hole, to drain,
to let out interrupt vayu, to let out interrupt circulation in a blood vessel, to let out a fluid in a jatodaka and mutra vriddhi, to let out a pus in a vidradhi. Vitakarma is a sterile surgical procedure of piercing special points with the special hollow needles. This weather must be done by hollow needle. If the blood vessel is large, the blood can be evacuated, but if the sera is not visible, it is to be pricked by a needle till it bleeds or may not bleed. To understand Vitakarma, we must have this concept in our mind. Out of the dosa, sera always carries all dosa, that is vata, pitta and kapha along with rakta. Tatraya sukshma shastra vidyata avyaktam ashrugam stravate susrut saristan 8. A simple puncture also bleeds which is not relieved. Symptoms of durvida sera, that a simple puncture through the bleed but does not relieve, also reflects an idea of Vitakarma. Vata dosa is the main positive factor of pain. When the needle with a hole is pricked on a body surface, the vitiated vata nirharan occurs. That's why the Vitakarma can be done on the tender point as well as surrounding the tender areas. Points for a Vedana Karma, name of the disease, points of Vedana Karma and superficial vein according to modern anatomy. Padadaha, Padaharsha, Visarpa, Chipa, Vata Rakta, Vata Kantaka, Vicharshika, Padadari, 2 angle above Kshipramarma, medial metatarsal vein, Vataja Slipada, 4 angle above Gulfa Sandhi, short staphenous vein, Pittaja Slipada, 4 angle above Gulf Sandhi, a branch of a dorsal venous arch, Kafaja Slipada, 4 angle above Kshipramarma, a branch of a dorsal venous arch, Kroshtaka Sirsa, Khanja Pangu, 4 angle above Gulfa Sandhi, short staphenous vein, Apache, 2 angle above Indrabasti, tributaries of a short staphenous vein, Gridrashi, 4 angle above or below Janosandhi, great staphenous vein, Galaganda, Urumulus Sira, tributaries of a short femoral vein, Liha Roga, Sira of left Karpura Sandhi, left median cubital vein, Yakrut Dalyodara, Kapodara, Kas Swasa, Sira of a right Karpura Sandhi, right median cubital vein. Sula Yukta Pravahika, 2 angle near through Shroni, common iliac vein, Pravahika Upadansa, Sukra Roga, Medra Madhya Sira, superficial dorsal vein of a penis, Mutra Vriddhi, lateral side of the Vrushana, does not mention a Sira Veda, however, this is site of a fluid aspiration. Jalodhara, 4 angle above below to left side of umbilicals, is the site of the peritoneal fluid aspiration. Andhra Vriddhi, Pasva Sulam, medial Sira of the Vam Pasva, and site is of a pleural fluid aspiration. Bahu Sosa of Bahuka, medial Sira of both skanda, cephalic vein at midpoint of Ama, upper Smara, medial Sira of Hanusandhi, that is facial vein, Unmada, medial Sira of Skanda, Kesanta or Lalata Pradesh or Apanga Sira, frontal, supraorbital, superficial temporal vein, Talu Roga, Talukat Sira, pterygoid flexus of the vein, Karana Sula, Karana Roga, Sira above Karana, external jugular vein, Gandagraha, Nasa Roga, Nasagra Sira, facial vein, Timira, Akshipaka, Netra Vyadi, Nasa Samipa, Lalata, Apanga Sira, frontal, supraorbital, suprafacial temporal vein, Sira Roga, Adimanta, Lalata, Apanga Sira or Sira near to Nasa, frontal, supraorbital, suprafacial temporal vein. For a Vitakarma, sterilized needle are always preferred. Needle number 26 is widely used for a Vedankarma as its dimensions resemble to the ancient instrument explained by Susrut Acharya. Its depth in a millimeter can be understood as in a skin 2 to 4 millimeter, in a mass 4 to 6 mm, or in a bone 6 to 10 mm. The place where 26 number needle cannot be easily used, like below tongue or a teeth, the insulin syringe should be preferred. But the insulin syringe should be used by expert only. In a case of obese, this needle will not work. So in the case 24 number needle is used, but this needle should be used with a gentle care, as it causes more trauma to the patient. Procedure of a Vitakarma, Purvakarma. Take written informed consent of the patient and attend before the starting the treatment. It is important to inform the patient about the procedure, its consequences, etc. Examine the patient properly. Proper history of the patient should be taken. Patient suffering from any major surgical deformity in fracture, dislocation should be excluded. After proper diagnosis, the patient should be seated on a comfortable chair or bed. Mark the points with the pen where the Vitakarma is to be done. Using all the aseptic precautions, clean the local area with a Tripaladi cloth or a Panchvalgal cloth or any other local antiseptic solution. The local area is to be dried using a sterilized cloth.
pradhana karma. By using a suchi, the points are fixed up to depths are mentioned below according to the place to be pricked. Then it is made out of the body immediately. Such 5 to 6 pricks are to be taken on the marked points so that the tender points should not be missed. In a case of the chronic disease, more sittings of the Vidya karma is required. Done frequently destroyed after use. This procedure can be done continuously for 7 days or more according to the condition of the patient. There is some list of the references. Thank you.
Thank you,
Thank you,
doctor.
doctor.
Next, I invite Dr.
So next
Amarlal Kishan Chand Ahuja for the paper presentation. Dr. Amar Ahuja. Hello, Dr. Amar Ahuja.
Hello. Am I audible?
Yes, doctor. Audible, doctor. Please share the screen, doctor.
Yes, sir. For a second. I'm unable to share my slides. Can you please share?
1 minute, doctor. Please start, doctor.
Myself, Dr. Amar Ahuja, second year PG student, Kaichikasa department. My topic is effect of Shalyakadi Yoga, a herbal preparation in Upastambhit Sandhigata Vata. Guided by Vaidya Sriranga S. Chapekar, Associate Professor, Department of Kaichikitsa, Ashwin Rural Ayurveda College, Manchi Hill, Sangamner, Maharashtra. Co-guided by Ravindra Athram. Introduction. Sandhigata Vata is one of the most common Vatyavadi. In Vidyavastha, all dhatus undergo Shaya, thus leading to Vata Prakopa and making individual prone to many diseases. Osteoarthritis is the most common articular disorder begins asymptomatically. The incidence of osteoarthritis in India is as high as 12%. It is estimated that approximately 4 out of 100 people are affected by it. The prevalence rate of osteoarthritis is 14.8%, in which knee arthritis prevalence rate is 10.8, which is more than others. It has been observed that around 10% to 15% of elderly people above 60 years have osteoarthritis with clinical symptoms all over the world, in which prevalence higher among women than men. Next slide. Rationale of study. Osteoarthritis is a slowly progressive degenerative disorder, otherwise known in Ayurvedic term as Sandhigata Vata. Vata is mostly dominant in Vruddhavastha. The person affected by this disease needs nutritive or rasayan therapy, which may cease the process of degeneration, or anulomana dhatu kshay, which generally leads in old age. Due to excessive overweight on a particular joint, generally knee joint, cause osteoarthritis. Sometimes due to more exercise of a particular joint or mithya ahar vihar causes the vitation of vata, which creates pain in sandhi. Nidana sevana aggravates vata, and this prakopita vata gets accumulated in rikta srotasa, means where free space exists for its lodgement, and give rise to a generalized and localized disease. As this disorder have no perfect cure or remedy in any other of medicine except Ayurveda, due to Vata Prakopa and age-related degeneration, there is more prevalence of Sandhigata Vata and osteoarthritis from age 50 to 60 years, and it also hampers the quality of life. And as the Ayurveda most focuses the management on geriatric disease, there are only some painkillers and local muscle relaxation available for this order in other medicines, other disorder, along with side effects like hyperacidity, gastric disturbance, constipation. Sandhigat Vata is a Madhyam Roga Marga Vata Vatika disorder in which vitiated Vata gets disordered in Sandhi. Next slide, please. Methodology, study design. Randomized, controlled, comparative clinical trial, duly signed and dated, consent formed by subjects will be participated. Screening of subject according to the baseline assessment and inclusion exclusion criteria, randomization, allocation of group. Next slide. Dependent variables are sign and symptoms of Sandhigata Vata. Independent variables are Shellekati Yog and Sihanadi Ugod. Next slide, please. Inclusion criteria. Patient billing for clinical trial having age group 30 to 70 years of either. Patient fulfilling the diagnostic criteria which are based on sign and symptoms of Sandhigata Vata. Exclusion criteria. Patient not willing for clinical trial. Any other addictions like chronic alcoholism, including hyperacidity. Patient suffering from any other chronic systematic disorder. Pregnant and lactating mother. Withdrawal criteria. Patient who will discontinue treatment. Patient unwilling to take the treatment during study. Patient shows any types of side effects if any complications occur. If any complications arise during treatment, cases will be liable for rejection. Informed consent will be obtained from all the participants, explaining the details about the treatment given to them. Next slide. We made two groups. Group A contains five patients. We give Shellekadi Yog, which is our drug, an initial assessment on 0 day, follow-up assessment on 7th. In the next, we made another group B. We have 5 patients. We give Sihanada Gugul Pati for comparison. Same initial assessment on 0 day, follow-up on 7th, 14th, and 21 day. Sir. Next slide, please. Hello. Next slide. Ingredients of appropriate methods of management, subjective parameters, Sandhi Shula, severe difficulty in walking, Sandhi Shotha, Sandhi Graha, Akunchan Prasanjana Vedna, that is pain during flexing and extension, Sparsha Sahatva, and last one is Sandhi Sputana. Next slide, sir, please. Next slide. Result. From the above pilot study, we noticed that total 10 patients from both group A and group B have good symptomatic relief in 14th day of follow-up. In this slide, we understand Shellekadi Yog and Sihanad Gugul have equal result in Upasambit Sandhigata Vata. Discussion. Next slide, sir. In this pilot study, we divided the patient in 2 equal groups. To first group, we give Shellekadi Yog. To second group, we give Sihanad Gugul. We seen that both yoga are good working from day 14. Since it is a chronic disease, it requires more time for cure. In both groups, we have symptoms due to hetu like Rukshitha, Alpa Ahara, Alpa Nidra, Vega Avrodha, excessive drinking of tea, coffee, and eating unhygienic food or snacks, and also disturbing sleeping patterns as well as stressful life. To get best results of drug and have no recurrence of the symptoms, we must have to avoid all the hetu sevana and treatment. Next slide, sir. Discussion. Shalyaki due to Madhur Rasa, Nirgundi and Lagi due to Ushna Virya act as a Vatanashaka. Nirgundi due to Ushna Virya act as a Shotahara and Amnashaka. Langli and Nirgundi due to the Ushna Virya and Tikta Rasa act as a Vedana Shamaka. Shigru due to the Tikta Rasa and Ushna Virya act as a Dosha Pachaka, Deepana and Kapha Vatagana. Therefore, these are taken for this study on Upasambit Sandhika Vata. Shellaki, Nirgundi, Langli, Shigru. Conclusion. In this pilot study, we've seen that Shellekadi Yoga and Sihanad Gugud have equal relief in Sandhikata Vata. To get proper, accurate, and detailed result of Shellekadi Yoga, we have to study more deeply on this topic. Also seen more number of patients of Sandhikata Vata. Thank you.
Thank you, doctor. Next, I invite Dr. Nirmala Bidari for the paper presentation. Dr. Nirmala Bidari.
Yes, sir.
Doctor, please share the screen, doctor.
Yes, sir.
The screen is visible, doctor.
Can I start, sir?
Yes, doctor, please.
Good evening, everyone. Myself, Nirmala Bidri, first year PG scholar, Department of Shalyatantra, Government Ayurvedic Medical College, Bangalore. My guide is Dr. Srinivas Maslekar, sir. My presentation topic is cupping therapy, the modified Rakta Mokshana. Introduction. Rakta Mokshana is a unique procedure among the Shastra Karma indicated in different diseases where gross vitiation of Rakta is present. Shushruta, the father of ancient Indian surgery, describes about physiological and pathological role of Rakta in various disorders. According to Acharya Vagbhata and Shushruta, Rakta Mokshana is one among the Panchashodhana. Rakta means colored red, crimson, blood red. Mokshana derived from the root moksha means to relieve or to let out. Raktasya mokshanam raktasrava. Letting out impure blood from the body is known as Rakta Mokshana. Classification. Shastra, Sashastra and Anushastra Vishravana. Under Sashastra Vishravana, Prachanna and Siravedana. Anushastra Vishravana, Shringa, Jaloka, Alabu, Gatiyantra. These are the pictures related to Prachanna, Alabu, Shringa and Gatiyantra. Indication of Rakta Mokshana. Vidradi Kushta, Ekadeshaja Shopa, Slipada, Visarpa, Arbuda, Granthi, Stanaroga, Oshtakopa, Krimidanta, Kshudra Roga, Vishajushta, Shonita, Upadamsha, etc. Contraindications. Sarvanga Shopa, Pandu, Arsha, Udara, Shosha, Kliba, Pakshagata, Adisara, Cherdi, Kamala, Akshepaka, Kshina, etc. Conditions in patient selection and in method of selection. It depends on dosha avastha anusara, rakta avastha anusara and atura avastha anusara. According to dosha avastha, vata dushta condition, Goshrunga is used. Due to ushna, madhura and snigdha guna, it mitigates the vata dosha, and due to in the pitta dosha condition, jaloka is used. Due to Shita and Madhura Guna, it mitigates Pitta. In Kapadushta conditions, Alabu is used. Due to Katu, Ruksha and Tikshna Guna, it mitigates Kappa. But it should not be used in Pitta condition. According to Rakta Avastha Anusara, in Eka Sthana Sthita Pindita Rakta, Prachanna is used. In Gradita Rakta, that is deep-seated conditions, Jaloka is used. In Supta Rakta in Tvacha, that is localized in skin areas, Alabu, Gatti, Shrungavacharana is used. In Sarvanga Kupita Dosha, Shiraveda is advised. Atura Vastanusar, Shrunga and Alabu is used in Sukumara Rogi. Jalokavacharana is done in Atyanta Sukumara Rogi, that is Parama Sukumara. Prachanna and Siraveda in Sukumara Rogi. Pramana Prakta to be let out during Rakta Mokshana. According to Bhava Prakasha, Jaloka covers the area of 1 hasta pramanam, Alabu 12 angula, Prachanna 1 angula, Shringa 10 angula, Shiraveda Sarvangagata dosha. Purvakarma Prakta Mokshana. First we have to check out for blood investigations and biochemical and coagulation profile, serological and other case profiles, specific tests as needed. Prophylactic tetanus toxoid is better. Arrange supplies like sterile gloves and instruments. Explain procedure to patient and take consent of the patient. Snehan and Svedana for local or general should be done. Diet, Vagu, light semi-solid diet should be advised. Position the patient usually in sitting position or any comfortable positions. Preparation of the part and checking of the vitals are needed. Prachanna karma. Indication in Ekadesha Sthita Pindita Rakta. Synonym Shastrapada or Pada. It is Purvakarma of Shringa, Jaloka, Alabu, Gatiyantra. Method. Position the patient and eyes covered. Tight the tourniquet. Clean with aseptic solution Make multiple superficial but sufficient non-overlapping incisions. Pachat karma, wipe the part with lukewarm water or aseptic solution. Dressing with Jatyadhigruta or Taila and bandaging is done. Shrunga method, identify the affected part, keep Shrunga over affected part to know the exact area covered by the Shrunga. Clean area with aseptic solution, make few superficial incision inside the area. Keep Shrunga over it and suck the blood by mouth from other end. Blood gradually is collected in the Shrunga. Shrunga will be released on its own after pressure equalizes. 50 to 100 ml of blood usually collected. Modification in Shrungavacharana. Nowadays, suction pumps, a syringe with its nozzle neatly cut off without sharp edges, or breech pump cups with suction machine are in use. Pachat karma, same as said in Prachana karma. Alabu or Gati yantra avacharana method. Press the mouth of the alabu onto the body to make an impression on the area. Make a few pricks within the impression. Lit a piece of camphor and put inside the alabu. Keep the mouth of the alabu on the impression in horizontal position to avoid burn. Blood will be collected inside due to the reverse pressure created inside. When the oxygen is burnt up, creates vacuum and gets attached to the body. When the pressure equalizes, alabu detaches. According to Charaka in Gulma Chikitsa, to remove adherence of Gulma, Gati Yantra is advised. Nowadays, fire cupping therapy is in practice. It is nothing but modification of alabu or Gati Yantra Raktamokshana. Cupping therapy. Cupping in Arabic is known as hijma. It is a special technique of evacuation used in the treatment of certain lethal diseases. A treatment done by producing partial vacuum in the cup glasses placed on the body surface by heat or suction in order to evacuate morbid material or to divert the material from the deeper tissues or diseased part of the skin. Both liquid cupping and cupping over an acupuncture needles are favored for treatment of arthralgia. These are types of cupping jars: glass cup jars, bamboo cup jars, pottery cup jars are in use. Types: dry cupping, wet cupping. Under dry cupping, fire cupping, water cupping, fixed cupping, biomagnetic cupping, moving cupping, flash cupping comes. And dry cupping pulls the skin into the cup without scarification, but in wet cupping, scarification is done. Technique: each cupping session takes about 15 to 20 minutes and could be conducted in 5 steps. First step: primary suction. Locates specific points or areas for cupping and disinfect the area. Suitable sized cup is placed over the site and therapist suck the air inside cup by flame, electrical or manual suction. Then leave it for 3 to 5 minutes. Scarification or puncturing. Superficial incisions are made on the skin using surgical scalpel blade number 15 to 21. Suction and bloodletting. The cup is placed back on the skin using similar procedure described above for 3 to 5 minutes. Removal of cup. Slowly releasing the vacuum inside the cup by pulling the mob. Dressing the area. After cleansing and disinfecting, followed by application of suitable sized adhesive strips. It should be remain for 48 hours. These are the images related to procedure. Therapy effect. Cupping can induce comfort and relaxation on a systemic level and resulting increase in endogenous opioid production in the brain. Leads to improved pain control. Enhances the circulation of blood. Removes toxins and waste from the body. This is achieved through improving microcirculation. It promotes capillary endothelial cell repair. It accelerates granulation. It increases the angiogenesis in the regional tissues, hence achieves muscle relaxation. Effective method of reducing LDL, low density lipoproteins, consequently may have preventive effect against atherosclerosis and cardiovascular diseases. Lower the number of lymphocytes in local blood related to the affected area with an increase in the number of neutrophils, which is one of the antiviral mechanisms that reduce pain scores. Loss of blood along with vasodilation tends to increase parasympathetic activity and relaxes the muscles and reduces the pain. Increased red blood cells tends to drain excess fluids and toxins, loosen adhesion and revitalize the connective tissues, increase blood flow to the skin and muscles, stimulate the peripheral nervous system, reduce pain, controls high BP, modulates immune system. Toxins are the main cause for the illness. It removes all toxins. Restore the sympathovagal balance and might be cardioprotective by stimulating the peripheral sympathetic and parasympathetic nervous system. Significant reduction in blood sugar in diabetic patients
Hello,
after
doctor.
pumping is also.
Doctor, you are exceeding the time limit, doctor. Can you speed up your presentation?
Okay, sir. Thank you. Thank you, sir.
Okay, thank you, doctor. Next, I invite Dr. Bhagyashree Tulsiram Shinde for the paper presentation. Dr. Bhagyashree, are you there?
Yes, sir. Yes, sir,
Okay,
I'm here.
doctor. Please share the screen, doctor.
Sir, can Sir, please can you share my PPT?
Okay, doctor. 1 minute, doctor. Doctor, please chat, doctor.
Full term normal delivery. So next slide. Presented by Vaidya Bhagyashree Tulsiram Shinde. Sir, slides. Definition of normal labor. Series of events that take place in the genital organ in the effort to expel the viable products of the conception, like as fetus, placenta, membrane out of the womb through the vagina into the outer world is called as labor. Labor is called as normal if the fulfill the following criteria: spontaneous in the onset and the term with vertex presentation without unto prolongation, normal termination with minimum aids without having any complication after affecting the health of the mother and baby. Next slide, sir. Factor influencing the process of labor: hormonal factor, estrogen therapy, progesterone therapy, prostaglandin therapy, oxytocin therapy, and fetal cholesterol therapy. So next slide. Mechanism, mechanical factor, uterine distillation therapy, like any hollow organ in the body. When the uterus is distended to the central limit, start to contact to evacuate the content. This explains the preterm labor in the case of multiple pregnancy and polyhydramnios. Search the lower uterine segment by. So slides is not visible clearly. Next slide. Next. Diagnosis of labor. True labor pain. It is characterized by painful uterine contraction of regular intervals, frequency of contraction increasing gradually, intensity of duration of contraction increasing progressively, associated with show, progressive effacement and dilation of cervix, descend the presenting part, formulation of bag of pore water, and not relieved by the enema or sedative. Next slide. Stages of labor. Stages of labor. Conventionally, event of labor is divided into 3 stages. First stage, the stage is longest. First stage is the longest stage of the 3 stages. Is actually divided into phases: early labor and active labor. First stage of the labor start from the onset of true labor pain and end with the full dilatation of cervix. Its average duration is 12 hours in primary gravidia and 6 hours in multiparas. First stage contain a latent phase up to 4 cm cervical dilatation and active phase is up to 10 cm. The stage is clearly concerned with the dilatation of effacement of the cervix. The stage is clinically manifested by progressive uterine contraction. Dilatation and effacement of the cervix is uterine until ultimate rupture of the membrane. Membrane material and maternal and fetal condition remain uneffaced except during the uterine contraction. Next slide. Early labor. During early labor, cervix dilatation efface. Womb likely film mild irregular contraction. How long is last? Early labor is unpredictable. For first time womb, the average length available for the hours 2 days. It's often short for substandard deliveries. Active labor. During the active labor, cervix will dilate at 6 cm to 10 cm. Contraction will be stronger, closer together and regular. Leg might cramp and you might feel nauseated. Women might feel water break if it has already, and experience to increasing pressure in the back. If woman has needed to have a labor and deliver facility. How long is last? Active labor is after last 4 to 8 hours or more. On average, your cervix will be dilated approximately 1 centimeter or an hour. So next slide. Event in the second stage of labor. The stage of labor start from full dilatation of cervix and end with expulsion of fetus. Its average duration is 2 hours in primary gravita and 30 minutes in multiparas. The stage consult with the descent and delivery of the fetus through the birth canal. The stage is clinically manifested by increasing frequency and intensity of uterine contraction with appearance of bearing down. Effort will result in expulsion of fetus. The mother may show features of exclusive. Second stage has 2 phases, proflusive and expulsive. For full dilatation until head touches the pelvic floor, and second is expulsive. Since the time mother has estimate desire to bear down and push until the baby is delivered. How long is last? It can taken from the few minutes to the few hours or more to push baby in the world. It might take long for first time womb and woman will have an epidural. So next slide. Events in the third stage of labor. The third stage of labor compromise the phase of placental separation. It is descended to the lower segment. It is finally expulsion with the membrane. The stage is begin after the expulsion of the fetus and end with the expulsion of the placenta and membrane. Its average duration is 15 minutes. The stage concerned with the placental separation and its expulsion. The separation is achieved by make reduction in the uterine surface and area of placental side following delivery due to the retraction. The placenta being inelastic shards of the attachment through the deep spongy decidual layer. there are two ways of separation, central and marginal. The bleeding is controlled passive myometrial contraction and retraction, leaving ligaments. And by thrombosis, the expulsion may occur through bearing down efforts or more commonly with assessment. How long is last? The placenta is typically delivered in 30 minutes, but the process can last as long as an hour. So, event in fourth stage. It is the stage of observation for the last 1 hour after the expulsion of after birth. During this period, maternal vitals, uterine retraction, and any vaginal bleeding are monitored. Baby is examined. They are done and ensure that both of mother and baby are well. There are stages of the birth in vaginal delivery. Mechanism of labor. Summary of mechanism of labor. Diameter of engagement, available transverse diameter of the until engaging the diameter of the head, suboccipito bigramic 9.5 centimeter or occipito frontal 10 centimeter. Engagement, increasing flexion, internal rotation of the occiput anterior to 2/8 of the circus, and some simultaneous rotation of the shoulder in 1/8 of the circle. Crowning stage, then delivery of the head of the expulsion, resuscitation, external rotation, delivery of the shoulder and trunk by the lateral flexion. So next, management of the labor, management of the first stage of the labor. First, initial examination, laboratory test, patient preparation, activity, fluids and oral intake, infection prophylaxis, maternal activity and position, pain control and comfort measure, amniotomy, monitoring fetal heart rate, uterine contraction and labor progressive. Management of second stage of labor. Persistent anterior cervical lift, pushing, immediate versus delay, position and technique, duration, maternal position for the delivery of newborn, and oropharyngeal care. Mechanism of third stage of labor, cord clamping and other approaches to the cord, early versus delay cord clamping, cord making, physiological cord clamping, placental draining, maternal newborn interaction, breastfeeding, normal placental separation, active management and delivery of placenta, repair the laceration, then instrument and sponge counts. Thank you, sir.
Thank you, doctor.
Thank you, sir.
Next, I invite Dr. Murshida C for the paper presentation. Dr. Murshida, are you there?
Yes, sir.
Okay, doctor. Please share the screen, doctor.
Okay, sir. Is it visible?
No, doctor, not visible, doctor. Okay, now visible, doctor. Please start.
Visible?
Yes, doctor. Please start.
I am Murshida C, second year PG scholar, Shalyatantra Department, BPSV, Ayurveda College, Kottakkal. My topic of presentation is concept of Vyadikshamatva in cancer treatment. Improving the immunity of the patient, we may able to seize the pathology and prevent further progression of disease. This is explained in our classic through concept of Vyadikshamatva. It explains the preventive and curative aspect at the same time. Vyadhibala Virodhitva, that is antagonistic to the strength and virulence of the disease. And Vyadhi Utpadak Pratibandhata, that is which prevent the development of the disease. We have to adopt this curative and preventive aspect of Vyadhikshamatva in cancer treatment also. Vyadhikshamata can be well understood with the help of factors like Agni, Prakriti, Ojas, Bala, Mana, Ahara, and Vihara. These basic factors are interdependent and control the Vyadhikshamatva. Derangement of any of these factors may adversely affect the Vyadhikshamatva, thus result in disease manifestation. Now let us look how these factors influence the Vyadhikshamatva in detail. Bala, usually referred as strength, also used as a synonym for Vyadhikshamatva. It is most important factor assessed in Rogi Parisha to decide the Sadhya Sadhyata and treatment of disease. On attain Bala through three sources, Sahaja, Kalaja, and Yuktigrita. Yuktigrita is important in treatment aspect. It is occurred by Idahara, Cheshta, and also through Rasayana Prayoga. An appropriate diet and regimen is necessary in helping the body to recover and prevent relapse. In Charanam Sutram 28th chapter, Acharya said, Aharam Sambhavam Vastu Rogasya Ahara Sambhaha, which means Ahara, Vyadhi, and Sharira are interrelated. This shows the importance of Ahara in maintaining Vyadhikshamatva, which may help in the preventive and curative aspects of cancer. In Ashtakridaya, it is explained about Nitya Sevaniya Davya. The sloga starts with Shilet Shali Goduma Eva Shashtika Chandala. In this, we can see many of them have antioxidant, anti-cancerous, and immunomodulatory properties. Triphala has tumor-specific cytotoxicity and does not harm normal cells. Anti-cancerous activity of Jeevandi and Mudga has been proven. Draksha, which is mentioned as Phalotama in Ayurveda, is also proven for its anti-cancerous property. Proanthocyanidin present in Draksha is a strong antioxidant which protects cells from free radicals. Many food items are contraindicated for daily use. A study conducted by Neyman DC et al. Proved that daily use of red meat will cause colorectal carcinoma. The daily use of vara and maisha mamsa is contraindicated in Ayurveda also. Next is Vihara, which affect Vyadhikshamata or Bala. Dinacharya, Vruddhacharya, and Sadruta are parts of ideal lifestyle measures mentioned in Ayurveda for maintenance of health. The routine practice of Vruddhashodhana is effective in preventing the accumulation of toxin in our body and also helps to improve immunity. People engaged in regular moderate exercise causes enhanced immunity and substantial protection of T cells. Rasayana work at various levels in the body such as Rasa, Agni, and Srodhas and overall result in absolute state of Vyadhikshamatva. It is a probable pharmacodynamics of Rasayana drugs. Rasayana drugs by acting at the level of Rasa enriches the nutrition. By acting at the level of Agni improves the digestion and metabolism of the body. Acting at the level of Srodhas, it ensures proper perfusion and nourishment of tissue, which provides body immunity against disease. Ayurveda describes a number of drugs as rasayana, which are claimed to possess immunomodulatory effects. These are some of the drugs which have been subjected to scientific studies and found to possess immunomodulatory effect. We discuss about the action of single drug, which has immunomodulatory action. Many studies also available proving the anti-cancerous and immunomodulatory action of Rasayana yogas. Chyawanprash have anti-carcinogenic, anti-mutagenic, antioxidant, and immunostimulatory effect. Brahmarasayana have antioxidant activity and can actively reduce the radiation-induced damage. Mana also affects Vyadhikshamatva. Ayurveda describes pranayama, yogasana, and sadhuta that nourishes both the physical and mental health of a person. The role of emotional and psychological factor over the proper functioning of immune system has been very clearly described by Ayurveda, which is now recognized by the modern science based on the evidence of various experimental and clinical studies. A study conducted by Kochubule et al. Have proven that Pranayama technique have a significant effect on increasing the number of natural killer cells in cancer patients. In fact, a new branch of medical science, psychoneuroimmunology, is fastly developing, which studies the interrelationship of psychological factors, nervous system, and immune system. Thank you.
Thank you, Doctor. Next, I invite Dr. Anjana for the poster presentation. Dr. Anjana, are you there? Hello, Dr. Anjana, are you there?
Hello.
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 Doctor, please share the screen, Doctor.
Yes, sir. Yes. Hello.
Hello, Dr. Anjana.
Sir, can you share my poster?
Okay, 1 minute, Doctor. Doctor, please start, Doctor.
Good evening, sir. So, my name is Anjana Yadav, PG scholar in Shastra from GGAC Nanded. My topic for poster presentation is Mutrashmani, also known as urolithiasis. Introduction. Acharya Shushruta described it as one of the Ashtam Mahagadas. He also termed it as Yama because it gives intolerable pain. Charak mentioned Ashmari is one of Basti Marmashit Vyadhi. In modern science, it is correlated with urolithiasis. Urolithiasis is the condition where urinary stones are formed or located anywhere in the urinary system. Predisposing factors are environmental and dietary, like low urine volumes, diet, high protein diet, or high sodium intake. Acquired causes like hypercalcemia and ileal diseases or renal tubular acidosis, and congenital causes like familial hypercalcemia, cystinuria. संप्राप्ति तत्र संशोधनशीलस्य अपथ्यकारिणः प्रकुपितः श्लेष्मा मूत्र संपृक्तो अनुप्रविश्य बस्ति अश्मरि जनयति. Due to improper purification of the body and by following the improper diet and gets vitiated, combines with urine, reaches in the basti to form ashmari. The 4 types of ashmari indicated 4 locations of mutrabha shrotas, where ashmari is stagnated or lost. Vataj, Pittaj, Kafaj, and Shukraj. Vataj in the as a ureteric stone, Pittaj as a vesical stone, and Kafaj kidney stone. Shukraj as a urethral stone. Types of kidney stone as in the modern science: cystine kidney stone, struvite kidney stones, and uric acid kidney stones, calcium kidney stones. Pathya and apathya are Pathya, Kulatha, Godhum, Yava, Tanduliya, Adrak, Mudaga, Jirnashali, Jirna Kusmanda, Pal, Yavashara, and Jalasevan. Apathya are Shushkahar, Rukshahar, Pishtana, or Kapitha Jambu, and Kashaya Sevan, and Ati Vyayam, and Vegadharan, etc. Samanya Lakshans are distension of bladder, pain in lower abdomen, passage of urine with goat's urine smell, fever, anorexia, pain in bladder, testes, pain is with headache. Chikitsa Sutra is Nidan Parivarshan, Ahar, eating balanced diet, maintaining hydration, treatment of associated etiologies like gout, hypercalcemia, hyperoxaluria, etc. A surgery as mentioned by Sushrutin Chikitsa San, Sanshodhak Snehan, Virechan Basti, and also Uttar Basti, Sweden, and Vaman. Thank you, sir. Hello.
Thank you, doctor. Next, I invite Dr. Prudilada Vinod for the paper presentation.
Hello.
Hello.
Am I audible?
Yes, doctor. Audible, doctor. Please share the screen, doctor.
Yes. Sir, can you please share my screen?
Okay, 1 minute, doctor. Doctor, please chat, doctor.
Good evening. Myself, Dr. Pritilata Hire, and I am presenting leach application in diabetic foot ulcer, a single case study under guidance Dr. Vidya Dharne. Contents are diabetic wound, Ayurvedic aspect of diabetic wound, leech therapy case study, and discussion and conclusion. Next, diabetic wound. The term diabetic foot is somewhat a misnomer as the condition has been defined as a group of syndromes that can involve neuropathy, ischemia, infection with the neuropathic type being the most common. Diabetic ulcers tends to occur most commonly on the plantar weight bearing surfaces, that is the pressure points. Epidemiology is most common causes of diabetic patient to get hospitalized is diabetic foot ulcer. As many as 15% of people with diabetes will develop a foot ulceration and it's related to complication like gangrene, etc. And 3% will have a lower limb amputation. Epidemiological factors are increased sugar level, diabetic microangioplasty, pathy, and diabetic neuropathy. Next, Ayurvedic aspect is Ayurvedic perspective of diabetic foot ulcer can be correlated with the Madhumeha Vran described in Sushruta Samhita. Samprapti. In Madhumeha, the lower limb vessels become weakened and unable to expel doshas. In this leads to the accumulation of the doshas, Meda and Rakta, along with the other doshas, followed by the formation of the Prameha Pidaka, which converts into the wounds after putrefaction, that is diabetic ulcer. Prognosis of the Madhumeha Vran. While describing the prognosis of the Vran in Sutrasthana chapter 23, Sushruta had stated that the Madhumeha Vran, that is diabetic ulcers, are kashtasadhya, difficult for management. Further, Sushruta specified that the wounds over the lower limb to delay in healing. Next. About leech therapy, it considered most unique and most effective method of bloodletting. It can be tried in all mankind, including female, children's, old, and patients having poor threshold to pain. It drains improved blood, useful in Pitta Dushti, Rakta diseases, varicose skin disorders, and all types of inflammatory diseases. Reference of the indication of the leech therapy in wound in Sushruta Samhita, Chikitsastan chapter 12 and 16. Next. Case study. 46-year-old female patient came with the chief complaints of non-healing wound in the left second toe, black discoloration around the wound, foul smell and discharge of the wound, and loss of the sensation over the second toe. Complaints are from 2 months and had no history of history of stroke 4 years before, and on Ecosprin 75 mg, 1 tablet OD. Intervention. In our hospital, we are treated her The 4 settings of the Jalokaucharan for 12 days with the interval of 3 days between each setting. After first 2 settings of Jalokaucharan, foul smell and discharge reduced, feeling of pain in the affected area started and slug reduced. Third setting of Jalokaucharan, full sensation was annihilation tissue seen. And after fourth setting, there is a complete cure. These are the pictures of before treatment and after treatment. The observation of the prognosis of the ulcer as per assessment criteria, day 1, day 3, day 6, and day 9 and 12. Size is reduced from 2 centimeter up to the 0.5 centimeter. The pain at the day 3 was there, but at day 12, it is reduced completely. Floor with a slough material, and at the day 12, there was healthy granulation tissue. Discharge decrease and smell decrease. Discussion with the leech therapy, the wound completely healed within 12 days. Probable mechanism of the action of the leech therapy. It improves blood circulation, reduces congestion, corrects diabetic microangiopathy. Vasodilator effect and anti-inflammatory effect was there. And next, probable mechanism of action, there is a Vranashodhan, Vranaropan, Madhumeha pacifying effect, that is bloodletting with the leech application pacifies Madhumeha, that is it breaks the pathogenesis of the Madhumeha at cellular level and inhibition of the infection. Next. Conclusion, with the leech therapy, the wound completely healed within 2 to 3 weeks, whereas statistical reveals that about 30% of diabetes patient neuropathic ulcers receiving standard care receives around 20 weeks of healing. Thus, the leech therapy proves to be effective, time-saving, affordable, and acceptable treatment. Though treating diabetic foot is a difficult task, we have managed to treat it with the leech therapy along with the conventional Ayurvedic method of wound care. Thank you.
Thank you, doctor. Next, I invite Dr. Akanksha Vijay Sheikh for the paper presentation. Dr. Akanksha, are you there?
Yes, sir.
Okay, doctor, please share the screen, doctor. The screen is visible, doctor.
Namaste.
Please.
My name is Dr. Akanksha Vijay Shirke, PG scholar, first year, Department of Dravya Guna, GAMC, Bangalore. My topic is a review of CASA treatment according to Dravya Guna aspect with reference to Charaka Samhita. Introduction. CASA has been described as an independent disorder as well as a symptom of many diseases like Tamak Shvasa, bronchial asthma, Rajashma, etc. CASA is the disease or a symptom of respiratory tract according to obstruction of Vata dosha and its reverse movement. Pranavayu obstructed in the respiratory tract due to various reasons attains upward direction and comes out with a force making specific sounds called as CASA. Types of CASA. When occurring as an independent disease, it has mainly 5 different presentations as described in Charaka Samhita: Vatach CASA, Pittach CAS, Kapach CAS, Kshatach CAS, and Kshayach CAS. Clinical diagnosis and examination of CASA. CASA pravritti, that is kapha, aruchi, anorexia, jwara anubhuti, that is feverish, kapha shthivana, that is expectoration, and other specific dosha symptoms are mentioned above. Throat congestion in almost all types, specifically in Vatach and Pittach CASA, mucopurulent, greenish sputum with foul smelling in a Kshayach CASA, raised body temperature, raised pulse of feverish feeling in a Pittach, Kshatach, and Kshayach CASA, emaciated and debilitated general condition along with fever, mucopurulent sputum in Kshayach CASA, on auscultation of chest, congestion, crepitation due to mucus and fluid trapped air in Kapach CASA, and wheezing in Pittach or Kapach CASA. Vatach or Pittach CASA. Treatment of CASA according to Dravya Guna aspect. List of drugs used in treatment of CAS are as follows: Kantakari. The Latin name is Solanium virginianum, family Solanaceae. Pipali, Piper longum, family Piperaceae. Shunti, Gingiber insularis, family Gingiberaceae. Maricha, Piper nigrum, family Piperaceae. Rasna, Lucia lanceolata, family Astraceae. Vidonka, Ambelia rebis, family Primroses. Shadi, Edicium spictum, family Gingiberaceae. Duralabha, Pagionata cretica, family Fabaceae. Vasa, Aditoda vasica, family Acanthaceae. Chitraka, Plumbago xylanica, family Plumbaginaceae. Haritaki, Terminalia cebula, family Combretiaceae. Khadira, Acacia catechu, family Mimosaceae. Jiraka, Umbelliferous, family Apiaceae. Madanaphala, that is Randia spinosa, family Rubiaceae. Vaka, Cinnamomum verum, family Lauraceae. Bidari, Purea tuberosa, family Fabaceae. And Patha, that is a Cyclia peltata, family Menispermaceae, etc. Vatashkasa treatment. Snehapana is the first step in a Vatashkasa. वातनाशक द्रव्य सिद्धघृत बस्ति पेय यूषक क्षीर मांसरस धूम अवलेह अभ्यंग परिषेक can be used as snehapana. Example, Kantakari Ghuta with Godugda and Pippalati Ghuta with Peya or Manda. For preparation of this Pippalati Ghuta, Pippali Mula, Chavya, Chitraka, Patha, Rasana, Hingu, etc. Dravyas will be used. Trishnadi Ghuta. For preparation of Trishnadi Ghuta, Shunti, Maricha, Pippali, Haritaki, Manuka, etc. Dravyas will be used. Rasna Ghuta, Rasna, Dashamula, Shatavari, etc. Dravyas will be used for preparation of Rasna Ghuta. After Snehapana, Churnas, Ableha, Dhuma, Peya are the further treatment for Patachkasa. Further treatment as follows. Vidanga Churna with Brita, Duralabhadileha, Dusparshadi Leha, Vidangadi Avaleha, Chitrakadi Avaleha, Agastadi Haritaki, and Dashmula Peya. This is the treatment of Patachkasa. Pittachkasa treatment. If there is a if there is a kapha anubandha in Pittachkasa, then a woman should follow. If there is a hin anubandha of kapha, then Virechana should follow firstly as a treatment. Avaleha made from Pittanashaka dravyas like Pippali, Manuka, Murva, Shunti, Amalaka should be used due to Shita Virya, Kashaya, Tikta, Madhur Rasa, it supplies increased Pitta, Pitta Rasa, Siddha Sneha with Madhu, Sharkaradi Yoga, and Vidaryadi Yoga. Pippali, Maricha Shmunti, Ela, Siddhagrita, Sthiradi Kshirapaka, which is made from Jivaka, Rishabhaka, Amalaka, Bhumi Amalaki, Mishri, etc. And Sharadi Kshirapaka, which is made from Kusha, Kasha, Darva, Pippali, Manuka, etc. Dravyas. Maricha Churna and Kantakaryadi Vatha can be used in Pitta Kasa treatment. Kafach Kasa treatment. In Kafach Kasa treatment, if the patient is strong, Vamana is the first step of treatment. After that, Ruksha, Katu, Ushna, Anupana follows. In Kafach Kasa, after food, Madhu Sevana, Kanji, Amla Dadi, Swarasa, hot water. Madirapana is considered as a Hitkara. Purushakadi, Hima made from Purushka Mula and Amalata should be used. Katafaladi Kwatha is used with Madhu or Grita. Grita Parjita Hingu Kwatha. In patient which have a Vata Anubandha with Kafajakasa. Pathadik Vata with hot water, Nagaradi Vata with hot water or Grita Bharjita Hingu, Kasamadadi Yoga with Madhu, and Dashmuladi Guta for Vata Pitta Janya Kasa. Treatment of Kshataj Kasa. Kshataj Kasa treatment described the same as Pittash Kasa treatment. Grita Abhyanga specially mentioned in Kshataj Kasa treatment. Jivaniya Ganadravya should be used for Kshataj Kasa treatment. Trina Panchamula Siddha Chaga Kshira for Rogi who is Trishna Pidita in a Kshataj Kasa. Jivanyagana Siddha Gritpana is the best treatment for Kshataj Kasa. After that, Bhumpana with the Meda, Mahameda, Bala and Mahabala Dravyas. Madhura Rasa, Shita Virya, Guru Guna Dravyas have Balya properties like Jivanyagana. So Jivanyagana should be used in Kshataj Kasa. If there is a Rakta Pravritti through mouth, then Godugda Siddha Grita Nasya and Gritapana is mentioned as effective. Kshayash Kasa treatment, according to Charaka Acharya, in a chronic Kshayash Kasa treatment is contraindicated. In acute Kshayash Kasa, Grimhana is the first step of treatment. Grimhana with in Mutra Vivarna condition of Kshayash Kasa, Vidali Kanda or Kadamba Chalakvat used in Kshatrash Kasa along with Shotha Vedana in Buddha Pradesh, Gritamanda with wait, sir. I want 2 minutes. The Panchamuladigrita, Gudichadigrita, or Kasmadadigrita can be used in a shared treatment. Haritkari Avaleha, Drakshadi Avaleha, Chitrakadi Leha, Jimatadi Leha can be used. Yavagu Prayoga the treatment of shared Kasa. Conclusion: Kasa is the individual disease of Pranavaleha Srotasa and symptom of many diseases like Rajyashma. When it is individual, it has a 5 types: Patach, Pittach, Kapach, Kshatach, and Kshayaj Kasa. For treatment of different type of Kasa, different medicinal plants and yogas made up from different dravyas mentioned in Charak Samhita. For Vatach Kasa treatment, Madhura Amla Lavana Rasa, which is considered as a Vata Samshimana Rasa, Madhura Vipaka dravyas and Ushna Guna dravyas used, which suppress increased Vata. For Pittach Kasa treatment, Madhura Batu Tikta Rasa, Shita Virya dravyas mentioned, which inhibit the increase of Pittach effect. For Kapaj treatment, Katu Tikta Kashaya Rasa, Ushna Virya, Katu Vipaka dravyas mentioned. For Kshataj Kasa, Kshataj Primhana, Jivanyagana, Madhura dravyas, Vitabalya Gunas mentioned. Viparita Guna dravyas inhibit the increased dosha effects. So Viparita Guna dravyas mentioned for treatment of Kasa. Thank you.
Thank you, doctor. Next, I would like to invite Dr. Akriti S. Gowda for the paper presentation.
Yes, sir.
Okay, doctor. Please share the screen, doctor.
Is it visible, sir?
No, doctor. Once again, please share, doctor.
Yes, sir. Now?
Yes, now visible, doctor.
Yes, sir. Good evening. Myself, Dr. Akriti S. Gowda, PG scholar, first year PG scholar, Department of Shalya Tantra from Government Ayurveda Medical College, Bengaluru. My topic is Ayurvedic Management of BPH, guided by Dr. Srinivas Maslika, sir. Introduction. Sir Benjamin Brodie wrote as, when the hair becomes grey and scanty, when specks of earthy matter begin to be deposited in the tunics of the artery, and when white zone is formed at the margin of the cornea, at the same period, the prostate gland, usually, I might perhaps say invariably, becomes increased in size. Prostatic hyperplasia is an almost universal phenomenon in aging men. It is the second highest operation of the old age next to cataract. Prevalence increases with age each decade of life. Histological evidence confirms that BPH occurs in 50% of men aged 51 to 60 years, 79% of men aged 71 to 80 years, 85% of men older than 80 years. Moderate to severe lower urinary tract symptoms are observed in 33% of men in their 50s and in more than 40% of men beyond this age. More than 25 million of elderly men are suffering from moderate to severe degree symptoms of BPH. Benign prostatic hyperplasia or prostate adenoma refers to the non-malignant growth of prostatic tissue in men from middle age onwards. In a young man, the prostate gland is at almost undetectable rudimentary stage and spreads across the coating of the urinary tract like a cluster of seeds. During puberty, due to the increased production of the testosterone and dihydrotestosterone hormones, its forms begins to change. Causes. The etiology of BPH is not clearly understood, but advancing age and testicular androgens are implicated as causes. The first one is hormonal theory, the most acceptable one. As the age advances, imbalance between androgen and estrogen may be the causative factor. Androgen diminishes as the age advances, but quality of estrogen increases, which leads to enlargement of prostate. The second one is neoplastic theory. According to this theory, there is proliferation of all the elements of prostate, this fibrous, muscular, and glandular elements, resulting in fibromyoadenoma. Symptoms are, in BPH, enlarged gland may compress the urethra, which causes through the center of the prostate. This can impede the flow of urine from the bladder through the urethra and causes lower urinary tract symptoms, which are characteristics of BPH. Lower urinary tract symptoms can be typically divided into bladder irritative symptoms such as dysuria, frequency and urgency, and obstructive symptoms such as hesitancy, weak stream of urine, dribbling, and incomplete emptying of bladder. The treatment. Early diagnosis of benign prostatic hyperplasia is essential to avoid complications such as UTI, damage to kidneys or bladder, bladder stones, and incontinence. The present modern conservative treatment includes either alpha-1A adrenoreceptor blockers or 5-alpha reductase inhibitors or both in combination, which are dose dependent and known to cause dizziness, decreased libido, retrograde ejaculation, impotence, postural hypotension, gynecomastia, skin rashes, and fever vascular side effects. And withdrawal of these drugs result in regrowth of prostate. And surgical procedures include transurethral resection of prostate, Freya suprapubic transvesical prostatectomy, Millin's retrograde prostatectomy, microwave treatment, electromagnetic treatment, holmium laser treatment, intraurethral stents, etc. But surgical intervention is difficult because of old age and risk of cardiovascular diseases, pulmonary conditions, hypertension, and diabetic mellitus are high. However, surgery is invasive, expensive, and has post-operative complications like hemorrhage, infection, incontinence, perforation of bladder, stricture urethra, retrograde ejaculation, impotence, and recurrence. Considering these complications, recurrence, and cost of surgery, Ayurvedic management is simple, safe, and cost-effective. Ayurveda is an age-old traditional medical system still practiced in India and also recognized by WHO. Ayurveda describes two conditions known as Mutrakrishna and Mutraghata, which are major conditions seen in BPH. Historical review. The earliest reference regarding the disease Vatastila is available in Sushruta Samhita. Later Ayurvedic authors have also described about this disease in detail. Vatastila is one among the 12 types of Mutraghata mentioned by all the acharyas like Sushruta, Charaka, Vagbhata, etc. And it is caused due to deranged Apanavata lodged in the region lying between the Shakrut Marga and Basti, causing a Granthi which is Ghana, Vedana Yukta, Ishak, Chalavat, resulting in obstruction to Shakrut, Anila, and Mutra. Of the several types of Mutraghata, certain features stimulate that of BPH encountered in current modern surgical practice, but the etiology is attributed to involvement of doshas in any growth anywhere in the Mutravaha srotas. In Vatastila, there is growth in between the rectum and urethra, which is leading to symptoms such as Sanga, etc. BPH correlates with Vatastila, having similarities in symptoms and surgical anatomy. Chikitsa, there is a very clear line of management advocated by various acharyas, and all the aspects of Antaparimarjana and Bahirparimarjana are integrated for treating Mutraghata. The approach towards the treatment of disease is completed initially from Nidana Parivarjana to Patya Apatya. The common Chikitsa Sutra under the caption of Mutraghata is mentioned below. According to Sushruta, Kashaya Kalka Sarpishi Bhakshyan Lehan Payasincha Kshara Madhyasava Svedan Bastichottara Sangitan. The drugs in the form of Kashaya, Kalka, Sarpi, Avaleha, Payasa, Kshara, Madhya, Asava, Svedana, Basti, Uttarabasti are told in context of Ashmari, Mutrodavarta diseases. These are also useful for managing Mutraghata. The different yogas which are mentioned by different acharyas in context of Mutraghata are as follows. Swarasa yogas are Nidigdikadi Swarasa, Amalaka Swarasa, Nilotpaladi Swarasa, Kanthakari Swarasa, Duralabha Swarasa, etc. And Kalka of yogas are Ervaru, Bija Kalka, Mustadi, Abhayadi, Draksha, Baladi, Shigrumula, Pashana Bedade, etc. And Kwatra yogas are Devadarvyadi, Shatavaryadi, Haritakyadi, Trinapanchamuladi, Pashana Bedadi, and Naladi. Churna yogas are Vyoshadi, Ela, Pravala, Pashana Bedadi Churnas, Pippali Churna, Surasa, Bibitaka, Ushradi Churnas. Vati or Guti Kalpanas are Chandraprabha Vati and Gokshradi Gugulu. Kshirapaka yogas, Kakolyadi, Traikantakadi, Kshirapaka. Sneha or Gruta Kalpanas, Balagruta, Mahabalagrita, Punarnavadi Mishraka Sneha, Pashana Bedadi Grita, Swadansha Grita, Dashamuladi Grita, Badravaha Grita, Dhanika Gokshara Grita. Kshara yogas, Patalakshara, Patalyadikshara, Kalyanakshara, Yavakshara, Avaleha, Swaguptadi, Avaleha, Pani yogas, Punarnavadi yoga, Sandana Kalpana yoga, Sura, Madhya, Madhukasava, Tiladi Kshara Yukta Sura. Upanahas, Punarnavadi Punaha, Yavagus, Saptachadadi, ಯಾವಾಗು, ಗೋಕ್ಷುರ ಕಂಠಕಾರಿ ಸಿದ್ಧ ಯಾವಾಗು, ಬಸ್ತಿ ದಶಮೂಲಾದಿ ತೈಲ, ಬಿಲ್ವಾದಿ ತೈಲ, ಶತಾವರಿಯಾದಿ ವಾಸೋತ್ತರ. Useful single herbs in BPHR. In Vedic literature, number of single herbs are indicated in the management of many diseases. In Samhita period, various formulations are introduced for the treatment of one or more diseases, but references of Ekamulika Prayoga are also found in abundance. Chikitsa Granthas, Nigantus play a very important role in Ekamulika Prayoga as they provide a list of diseases on which a single drug is effective. Same drug acts on different diseases when given in different form with different anupanas. Usage of single herb will reduce the exploitation of plant materials otherwise commonly used. It will also help to reduce the addition of plants to endangered list of medicine plants. The useful single herbs are Gokshura, Varuna, Punarnava, Ushira, Shirisham, Shvetachandana, Kadira, Bala, Shatavari, Silajitu, Yavakshara. The herbs of Varuna, Shirisha, Bala, Punarnava contains beta-sitosterol. Beta-sitosterol has been proved potential in reducing BPH by improving urologic symptoms and flow measures. Patya and Apatya. Lastly, the most important and the most neglected aspect of the treatment is that of Patya and Apatya. Dietetic control will give boost to the drugs administered and therefore enhance the results of these given drugs. Patya Patya for managing the disease Mutagata is briefly described in the text as follows. Patyas, Abhyanjana, Sweda, Virechana, Basti, Avagaha, Sweda, Uttarabasti, Lohitashali, Puratana Mamsa, Madhya made by Dhanya, Takra, Mashyosha, Purana, Kushmandafala, Patola, Ervaru, Kharjura, Narikela, Mastaka of Talafala, Puranashali, Yava, etc. Apatyas are Virdhanahara, which are Ruksha, Vidahi, Vishtambi, and Vyavai. Vegadharana, Vamana, Mutra Vegavarodha, etc. are apatyas, as they all lead to the vitiation of vata and results in further deterioration of the condition of aghata or urine retention as well as obstruction in flow of urine. Thank you, sir.
Thank you, doctor. Next, I invite Dr. Diksha Prakash Patil for the paper presentation. Dr. Diksha, are you there?
Yes, sir.
Okay, doctor. Please start the session,
Sir,
doctor.
can you please share my PPT?
Please start the session, doctor.
Okay, good evening, everyone. Myself, Dr. Diksha Prakash Patil, PG scholar, second year, Kamar Vritti Department, Government Ayurvedic College and Hospital, Nanded. My topic is role of Abhyanga in neonates. Next slide. Abstract. The Ayurveda aid to provide systematic, luxurious, and sophisticated neonatal care. One of it is oldest techniques of Abhyanga, preventing diseases and promoting health and healing. It has been included as a part of pre-therapeutic procedure of Panchakarma and treatment measure for a certain diseases. Next. It is also included as a Dincharya, part of Dincharya as a health maintenance. Abhyanga is a child care protocol which mentions scientific approach toward newborn care as Jat Matra Paricharya. It plays a pivot role in increasing the strength and nourishes body, improves skin texture, and accelerate the healthy growth of development of newborn. The present paper explained the role of Abhyanga, which is traditional ancient practice, and its benefit and indication, contraindication, also contribution to modern health society. Next. Introduction. As the newborn period is extremely critical and foundation of adult human life, neonatal care is therefore very important area of health practices. And in India, traditional newborn care is going on till today. Ayurveda explains very delicate and sophisticated protocol for newborn under Jat Matra Paricharya, considering the smooth transition of newborn baby. Next. Abhyanga is one of the procedure, and for Ayurveda, there are some other method like application of oil around the over the body, like Samhanan, Parishek, Abhyanga, and Mardhan. Out of this, Abhyanga means the application of oil or untouched substance on particular body part or entire body with optimum pressure applying strokes and in particular direction. Abhyanga to newborn baby is very helpful for healthy growth and development. Next. To review and evaluate the importance of Abhyanga in neonate, to discuss the scientific background of the Abhyanga in neonate. These are the aims and objective of my study. Next. Next slide. Next. Concept of Abhyanga in Ayurveda. Abhyanga therapy is ancient practice which predates the Vedic period. What is Abhyanga? Abhyanga means applying oil and lightly massaging the body. You can use warm warm oil or for massage into entire body depending upon the climatic condition of the region. So it can be beneficial for maintaining health and used as a medicine for certain disorder, incorporated into routine appropriate for almost everyone, especially in the newborn child. Next. So for the purpose of Abhyanga, we can use following oil like Bala tel, Lakshadi tel, Ashwagandha tel, Bala Ashwagandha tel. And out of this, Bala tel is the best remedy for newborn Abhyanga. Next. Abhyanga, selection of oil. So depending upon the properties of oil and depending upon the condition, we can select whether which oil we want, like sesame oil, sunflower oil. Next slide. Bala oil or mustard oil. Next. Benefits of Abhyanga. So Abhyanga, it will nourish the body and makes the skin more fairer and attractive. It increases the working capacity of body by increasing the stamina or strength and prolonging the lifespan of human being. It prevent the aging of body tissues, pain, fatigue, and lassitude. And all these benefits are also special concern in case of neonates. So how? Newborn passes through the tedious birth process through narrow birth canal, experiencing the fatigue, pain, and lassitude, and this all are prevented by the case by using Abhyanga. Also, the newborn skin is very delicate, requiring additional care as compared to adult. And newborn is in growing phase, and growth velocity is highest in this period of life, which demands continuous nutrition. And this can be given with the help of Abhyanga. Next. Other benefits of Abhyanga, it relax and soothen, depends bonding, then improve communication, contribution to growth and development, help baby to better sleep. Then Abhyanga should be performed in Anulom Gati for proper absorption of the oil. Next. Now the direction of Abhyanga. So Abhyanga should, we have already discussed that the Abhyanga should be performed in Anulom Gati for the proper absorption of oil by follicle and duration. So Dalhan has decoded the relation of time of Abhyanga with the nourishment of 7 tissue, that is 1 matra is equal to 16 by 60 second. And I have also discussed here the duration of Abhyanga in matra depending upon the structures of body, like hair follicle it will take 300 matra and so on. Next. Here are some labh of Abhyanga which is mentioned in Ayurveda. Application of Abhyanga. When to start? Abhyanga can be practiced right after birth and once the baby is vitally stable. So there is no specific time or indication. So when we should start the procedure, only the healthy neonate we want. Then time of procedure. Anytime we can start the application of Abhyanga, but the ideal time to do Abhyanga is in the morning. So room temperature should be not less than 25 degrees Celsius in order to prevent hypothermia in baby. How many days in one setting? So one can continue the Abhyanga till the completion of infantile age, that is 1 year of life. Next. Its indication, very safe procedure which can be done on every baby who is vitally stable. Then contraindication, there is immediately after feeding, baby with hypothermia, sick babies, congenital heart defect, and ARDS, that is acute respiratory distress syndrome. Discussion. Neonatal health is one of the very crucial health challenge faced by developing countries. So Abhyanga, which is a part of it, is very effective and economically convenient method for people. So prevention of neonatal morbidity is also a big topic, keeping in mind discussing the classical text of Ayurveda. So the Abhyanga increases the vagal activity, which may lead to increasing gastric motility, is activity, and thereby causes weight gain in neonate or baby. Also their proper growth and development. So we can try that Abhyanga in low birth weight babies also. Next. Conclusion. Abhyanga is one of the important part of Zatmatra Parichara, as we have already discussed about it, and very effective to gain weight, reduce pain, enhance immunity, and accelerate the health growth and development of baby. Proper selection of oil is also very important. Certain precaution under medical supervision and advice. One can practice Abhyanga from birth to lifelong without any harm in the massage to modern health world. It in short, it can be concluded that without the therapeutic and pharmacological consideration, it is impossible to obtain the desired therapeutic action of massage therapy. Here are some references. Thank you.
Thank you, Doctor. Next, I invite Dr. Jyoti Chauhan for the paper presentation.
Hello.
Hello.
Yes, sir.
Doctor, please share
Sir,
screen,
can you
Doctor.
share my slide?
Okay, Doctor. 1 minute, Doctor. So please chat, Doctor.
Yes. Good evening, everyone. I'm Dr. Jyoti Chauhan, PG resident, second year, Shalatantra Department, guided by Dr. VP Ukhalkar sir, Associate Professor, Shalatantra Department. My topic is clinical study of Shodhan and Ropan efficacy of slide. First slide. Ropan efficacy of local application of Ayurvedic in the management of Dushtovran. Next slide. Next slide, please. Introduction. Ayurveda is an ancient science of life in prides of India. Ayurveda dealt with many dreaded diseases. Ayurveda has propagated many excellent remedies for the Vrana, Shodhan and Ropan. Acharya Shushruta, pioneer in the art and science of surgery, has described widely about the Vran and its Shodhan and Ropan. Next slide. The Ayurvedic Grit is among one of them. Gadanigra mentioned it as one of the best for Shodhan and Ropan. Acharya Shushruta in the Shushruta Sahita, Sutrastan described the Sashti Upkram for the Vrana, Shodhan and Ropan. In Shushruta Sahita, Vran disease is described by the Acharya Shushruta in Sutrastan 21 Adhyay. According to Acharya Shushruta, there are mainly two types of Nij and Agantu Juran. Next slide. According to the modern science, wound is definition of wound is any break in the continuity of the soft tissue due to any violence. There are many types of the wound. Mainly, it is divided into three types. First is closed wound or open wound, tidy and untidy wound, and third one is acute and chronic wound. Next slide. Wound healing. Wound healing, it may be by primary intention or secondary intention. First, healing by primary intention. It occurs in a clean incised wound, such as the surgical incision, wherein there is only a potential space between the edges. It produces a clean, neat, thin scar after suturing. And second, by secondary intention, here healing is by secondary intention. It refers to a wound which is infected, discharging pus, or wound with a skin loss. Such wound deals with a ugly scar. This type of healing take large time, comparatively healing by the first intention. Now I am presenting the case which will be open wound has cases been taken. Next slide. According to Ayurveda, Vran ke mainly two types. Nijuran and Agantujuran. Acharya Shushruta has explained Vran Avastha. Nijuran four types: Dushtavastha, Shuddhavastha, Ruyaman, and Agantujuran, it's Shuddhavastha, Dushtavastha, Shuddhavastha, Ruyaman, and Runavastha. Next slide. Next slide, sir. Case description. A female patient of age 46 years complained of wound over left foot. Patient is having complaint since 1 month and took conservative treatment dressing at private hospital but got no relief. There is no history of diabetes, hypertension, TB or any other major illness. There is no surgical history. All vitals are stable. Next slide. Local examination. Local examination in we see the infected wound present over left foot near lateral malleolus of size 4 by 3 centimeter. There was slough present, mild, serious watery discharge present, tenderness present, and no local temperature. So we diagnose infected wound, that is Dushtavrana. Next. On general examination, it is a general examination is good. A febrile pulse is 76, BP 120 by 80, no icterus or no pallor seen. In systemic examination, all vital parameters were seen within the normal limit. Patient was hemodynamically stable. Laboratory investigation, we said HB 11.5 gram percent, BT 2.10, CT 3.30 minute. Basal random was 68 mg%. HIV, HBs, AG are negative. Next slide. Treatment, we had applied a local application of Ayurvedic once a daily, and but we have taken follow-up record on 3rd, 5th, 9th, 15th, and 20th day. Next. Drug description. The Ayurvedic has been prepared according to the Snehi Kalpana Vidhi as per Sharangal Sahita Madhyam Khand after Ghrita Murshana. The Ayurvedic having 9 content: Daru Haridra, Yashti Madhu, Lodra, Nakeshwar, Patulpatra, Haritki, Amlaki, Vibhitak, and main Grit. The mode of action of the Ayurvedic is the Ayurvedic content are mostly Katutikta Rasatmak, which help in Shodhan, Laghu Ruksha, Gun, Kled, Shoshan, and Kasai Rasatgras, Vrin Ropan Heli. Next slide. Assessment criteria. It is mainly divided into 4 grades: 0, 1, 2, 3, 4. In 0 grade, a slough is absent, discharge absent, and the wound closed, healthy, and healthy granulation present. In grade 1, slough covered up to 25% of wound, 0 sanguineous discharge may be present, 75% wound covered with the granulation tissue. In grade 2, the slough covered with the 25 to 50% of the wound, there may be a serous discharge present, and 50% of wound covered with granulation tissue. In 3rd grade, slough covered with the 50 to 70% of the wound, purulent discharge without swelling is seen, and unhealthy granulation with mild slough is present. And in 4th grade, slough covered all over the wound, purulent discharge with foul smell is present, and there is no granulation is completely absent. Next slide, please. In overall, we can see it can be assessment criteria can be divided into 3 types, that is healed, improved, and non-improved. In healed, wound is completely healed, scab formation is seen. In improved, wound size is reduced, baseline is formed. And in not healed wound, no reduction in size or a complication. Example, increased pus formation. Next slide. Here I had shared the images on application of the local Ayurvedic grid. Day 1 images, day 3, day 5, in day 9, and day 15 after in day 20. There is a healing. Next slide. These images are before treatment and after treatment. Next slide. Discussion. Acharya Shushruta, pioneer of Sashildar, enumerated Vrana Chikitsa in his legendary book Shushruta Samhita, in which he described Vrana causes, Chikitsa, Pathya, in very detail. He also explained the types of Vrana and their management, among which the Dushta Vrana is a type which can be correlated with the infected wound. The Ayurvedic with Shodhan Karma along with Ropan helps to heal the wound completely. In the Ayurvedic all the contents are easily available and easy to prepare. The Vivai Gun of a Grit also help in absorption of the grit, and also it is anti-inflammatory. Conclusion. Next slide. According to Materia Medica, content of the Ayurvedic has antiseptic and anti-inflammatory property. Also have a Vrana Shodhan and Ropan effect. The Ayurvedic contents are mostly Katu, Tikta, Kashaya, Rasatmak and help in Kled, Shoshan, Vrana Shodhan and Ropan. This study is carried out to establish effective, convenient, non-invasive therapy to reduce the time period of wound healing in the management of Dushta front, that is infected wound. Vivai Gun of Grida also help in absorption of grit, and also it is anti-inflammatory. So the Ayurvedic grit reduces slough completely and offers healthy granulation and tissue formation. Next slide. References are here. Thank you so much.
Thank you, Doctor. Next, I invite Dr. Bharati for the poster presentation.
Good evening. Can you please share my poster?
Okay, Doctor. 1 minute, Doctor.
Yes, doctor.
Doctor, please start. Doctor.
Good evening, myself Bharti, final year PG scholar, Department of Procedure and Yoga from Government College, Vijayawada. Today, my poster is on Sutika Paricharya. When coming to definition, a woman who has just given birth to a child followed by the expulsion of placenta is called Sutika. Acharya Rukshitha has mentioned that after 1.5 months of regulated and specific dietary mode of life, she will become free of Sutika Paricharya. Different acharyas opines different Sutika Kala, like after the next Raja Darshana. Coming to the first Paricharya, which is exclusive breastfeeding. Exclusive breastfeeding is especially advised to the Sutika, like puerperal woman. That is because breast milk contains everything that baby needs for first 6 months. And here, the breast milk provides optimal nutrition for babies. It has the right amount of nutrients and is easily digested and is readily available. There are many benefits of breastfeeding, like it provides ideal nutrition for the babies, and the fluid called colostrum, which is high in protein and low sugar and loaded with beneficial compounds. It is truly one-diet food and it is not replaced by any formulas. Colostrum is ideal breast milk and helps a newborn immature digestive tract develop. After the first few days, the breast milk start producing large amount of the breast. And particularly, colostrum provides high amounts of immunoglobulins A. IgA protects the baby from getting sick, forming a protective layer inside the baby's nose, throat, and digestive system, which will help the baby to be immune against diseases like pneumonia, diarrhea, and other infections. Breastfeeding may reduce different diseases like middle ear infections, respiratory infections, cold and infections, gut infections, etc. Breast milk provides babies, it promotes the baby's weight. Like the main key hormone is leptin. Leptin is the key hormone which is present in the breast milk, which is very much needed for regulating the appetite and fat storage. And it also makes the children smarter and for brain development. Coming to Patya and Apatya, as we have already discussed, the Patya comes like this. The first one is Abhyanga. Abhyanga should be given to Sutika, especially with Bala Taila, which helps to tone the pelvic floor muscles, abdominal muscles, and back muscles, and relief from the muscle spasm. It also helps in recovery from soft tissue injury by increasing the circulation and also improves the dilation. Next, Parisheka and Navagaha. Parisheka, this is in the hot water and steam, which is Vatahara, and also the abnormal blood clots are accumulated in the uterine cavity after the delivery of Garbha. It properly eliminates the Vata dosha. And the Patta Bandhana, which is Udara Veshtana, it provides initiation of Vata dosha by compressing hollow space producing after expulsion of the fetus. Abdomen should be tightly wrapped with long cotton cloth after bath. It provides support to the back and abdomen. It helps mainly the uterus to shrink back to its normal size and also helps us to straighten after the pregnancy for improvement. And the diet like Lagu Panchamula, which helps for exclusive breast milk secretion, and the few drugs like Panchakola used for Deepana Pachana, which subsides the Agnimanda and increases the appetite of the Sutika. And also they have the antibacterial and antibacterial activities and also anti-helminthic activities, and Dhupana is advised to prevent from the UTI infections and other infections. Coming to conclusion, the diets and regimens which are described by Acharyas have a total significant value and also beneficial. The woman becomes weak and emaciated due to growth of the fetus and also empty body due to instability of all the habits, labor pains, excretion of Sveda and Rakta. By Paricharya, she attains all the losses and reaches her pre-pregnant state. Thank you.
Thank you, doctor. Next, I invite Dr. Shraddha for the paper presentation.
Yes, sir. Am I audible, sir?
Yes, doctor, audible, doctor. Please share the screen, doctor.
Yes, sir.
So next I invite Prashant Jadhav.
Yes, sir. Yes, ma'am. Ma'am, can you please share my PPT? Hello.
Okay, 1 minute, doctor. Doctor, please start the session, doctor.
I am Dr. Shraddha Prashant Jadhav, second year PG scholar, Kai Chikitsa department from SMBT Ayurved College and Hospital. My topic is management of hypothyroidism by Panchakarma. Introduction. Hypothyroidism is emerging as a common health disorders in India and also as worldwide. Hypothyroidism refers to a state where there is deficiency of thyroid hormones, including hypothalamic pituitary disease and generalized tissue resistance to thyroid hormone and disorders that affect the thyroid gland directly. The prevalence of hypothyroidism is more in females, with male to female ratio being 1:6. Hypothyroidism influences the standard of living, and in spite of many progresses, the modern management of hypothyroidism remains upsetting. The next, sir. Hello. Next slide. The modern management includes synthetic thyroid hormone, which patient has to take lifelong and has certain side effects such as weakness, muscle cramps, palpitation, tachycardia, restlessness, osteoporosis, etc. Panchakarma therapy is designed to eliminate vitiated doshas through the nearest root and attain state of equilibrium. It is a treatment of body, mind, and consciousness that cleanses and rejuvenates. Next. Clinical features, signs, slow pulse rate, hair loss, dry core skin, swelling of limbs, cool extremities, delayed relaxation of tendons, myxedema. Symptoms, fatigue, constipation, poor appetite, weight gain, hoarse voice, irregular menstruation, poor concentration. Next. Ayurvedic approach to hypothyroidism. In Ayurveda, there is no direct reference of hypothyroidism, but a disease named gallganda characterized by neck swelling is well known. The clinical features of gallganda and hypothyroidism are vaguely similar. According to Acharya Vagbhat, kapha-associated pitta dushti with vitation of vat due to marga avaran and involvement of rasavaha, medovah, maunsavaha srotodushti can be considered as a cause of this disease. Galganda is explained in Shushrut Sahita, Yog Ratnakar, and in Charak Sahita. Next. Chikitsa of Galganda, Chardi Virechanam Nasyam, Svedo Dhuma Sira Vyadhya, Agni Karma Shara Yoga Pralepo Langhanani च. Bhaishajya Ratnavali Galganda Chikitsa. Next. Vaman. According to Vagbhat, Vaman eliminates kapha dosha associated with pitta. Hypothyroidism is kapha avrutta saman vayu and pitta dushti. So it helps to eliminate doshas and release marga avrut. Vaman karma is considered as a best purificatory measure and sroto shodhaka. It helps in sroto vishodhan, agni vardak, and also helps in normalizing the pratilom gati of vata. Vaman can be done with madanfal. Virechan expels increased doshas out of the body through adhomarga. It acts as Rotoshodak, Agnivardak, and Anulomak. Virechan can be done with Trivritta, Haritaki, Aragvat, Danti, Dravanti, Gandharva Hastyadi tail. Next. Nasya. The stan of thyroid gland is Urdhva Jatrugat, which is Kapha stan. For elimination of Kapha, Shiro Virechan Nasya is indicated by Acharyas. Nasya karma stimulates the olfactory nerve, which acts on higher centers, that is hypothalamus and pituitary gland. Tumbi tel, Vyoshadi tel can be used for Nasya karma. Basti. As per research, Lekhan Basti is effective in the treatment of hypothyroidism. It does shaman of vata, which is avrit by kapha dosha. Shara Basti can also be used for management of hypothyroidism. Next. Conclusion. Hypothyroidism is a disease which includes a group of symptoms. In Ayurveda, we may consider it as Vyadhi Sankara. Through Panchakarma Chikitsa, Srotoshodhan, Agnivardak, Vatanuloman, and Kapha Shodak properties can be achieved. So Panchakarma is very useful in the management of hypothyroidism. Thank you.
Thank you, doctor. Next, I invite Dr. Praji for the paper presentation.
Hello, sir.
Hello, doctor.
Am I audible, sir?
Audible, doctor. Please share the screen, doctor.
Sir, can you please share my PPT?
Okay, doctor. 1 minute. Doctor, please start the session, doctor.
Good evening, everyone. My name is Dr. Prachi Keda Suryavanshi, PG Scholar 2nd year from SMBT Ayurved College and Hospital. Guide name Dr. Varsharani Nifade, ma'am. The topic of my presentation is Vata Rakta disease review. Next slide, sir. Introduction. The rapid modernization of India, fast food culture, stressful and speedy life prevalent in urban areas, spreading its wing in remote villages too. Nowadays, human beings are vulnerable to many disorders. Vata Rakta is one of the metabolic disease. Vata Rakta is described under the Vata Vyadhi Chikitsa and Sushrut, while Charak has emphasized it in a separate chapter for Vata Rakta after Vata Vyadhi Chikitsa. Next slide, sir. Vata Rakta is a disease explained in Ayurveda involving Vata dosha imbalance affecting Rakta Dhatu, where Vayu gets aggravated due to obstruction in the path of Vata, and on the other hand, Rakta, that is blood, get vitiated. Vata itself has a strongly spreading property, so that Vata spreads to all other body parts with vitiated blood, then finally gets lodged in the joints, especially in small joints. Therefore, in general, the disease Vata Rakta gives rise to the symptoms like pain, swelling, tenderness, stiffness, discoloration, and burning sensation. Vata Rakta can be even be correlated to gout on the basis of etiology. Common metabolic disorders of musculoskeletal system and characterized by severe pain, inflammation, tenderness, and burning sensation in the affected joints. Then synonyms of Vata Rakta. First one is Khudvat, Adhyavat, and Vata Ballasa. Next slide, sir. Types of Vata Rakta. First one is Vatadikya Yukta Vata Rakta, then second one Pittadikya Yukta Vata Rakta, Kafadikya Yukta Vata Rakta, and Raktadikya Yukta Vata Rakta. Then Vata Rakta has two avastha. First one is Uttan and second one is Gambhir. Next slide, sir. Hetus of Vata Rakta. Lavan, Amla, Katu, Snigdha, food take. Then one Kulitha, Udid, then Dadhi Kanji 7, Asavarishta, Viruddhashan, Adyashan, Krodh, Divaswap. Then next is Samprapti of Vata Rakta. Vayu Vivrudha Vruddhena Raktena Varitah Pathi Krusna Sandushayat Raktam Tadneyam Vata Shonitam. Then Purva Rupas of Vata Rakta. Sandhi Shaithilya, Alasya, Angasad, Tod, Bhed, Gavrav, Kandu, Sandhi Vedana. Next slide, sir. Samanya Lakshan of Vata Rakta. In Uttan Vata Rakta, we can see Kandu, Daha, Ruja, Tod, Spuran, Ayas, Tvaka Vaivarnya. Then in Gambhir Vata Rakta, we can see the symptoms like shot, kaठिन्य, वेदनाधिक्य, दाह, तोद, spuran, bhed, pak, and the चिकित्सा of वातरक्त is वीरेच स्नेह इत्वादौ स्नेहयुक्तै विरेचनै वृक्षैर्वा मृदुभिषस्तं सकृद बस्ति कर्म च सेकाभ्यंग प्रदेहान्न प्रायो स्नेह विदाहिन वातरक्ते प्रशस्यन्ते चरक चिकित्सा 29/41. Thank you.
Thank you, doctor.
Thank you, doctor.
Next, I invite Dr. Vaneshri for the paper presentation.
Sir, I am audible.
Yes, doctor, audible, doctor.
Wait. Sir, you please share my slides, sir.
Okay, doctor, 1 minute, doctor. Doctor, please chat, doctor. Hello,
Hello.
doctor. Please chat, doctor.
Sir, wait, sir. Myself, Dr. Vaneshri. First year PG scholar, Department of Shalyatantra, Government Ayurveda College, Bangalore. My topic is a literary review of Vimlapana Karma, guided by Dr. Shilpa PN ma'am, Department of Shalyatantra. Introduction. Vimlapana is the upakrama of advocated by Shushruta Acharya in the management of Runa, as it can be conducted with different techniques. Hello. Hello.
Yes, doctor, you are audible.
Okay, sorry, ma'am. As it can be conducted with different technique. Example, help of the tip of the index finger or thumb, and also with the help of green stick by applying gentle massage over the site of shop. That may work by dispersing the accumulated dosha in the corresponding shrotas so that the shrotosanga may be released and pathology may break. Vimlapana is described for both Ama and Pakva Avastha of Shopa, which means it includes the both Nija and Agantuja type of Bruna. Whereas in Nija type of doshas are involved initially, and in Agantuja types, doshas are involved in later on. In reference of Shopa, Saptopakrama is advocated from the first to last stage. Vimlapana is told in Ama Shopa condition, and Vaikrutapama can be done when the wound undergoes the Pakva Avastha. Since Vimlapana Karma is explained for inflammatory swelling as a first line of management, an attempt is made to see the effect of Vimlapana Karma in wound healing. Vimlapana Karma is nothing but manipulating over the Runa Shopa by doing a gentle massage with the help of fingers and thumb or shalakas. In Vimlapana Karma, by using Jatyadi Taila and gentle massage by the surgeon, there will be a rise of local temperature, by which there will be a vasoconstriction which might be relieved, and there will be a necessary nutrients, oxygen supply, etc. are carried out over the site of Runa. Thereby, it improves the condition of the Runa. Classical review. In Sushruta Samhita, Sutrasthana, Dallana Tika, in 17th chapter, Ama Pakvashi Adhyaya, we get the reference of Vimlapana Karma in the context of Saptopakrama as a first line of treatment for Runa Sota. Like Adav Vimlapanam Kurya, Dvitiya Avasochanam, Tritiyo Upanaham tu Chaturte Patane Kriyam, Panchamam Shodhanam Kurya, Shashte Ropanam Mishati, Ete Krama Vrunasyokta Saptama Vaikrutapaham. As Acharya Shushruta mentioned Vimlapana Karma under the heading of Saptaprakrama, even also in the Shashti Upakrama. like tasya runasya shashti upakrama bhavanti tadata apatarpanam alepa parisheka abhinga svedo vimalapana upanaha etc. Indication of vimlapana stiranam rujatam mandakaryam vimlapanam bhavet abhajjam swedayitva tu venunadyam tatshanaihi vimardeet bishak pradnastalena angushtreena va. In Ashtanga Sangraha, whereas Acharya Vagbhata explained to Vimlapana karma as a procedure indicated for sthira associated with mandaruja can be treated by oilation or sudation therapy, in which the surgeon should carry out a gentle local massage with bamboo reeds or by palm or by thumb or finger. In Baisajya Ratnavali explains Vimlapana karma is in 7th chapter, that is Runashota Adhikara, under the context of Katina Shota Kriya Karma, wherein he explains it is the procedure for Manda Vedana Yukta, Stira or Katina Shota, where it should be first oilated like Abhyanga or Bias Vedana by using Vatahara Taila. And thereafter, Svedana Karma is to be carried out with the help of bamboo reeds or by the tip of the thumb or fingers by applying slowly Mardana, which can be carried out in circular fashion. It's also an explained in Gada Nigraha, like Vimlapan explained a procedure like kneading with the bamboo reeds or stones or shalaka for Katina Runashopa, where Vimlapana refers to for Pralepa, Parisheka, Abhingadi Karma, which does the Baya Shodhana of the Runashota. Vimlapana Karma also refers to Mrudvikarana or Shuddhikarana. Yogaratnakara Acharya Yogaratnaka also opinions same like Shushruta Acharya and explains this same as a procedure practiced in Katina Runashota. According to Acharya Dallana, the Vimlapana karma is indicated for sthira, associated with mandaruja. Having given oilation and sudation therapy, a surgeon should carry out a gentle local massage with the bamboo reeds, the palm or the thumb. Other acharya also same opinions come from various acharya, recent authors, the procedure of Runashota, Vatata Shota, Katina Runa and Runashota, etc. Procedure. Vimlapana karma is a procedure which is done in Runa Chikitsa told by Acharya as for the Runaropana purpose. This is done in the rhythmic circular rotation passion which are made around the wound initially, slowly and later with applying pressure so that the surrounding area becomes warm by increase in the local temperature by friction with the tip of the fingers. Vimlapana procedure can carried out or brought by using Jatyadi Taila by applying continuous friction of the Runa and the surrounding skin. Acharya Dallan has commented Vimlapana as Shopo Vilayanam Angulyat Mardet, throws a light on the purpose of the procedure of Vimlapana. In Dishtaruna, delayed wound healing because of many metabolic systemic local factors where is seen as a Vimlapana is the first line of treatment. In inflammatory swelling told by Acharya Dallana, it is working principle. It is working helps to resolve the pain and improves the antitoxic condition of the wound. Hypothesis of the practice of Vimlapana karma in Dishtarana says that is removes the local vasoconstriction, thereby aiding the micro or macro circulation of the wound site. Importance of Vimlapana: reduction in pain by removing the local toxins, improves the micro and macro circulation, improves the anoxic state of the tissues. Prevention of the tissue destruction by improving the circulation. Most of all Vimlapana karma may contribute to debridement of the slump, hence the paving way for development of healthy granulation tissue and helps in quicker healing of Runa is lesser span of time. Conclusion. Vimlapana karma explained by the many acharyas in our classics. It's mainly explained in Runashopa and also we can use in the treatment of Dushtaruna. It one most easy and cost-effective line of treatment. Without causing any other problem or any other issues, Runa can be healed or treated easily. As healing of the Runa is slow process, but using the Vimlapana karma future, it helps to heal the Runa a little bit fast. Similar so that the catalyst which helps to increase the any of the process is fast. Thank you.
Thank you,
Thank you,
doctor.
doctor. So next I invite Dr. Geetanjali Ramesh.
Yes, ma'am. Sir,
You're audible, doctor.
1 minute. Can I start?
Sure, doctor.
Good evening, everyone. Myself, Dr. Gitanjali Takole, second year PG scholar, Rashasastra and Bhaishajya Kalpana Department from Sumatibai Shah Ayurved Mahavidyalaya, Hadapsar. My topic is Ancient and Modern Parameters for Standardization of Bhasma, guided by Professor Vaidya Kalyani Jadhav ma'am. Bhasma means metals and minerals are treated with herbal juices or decoction and make them into pellets exposed to certain quantum of heat as per Putta. Putta means Agni Praman. Bhasma preparation and bhasmas are the best example of nanotechnology and nanomedicine practiced during ancient period. Standardization. Standardization is a measurement of ensuring a quality and is used to describe all measures which are taken during the manufacturing processes and quality control leading to reproducible quality. To check the purity, safety, efficacy, and potency, standardization is necessary. First, we can see Asian parameters. First, Bhasma Pariksha. Bhasma Parikshas have to be carried out during the Putta procedure to ascertain the proper preparation of Bhasma. After passing all Bhasma Parikshas, the prepared Bhasma can be used safely for consumption. In the Rasagranthas, Bhasma Parikshas have been described such as Rekha Purnatva, Varitaratva, Unnama, Apunarbhavatva, Niruttatva, Nishchandratva, Amlatva, etc. And some specific parikshas are also described for specific dhatu. For example, Amla Pariksha for Tamra Bhasma, Nishchandratva Abhrag Bhasma, Avami Pariksha for Tamra and Suvarna Makshik Dhatu. Second point is Dhatu Bhasma and Varna. For example, Suvarna Dhatu, the color of Suvarna Bhasma is Champak Varni, that is brick red in color. Rajata Dhatu, Krishna, that is black in color. Vanga Dhatu, Shubhra Varni, etc. Third point is Dhatu and Dhatu Jwala Varna. Suvarna Dhatu, Pita Varniya Jwala, Rajata, Shweta Varniya Jwala, Tamra, Neela Varniya Jwala, etc. Then we can see modern parameters. Modern parameters can be divided into 4 ways: organoleptic evaluation, physical evaluation, chemical evaluation, and instrumental evaluation. First, organoleptic evaluation, that is Panchabhautik Parikshan, Shabda, Sparsha, Rupa, Rasa, Gandha. In case of Bhasma, taste, touch, odor, and color. Generally, well prepared Bhasma are tasteless and no odor, and in touch, Bhasma will be soft and smooth. The color of different Bhasmas is specific. Second is physical evaluation. In these, various analytical tests are carried out. First, loss on drying. It is used to measure the amount of water and volatile matter in bhasma. Ash value. It is used to determine the quality and purity of bhasma. And specific gravity, solubility, pH. These tests are also performed. Third one is the chemical evaluation. In chemical evaluation, quantitative analysis and qualitative analysis. In quantitative analysis, acid insoluble ash, which indicates the amount of silica present in sample. Gravimetric analysis is used to determine atomic mass, and volumetric analysis is used to determine the concentration of analyte. Second is qualitative analysis. In qualitative analysis, NPST, that is Namburi phase spot test, is performed, and this test is used to identify the purity and quality of bhasma. And fourth point is instrumental analysis. It can be divided into analysis through 4 ways: spectroscopy at atomic level and molecular level. At atomic level, atomic absorption spectroscopy, atomic emission spectroscopy, plasma emission spectroscopy, and at molecular level, FTIR, that is Fourier transform infrared spectroscopy, FT Raman spectroscopy, etc. These instruments are techniques are used, and these instruments are used for the qualitative and quantitative determination and also determination of metals at trace level. Second is X-ray techniques, X-ray fluorescence spectroscopy, which is used for determination of elemental composition. XRD means X-ray diffractometry, which is used for the identification of crystalline material, and X-ray photoemission spectroscopy is used for the surface analysis. Then microscopy. In microscopy, scanning electron microscopy, which is used for the particle size determination. Transmission electron microscopy, scanning probe microscopy, which is used for the surface studies of the nanoscale range. And last one is the thermal energy. This method detects changes in the physical and chemical properties of the given substance by application of heat on thermal energy. These are the parameters which are used for the standardization of bhasma. Thank you, sir. Hello.
Thank you, doctor.
Thank you.
Next, I invite Dr. Manoj Srihari Rao for the paper presentation. Dr. Manoj, are you there?
Yes, sir.
Okay, doctor.
Yeah.
Your screen is visible, doctor. Please start.
Okay. Okay, sir.
The title of my paper presentation is Randomized Control Study to Evaluate the Efficacy of Swadhanshradithail Abhyanga in Pain Management of Janusandhigat Vat vis-a-vis knee osteoarthritis under the guidance of Dr. Anil Wagh in SMBT Ayurved College, Nashik. संधिगत वात हंति संधिगतः संधिं शूलाटोप करोति च वातपूर्ण द्रुतिस्पर्शः शोथ संधिगते अनिले. This is the classical reference of संधिगत वात. It is correlated with osteoarthritis. Osteoarthritis of knee is one of the leading cause of disability among non-institutionalized adults. A community-based cross-sectional study across 5 cities in India conducted in big cities, small city and town and villages reported prevalence of knee osteoarthritis around 28.7% in 2016. Abhyanga, that is Ayurvedic massage, is with various oil, is comparatively simple, easily accessible, and external pharmacological intervention. It is used by patients with pain in joints and muscular pain frequently even at home. But very few research studies have attempted to quantify the efficacy of simple individual therapeutic approaches like Abhyanga on specific outcome like pain relief in specific Vat Vyadhi like Janusandhigat Vat. So this study is designed to evaluate the efficacy of Abhyanga in pain relief by 2 different oils in patients suffering from Janusandhigat Vat vis-a-vis knee osteoarthritis. The objective of study is to evaluate the efficacy of Abhyanga for 7 days with Swadhanshradithail in relieving pain due to Janusandhigat Vat, and this is assessed by comparison of VAS score at baseline at 7 day and at 14 day of visit. The also to evaluate the Abhyanga for 7 days on functional disability of patients suffering from Janusandhigat Vat, and that is assessed by comparison of WOMAC scale at baseline 7 day and 14 day. The study is a prospective interventional parallel arm randomized control clinical trial, and the study setting is OPD and IPD from Department of Panchakarma. The drug which is used is Swadhanshradithail. Swadhanshra स्वरसप्रस्थौ दौ समापयसा सह षट्फलं शृंगवेरस्य गुडस्य अष्टफलं तथा तैलप्रस्थं विपक्वं तैहि दद्यात् सर्व अनिलार्तेषु. This is a reference from Charak Samhita Chikitsasan 28 Adhyay. It consists of 5 main drugs: til taila, kshira, swadhanshra, gud, and adrak kalka. The mode of administration: Abhyanga will be done by applying bearable warm, that is Sukhoshna oil, Swadhanshradithail in trial group and til tail in control group at the affected knee joint, and then lightly massaging the joint in circular direction clockwise and then anti-clockwise for at least 5 minutes once daily for 7 days. Dosage: oil for external application, and approximately 5 ml oil is used. Duration for 7 days. Thank you.
Thank you, Dr. Manoj. Today's presentations seems to be over. I would like to invite Dr. Aishwarya Aras to conclude the session. Dr. Aishwarya? Okay.
So it's an official wind up to the Rukshitha paper and poster presentation. And before winding up, I'm particularly grateful to our panels to be there throughout the presentation. And I cannot fail to appreciate the presence and active participation of our participants. So we'll see you soon on the platform of national seminar.